To this live GFN TV broadcast, which is being beamed around the Global Forum on Nicotine here in Warsaw, and indeed online around the world. I'm Will Godfrey, the founding editor of Filter, and I'm so glad to be joined today by two people whose contributions in this field I've long been aware of, but with whom I've not previously had the chance for an extended conversation. One of them is Dr. Jasjit Ahluwalia, who is a physician and public health scientist of great distinction at Brown University in the United States. His specializations include nicotine, smoking cessation, and the associated racial health disparities. He's published so many papers that I wonder if he ever takes a weekend. Welcome, Jazz.
Thank you very much. Delightful to be here.
And alongside Jazz is Nancy Lucas, who is a leading international tobacco harm reduction advocate. Her long track record includes organizing with vapers in New Zealand to ensure regulated access to vapes and heated tobacco products. And she's the founder and leader of CAFRA, which is a regional organization advocating for tobacco harm reduction across Asia Pacific and beyond. Delighted to have you with us,
Thank you for having me.
So yeah, we'll get started. I mean, even though the conference is still young, there have been side events going on. There have been many conversations, and no doubt, Nancy, you're still struggling a little bit with the jet lag, having arrived from New Zealand. But just interested in any sort of early thoughts and observations from what you've been hearing from folks here in Warsaw.
Well, I mean, the main thing that has impressed me is Latin America. It's good. It makes me happy to see all the people from Latin America are here. They're engaging. You know, the main highlight for me so far was Roberto's oration yesterday. That was great.
It was fantastic.
It was
wasn't it?
fabulous. Spot on, dead on, given with humor. Roberto being Roberto. I mean,
it made me feel as if I could understand science.
Yes, yes. So I'm very impressed with that. And like I said, I'm really happy to see so many people from Latin America here. So that's my take on it. Great.
And Jazz, you've been here a day or two longer than Nancy. I know you've been throwing yourself into various events and conversations. Any sort of takeaways or standouts for you so far?
Well, yeah, no, I think Nancy's right to have so many people from, I was told this morning, there are people from 80 countries at this meeting. You know, that's really fantastic. I mean, the combustible tobacco issue, you know, speaking as a physician, is not just a U.S. problem. Of course, everything we think is in the United States. That's why we call it the World Series for baseball, even though there's no world involved. You know, the bigger problems with combustible tobacco are really around the world in LMICs. And so to have countries represented at scientific meetings, advocacy meetings, it's critically important if we're going to make a difference, for sure. There's no question about it. This is my first time attending GFN.
Is it?
So yeah, so this is a new thing for me. You know, I tend to go to science meetings, tend to be asked to speak at science meetings, since that's sort of what I do. But I think in the end, if we're going to make some changes, especially with such a controversial topic, a difficult topic from a political standpoint, and you know, and from a legal standpoint, it's going to require quite a bit of advocacy, actually.
Well, certainly Nancy knows all about that. But yeah, I mean, one of the reasons this is always a standout event of the year for me is the sheer diversity in terms of both international representation, but also the diversity of perspectives. Like we've got academics, we've got advocates, consumers, scientists. It
that's
really is.
The beautiful thing, and that's why I'm so glad that you're here, because you know, working in the field, you see your patients, okay, but to see other people and other consumers from other countries and their experiences, and it will broaden the understanding from a consumer perspective, because that's one of the things in many of the LMIC countries is that the medical profession themselves, they're so disconnected from all of this because of whatever, okay? So it makes me happy to see you here and to see other scientists coming here, because it humanizes all of us.
Do you think that's a fair characterization of the medical profession, Jazz?
Yeah, I mean, you know, physicians, you know, they tend to obviously be higher income. They live in an ivory tower if they're in the academy. You know, I say it's a fake world that we often live in. It's just sort of this, you know, world that's not real. And people are real, and real things happen in the real world. I think physicians, unfortunately, are more judgmental than they should be, and we'd like them to be. I think sometimes they have trouble empathizing with those from different backgrounds, those with, I'm not stereotyping or generalizing, but those with, maybe substance use issues related, let's say opioids, heroines, and things like that. Ironically, they have more empathy for people with sort of, so-called serious substance use issues. And they tend to have limited empathy, maybe more for smokers a bit, but very little for people who use recreational nicotine. I think it's just the atmosphere in the United States. The question is there a role for recreational nicotine? And I think generally the federal government, the FDA, the CDC, sort of is really sending a pretty strong message of resounding no, which is interesting as they legalize cannabis. I just find it absolutely
Yeah, I don't
fascinating.
understand that because it's the same in Thailand. Cannabis is legal. It's not regulated, but vaping is verboten. And it's happening in a lot of countries along the way. Now, I want to ask you a question. Sorry, Will. I want to ask you a question as a physician. What is the general, I don't know if this is a generalization and it won't apply to everybody, but what is the general mindset in the medical community about the use of cannabis?
So, without again generalizing, but I have to generalize the answer, is that, youth in the United States, maybe globally in Western Europe, believe that cannabis is perfectly safe. I mean, when you decriminalize, but then when you go further to legalize a product, you're sending a strong message that, almost to some extent, that the government has sort of blessed the product, that it's safe. And so, in general, the feeling about cannabis amongst people, probably physicians too as well, is that it's fine to use, it's safe to use. And ironically, the feeling about, let's say, e-cigarettes or vaping is that it's not fine to use for a variety of reasons,
yeah.
whatever they may be, and that it's very dangerous, which I think is not an accurate statement. I mean, no one says it's safe. The manufacturers of e-cigarettes don't say it's safe. But to say it's very dangerous, I mean, the perceptions, as you know, as well as I do, that 80% of U.S. physicians think nicotine causes cancer. That's unbelievable.
I was going to bring that up.
Mind-blowing,
Or
yeah.
cause COPD, or cause heart disease, and I'm stunned by that. And then 70% of Americans think e-cigarettes are as dangerous or more dangerous than cigarettes. And unfortunately, the United States government is complicit in that misinformation. The media is complicit, the government's complicit, and it's really tragic.
It's
It is. It's
absolutely
very much so.
scandalous, isn't it? I'm very glad that you're a member of the 20% of physicians
Yes.
who do not believe that. But bringing it back here now, you're obviously, the listening that we do here is so important, the dialogues are so important, but you're also both here to proactively engage in events and impart certain messages. And I would like to ask you, what are some of the key things that you're looking to get across during these days?
My number one message is to the advocates, and it usually revolves, jet lag, usually revolves around, it can be very hard to do what we do. It's very hard to be an advocate and sit there and constantly be fighting these people. And my main message is there's always somebody there to pick up your slack. A lot of people are isolated. They live in different countries. Some people are, a single advocate in a country by themselves. I mean, we are a community. And the beautiful thing about GFN is that community is now everywhere because now we're online. Hi, everybody. And also when you're here. And that's what we're here to do, is we are here to engage with one another. We're here to learn from each other, and we're here to support each other. And that's why I'm here.
There's a board that we just walked past on the way here in the corner there, which I had to stop and look at because it's got kind of the logos of
the
I think several dozen international
Yeah.
tobacco harm reduction advocacy organisations from all over the world,
Yeah.
and I kind of my jaw dropped a little bit. I didn't realise
You
there were
didn't
quite so
realise.
many, and that they're all connected, and there is just an incredible network now, which perhaps didn't exist a decade ago.
No, it did not. Absolutely did not exist a decade ago. I was talking to Harry Shapiro this morning, and I said, it's funny because my first GFN was in 2016. And I look at what it was like in 2016, and I look at like what it is now, and I'm like, wow, it's exploded. And in a good way. in a good way. I mean, never would have imagined that we'd have people from Latin America. I never would have imagined there would be people from Africa. This is a good thing, you know, and this shows me, even though the battle is hard, that we're winning, we're gaining ground. The more people that are out there advocating, the more people that are out there educating, the more people that are out there supporting each other, we'll get there. It's just not going to happen tomorrow. It might be another 10 years. Hopefully not, but that's what I see, and that heartens me, because I remember being, you know, 3 of us in New Zealand out in the middle of the South Pacific trying to do this, and now somebody will come up to me from, like, say, Malawi or from Uganda, and I'm like, okay, yeah, been there, done that, here, let me help you, because I think that's the goal, is to help each other along.
Yes, there was an extraordinary graphic that came up during the session yesterday evening, just showing the sort of exponential increase in the millions and millions of people using safer nicotine products around the world. Obviously, we would like that to increase further while smoking declines. Jazz, how would we look to accelerate that from your perspective?
Well, you know, I think it's hard, I would say. And colleagues of mine who work in other substance use fields like alcohol and other things, you know, remind me, they say, Jazz, you just don't remember about alcohol, that you know, it was a marathon, not a sprint, that we have to work 20, 30 years. Because as you may or may not know, Alcoholics Anonymous was always about abstinence. And it was always about quitting alcohol. And in the field of alcohol research, you know, this is sort of like a research issue, for studies generally to show an outcome of success in the alcohol field, it's often not abstinence, it's drinks per day.
Yeah.
Now, it turns out we've now discovered that even one alcohol drink, this may disappoint you, is actually dangerous. And the evidence about red wine is almost completely gone with regards to cardiovascular benefit. So alcohol, unfortunately, is dangerous at all levels. Alcohol is a toxic.
That is disputed by some in the field, is it not?
People can dispute lots of things.
Yes.
I've been very comfortable with people disputing things, but science speaks for itself. I mean, this is not my work. This is other people's work, and that's a consensus. I mean, people will dispute things with agendas, conflicts of interest, or just to sort of justify what they do. So I have no trouble with people saying whatever they want, because it's quite common. Cigarettes are interesting because in the world of research and smoking, it's all about abstinence. Now, there has become more flexibility about cigarettes per day. It's a little concerning to me because it turns out it's very curvilinear. 10 cigarettes is not half as dangerous or half safer than 20 cigarettes.
Right.
It's very curvilinear. I've done a lot of work with actually light smokers, that is, people who smoke sort of less than 10 cigarettes a day, and the carcinogen levels of NNAL, you heard about that yesterday, is quite high, actually.
Yes.
Just to actually give you an example, we did a study years ago in Minnesota where we measured babies' urine. Babies that were less than 5 years old, so often they were actually 1 or 2, and we collected their urine. It turns out you can collect it from diapers and squeeze the urine out of it somehow. It's really quite
What a
fascinating.
great job for somebody to have.
Yeah, we have students and researchers who do that.
That's what they do,
Yeah, that's what we do. And we measured, the criteria to be in the study was there had to be a parent who smoked in the house and exposed the child to smoke. Of the 70 babies' urine, 69 of the 70 had high levels of the most potent carcinogen in the world, which is NNAL, which is a breakdown of NNN. This is a highly carcinogenic product. And so, you know, that's quite scary, of course, I think. You know, so I like to let science inform policy, whatever the science is. So I think at meetings like this, people enjoy having, oh, good, and you know, there are only about 3 academics at this meeting, I think, about maybe 5 or so, a very small number. And so sometimes they like hearing what I say, and sometimes they don't like hearing what I say, you know, which I'm comfortable with. But I think sort of radical thought on either side, you know, anti this or pro this, is not good. It's not good for anything, whether we talk about abortion, or we talk about this, or talk about that, you know, sort of sensible talk. And, you know, misrepresenting science on either side is just not a good thing to do.
Yes. You touched on abstinence, and that's sort of an interesting, as somebody who, not from the States, but who now lives there, both of you no longer live there, but it does seem to me a particularly characteristic of US culture to have this desire for, I mean, we think back, obviously the formation of AA, but also alcohol prohibition, also drug prohibition and the so-called war on drugs that's been exported around the world. And now almost the sort of the nicotine attitude that we're seeing is perhaps an extension of that in the United
American
States.
culture, yeah, it's very black and white. And it's very, you're either with us or against us. It's always been that way. It's still that way. It's gotten worse, I think. I don't live there anymore, but from what I can see from looking in, it's gotten worse. A lot of black and white. They don't want to deal with the shades of gray. Absolutely.
Yeah, there's a lot of, you're absolutely right. There's polarization in every topic. It sort of scares me a bit, you know, transgender issues have become very hot, polarizing sort of culture. And it's not healthy at all. It's funny about the black and white and gray. I start off my classes, I teach, not too much, I do more research, but I teach 1 or 2 classes. I teach a graduate class on tobacco actually for the last number of years. And I start off my class with a cartoon. I think there's a special name for it. It's from the late 1800s by an Austrian sketch artist. And when you look at it a certain way, you may have seen it, it looks like a duck. If you look at it again,
yes,
it looks
I've
like
seen
a
that.
rabbit.
Yes, yes, yes.
Well, I love showing that to students, and then I asked, first I asked them to vote on what they think. It's usually 50-50, and then I asked them to say, why am I showing you this? And some of them sort of get it. And I said, we all have different perceptions of the same thing. And that we go into war about, you know, your side versus the other side, but it's about perceptions. And I actually told one of our KAC scholars, I think they're called at this meeting.
Yes.
She's from Armenia, and she's a medical student. She's
I
actually a
spoke with
medical
her myself,
student.
yes.
Yeah.
Yeah.
And she's very bright. And I said to her, we were talking about something, and I don't know how it came up, but I said exactly this. I said, you know, you guys are young, it's great, you're idealist, and you should be, it's good. But the world will knock sense into you a little bit.
Yes.
And unfortunately, the reality. And I said, the world is not black and white, it's
No,
gray.
it's not.
It's actually gray on everything.
Yes.
And when you realize that, then you work on things. And I think of the United States, it's a very odd puritanical. Right?
Yes,
the word
that's
you
exactly
use,
the
right?
word,
It's
yeah.
the word- I love that word because it's funny. We'll have, you know, sex on TV, we'll have
Yes.
sex, we'll do this, but you can't talk about condoms. You can't advertise condoms. There are all these rules about
Yeah.
what you can't do. And then we get very puritanical, very judgmental about things. And it's just sort of, you know, sort of bizarre, actually.
It's the
in some
cognitive dissonance of it.
ways. Right. Yeah.
Yeah, for sure.
Something you were saying there reminded me of one of the graphics that Roberto Sussman showed in his of the kind of you know, high THR knowledge, low cynical idealist.
Yeah.
And I mean, I think that that Jazz made very good points about avoiding dogma. Even those of us who
Oh,
are
yeah,
obviously
absolutely.
on the right side of this. But I mean, how would you
On the right side of this, you caught that, right? You've
how
been
would
in the
you
States
how would
too
you
long.
characterize then, Nancy, opponents of tobacco harm reduction? Do you concede their sincerity in some cases in wishing to protect public health?
Okay. I get angry when people call the other side ants because I think that's derogatory. And what I try to tell people is, listen, we're fighting the same battle, it's just the perception and the perspective of it is different, okay? For example, you know, I'm a consumer advocate for THR because, you know, I lost my mom to smoking-related disease, okay? I don't want anybody else to go through that, okay? That doesn't mean that the person on the other side of the table hasn't experienced the exact same thing, and that is their motivation for doing what they do, okay? So I say to younger advocates or newer advocates, listen, you know, get the aggro out of the way. Find the common ground, okay? And that involves even when you're going to talk to a government official or a public health person or your GP, find the common ground because your humanity is something that you share with people on the other side of the fence. Connect that way and then go forward. You can understand why somebody is doing something, but that doesn't mean that you condone what they're doing or the way they're doing it. But you need to understand why they're doing what they're doing because that humanizes it.
Yes.
You know, so that's how I approach things, and that's how most of us in Asia Pacific, that's how we approach things when we're dealing with others and with ourselves.
Yes.
That level of respect. And I think that lack of respect puts people into these categories and into these boxes of good, bad, right, wrong. It's not about that. It's about where are we going and how are we going to get there and what's the best way to get there so that we're as inclusive as possible of all people.
Yes, yes. And speaking of how to get there and touching on the sort of abstinence thing again, I wanted to ask you both how you feel about smoking bans as a means of attempting to transition people to safer alternatives. We can see lots of iteration. I mean, obviously in New Zealand, there's a kind of an incremental step-by-step move towards banning smoking sales. In the United States, the FDA is proposing to ban menthols, which obviously would particularly impact the African American community, which is very central to your work. And at Filter, we recently published an article about a big increase in uptake of vaping in UK prison system. However, that's come alongside a smoking ban, which has created illicit tobacco markets inside prisons with associated deaths, violence, and so on. So, in the United States, we've seen organizations like the ACLU, Drug Policy Alliance, come out against the menthols ban because of the anticipation of increased criminalization of communities that are already bearing the brunt of drug-related and other criminalization. So maybe it's a bit of a controversial one for this time in the morning, but I'm just interested in your thoughts about smoking bans and in those different contexts and whether or not they can be justified.
No. Simply, no.
Yeah, yeah.
Okay, I think if you tell somebody, and maybe it's just me being a rebel, highly likely, if you tell me I can't do something, that's the one thing I'm going to want to do. Okay? It's not compassionate. It's not empathetic. People have a right to make a choice. Their choice should not impact other people, but they should have the right to make a choice. I don't think any government official or has the right to decide for me what I'm going to do with my body. And I'm going to hand that one over to the doc here because there's all those issues in the States more than anywhere.
Yeah, no, I mean, I agree with Nancy. I think, humans are empowered to make choices as adults, right? As adults. My wife's a pediatrician, so I always have to remember the kids. But, I think bans don't work. We know prohibition didn't work. So in terms of the United States, they're not really proposing a smoking ban. They're subsets, right? They're sort of banning menthol. They're not banning smoking. They're banning the menthol of smoking, so to speak, right? And so it's a tricky one for me because, as you know, I work on the topic of African Americans for the last 30 years and have done the most work in that space than anyone in the U.S. And African Americans have greater morbidity and mortality from almost everything related to smoking. And the menthol was a marketing tactic of the tobacco industry. I mean, I think they admit that. They have no trouble sort of saying that. Of course, the industry, especially ones that have a high percentage of sales in the U.S. from menthol cigarettes, and one company has 50% of the revenue from menthol products. So they will file suit immediately, before you wake up in the morning. And it'll drag on for years. So I have mixed feelings about the banning of menthol. I think the criminal activity that would occur after it was banned is exaggerated. I mean, that's a drama statement. I mean, would those things happen, like, I forgot the name of the murder of the African American who was selling Lucy's on the street, and you saw that.
Eric Garner.
Yeah, Eric Garner and things like that. Do those things happen? Yeah, I mean, that happened before there was a ban, so it happened. Will it happen more if there's a ban? Probably not. The industry is very innovative. You saw what Reynolds did is that when there was a ban in California, as you know there is for menthol, they developed a capsule thing or something that's in the cigarette that pops, and it gives you, it's not menthol, but it gives you a menthol type feeling. And then, sort of certain, nonprofits, who they are, criticize them saying, there goes big tobacco again, circumventing the law. They weren't, I'm obviously not a pro-tobacco industry person, for sure. People know that. But I am pro-choice within reason and things like that. But yet public health, the government has a responsibility to protect the health of the public, which does limit freedom to some extent. But they didn't circumvent that law. They just got innovative. And they created something that tastes like menthol, but it's not menthol. And so, they're accountable to shareholders. It's unfortunately, or is or not, or whatever, a legal product. They're accountable to shareholders. So they're not going to take it lying down. At risk is billions of dollars of shareholder value, not just the CEO's salary, but shareholder value. So I think the bottom line with regards to things like menthol and things like that is if you, like, for example, here's my idea if I was sort of whatever. I would do a phased-in ban of menthol cigarettes in the United States rapidly over 2 years, but immediately give PMTA, pre-market tobacco
Right.
authorization for menthol e-cigarettes, menthol nicotine pouches and things like that. This is not rocket science.
Well, that's what New Zealand's done.
Yeah,
you
yeah.
know?
So I mean, I think different countries have done different things. No country's done it right, so to speak. But some countries have had. It's hard for me to admit that the UK has handled this a little bit better than the United States.
But,
having been colonized by the British and India. So it's a sensitive topic for me. But they do it. They do it. They do it well.
Yes. Nancy spoke of common ground, and it sort of struck me there that the question of the menthols ban and bans on cigarettes in general, it does somewhat divide the THR community.
Yeah.
I hear different perspectives on it, but certainly I think common ground we can all have is that in the event of such products being restricted, but even if they're not,
Yeah.
the importance of approving safer nicotine versions of them is absolutely paramount.
Information. People need to be informed. They need to know what they're doing. I mean, when my mother and my father started smoking, they didn't know what it was, right? Okay. I mean, my mother's doctor told her to start smoking for her anxiety in the 50s. I mean, hello. Okay, she didn't know. Nowadays, obviously, we know better. Okay, but I think people should be given the information they need to have to make an informed choice. And the thing that scares me in the THR field is all the disinformation and misinformation in the media, like you said. Okay, all the effluent that is being put out there, and people believe what they're being told. How are they going to get the information? Well, sometimes they're not going to get that information because it doesn't serve certain people's corporate interests.
Yes.
The part that bothers me the most about the whole harm reduction field is the following. I'm curious to see what you think why it is. I have a theory. So you alluded earlier about like certain people don't believe in harm reduction or whatever. People tell me like, oh, I don't believe in harm reduction. I say, but actually you practiced it 3 times today already.
Yeah.
Everyone actually, whether I don't know what to believe in. It's not like a religion. It's like you do it. And you know what they are? Condoms, seatbelts, helmets, less of a Cheesecake Factory cheesecake, which is about 1,000 calories. You'll eat only like a portion of it. I don't eat a full dessert anymore. I share desserts. People share appetizers sometimes. They had appetizer each and share an entree. I know friends who do that, not to gain weight. I mean, we're practicing a harm reduction. I'm fascinated in Poland. No, everyone obeys the law. They like stand at a crosswalk, and there's no cars. And I'm looking at it, Type A New York personality. I'm like, I got to cross, but I try to follow the Polish people.
Yes.
So that's the form of harm reduction. There's something about and the people who vehemently, let's say, are opposed to tobacco harm reduction. They're the strongest supporters of opioid harm reduction. Good example, Bill Gates.
Yes, exactly.
So I find it very interesting and sad in a way. And I have a theory as to why. I would be curious to see any comments either of you have about that, because that's, I think, actually at the crux of the issue.
Yes.
So you've got people accepting harm reduction, even sort of maybe right-wing, whatever the expression is, so on and so forth, who might oppose like safe injection zones or medically supervised safe injection zones.
There is certainly an exceptionalism applied
Absolutely.
to tobacco.
Yes.
We could have a whole long discussion about that, but we are just now coming towards the end of our segment. But I did promise finally to ask you about thoughts for the next decade and sort of key questions and priorities. We only have about 1 minute left, but if you were to name just one thing from your own particular sphere that is going to be critical in the decade ahead, what would it be?
The truth will prevail. It will prevail. I believe so.
Yeah.
Yeah, I agree. I end all my talks with science will inform policy, whether it comes out showing that people who are, quote, pro-harm reduction, sort of make up stuff, it'll show you're wrong, or the people who are anti or whatever. I think you're right. Truth will prevail, science will prevail. It's going to be a marathon, not a sprint. The answer to my question about harm reduction in this space is I think people and physicians, and especially Americans, hate the tobacco industry so much they forgot about the smoker.
Yep.
And that's the tragedy of it all.
That is.
Science will inform policy rather than policy informing science. That's the dream, isn't
That's
it?
it.
Thank you so much,
Thank
Jazz
you.
and Nancy. It's been a pleasure speaking with you. We're about to hand over, very relevantly now, to a session on the politics of scientific
Excellent.
publishing. And I'm going to hand over to Harry Shapiro to introduce that in the main conference room.
Good morning, everybody. Thank you, Will, editor of the absolute must-read Filter magazine. Wonderful publication. I hope you are all suitably recovered from last night at the Sphinx. My name's Harry Shapiro. I'm the director of DrugWise, which is a UK NGO delivering drug information online, and I'm also the lead author of the Global State of Tobacco Harm Reduction. I can see people are still drifting in, but I'm not going to stop. I'm going to carry on. I've got two guests with me who will be coming up to the lectern shortly. I've got Sarah Cooney, who's a consultant in science communication, and also Nick Crofts, who is editor-in-chief of the Harm Reduction Journal. And you'll hear from both of those in a minute. Sarah's giving the keynote, and Nick is the responder. By way of introduction, in 2017, British politician Michael Gove declared that the British public were sick and tired of experts. We'd had enough of experts, and he was making a specific reference to the fact that the Bank of England economists had failed to predict the financial crash of 2007-2008. And they'd also predicted that in the immediate aftermath of Brexit, the UK economy would go over a cliff. I'm making no comment about that second prediction, given the state that we're in at the moment, but Michael Gove was determined that we're not having anything more to do with experts. And then along came COVID. And when COVID hit, the BBC and media outlets all over the world couldn't get enough of experts. They were falling over themselves to find every ologist that they could get in front of a microphone. Virologists, epidemiologists, psychologists, pharmacologists. We wanted to hear from these people. We wanted to know what this epidemic was all about, how it was going to affect us, how many people were going to die, how do we cure it, when's there going to be a vaccine? All these questions. We had experts in front of the British media every day giving their charts and predictions as to what was going to happen. There was scientific dispute about how all of this started, and there was genuine concern about the inequalities about access to vaccines. But the scientists were all pretty much on the same page. The race was on to find the vaccines and to find them quickly. And in the end, there were loud plaudits for the pharmaceutical companies for stepping up to the plate. But those plaudits were reserved for one, there was one company that didn't get these plaudits, and that was the Canadian company whose vaccine was refused to be endorsed by the WHO. Why? Because one of their shareholders was a tobacco company. Which, for me personally, that kind of symbolised for me how politics and ideology could trump even the most urgent global public health requirements. Because, as many of you will know only too well, within the world of tobacco control publishing, much science has been subsumed and subverted to the interests of politics and ideology. From scientists shut out from publishing at all, to the most ludicrous examples of bogus science, which has somehow passed muster into the pages of otherwise respectable academic journals. And it seems like the piranhas of public health are only too keen to rip the flesh of academic credibility off the bones of anybody who disputes the anti-tobacco harm reduction narrative. So, is there any good news here? Is there any positives here for those who want to kind of swim in the troubled waters of scientific publishing within the tobacco control world? Well, Sarah thinks there is some good news to be said, some hope and optimism. So I'm going to pass over to her now to explain. Thank you, Sarah.
Thanks very much, Harry, for that introduction. And I wanted to say it's a great honor to be speaking at GFN. So I wanted to also thank the organizing committee, Jerry, Paddy, Jagosh, and Jess for having this topic and also for inviting me to speak. Oh, I forgot about. Sorry. So here is my conflict of interest statement. And what I'm going to do is talk you through why it's important to publish. And because I know people in the audience may not know that much about publishing, I'm going to try and do a bit of a really fast publishing 101. Also talk about the barriers to publishing. There are some emerging trends in science publishing that I think it's important for you to be aware of. And I will take you through some kind of case studies and personal experiences that I've had. So a bit about me. I trained as a geneticist and I did my graduate work at the University of Toronto. I discovered that although I loved science, my interests were much broader than what you can do at the bench. So I decided to try science publishing, which a lot of scientists end up doing. In order to stay close to science, you go and work for journals. So with my freshly printed Irish passport, I moved from Canada to the UK to work at Current Biology Limited, which was a small publishing company set up by an entrepreneur who was looking to disrupt things. I worked for them for a while and then we were bought by Elsevier. After I left, I went to Nature Publishing Group, so I was working on one of the world's most prestigious journals, which was very exciting, but it's also fascinating to see some of the politics that went on behind the scenes at a very high-level editorial environment. The sorts of papers that didn't get accepted and that were fantastic, and then papers that did get accepted, and you thought, well, I don't understand why. And speaking to editors and learning sort of some of what was going on behind the scenes. Most importantly, at Nature, I met my husband, James. Some of you have met him as well. After Nature, I went to the Society of Chemical Industry, which is a small chemistry membership association. They have a small group of journals that they do in partnership with John Wiley and Sons. And after I left the SCI, I went to another startup. So an open access publisher, Biomed Central, started by the same innovator who set up Current Biology Limited. I was brought in to add to the senior team as that business was prepared for sale. It was then bought by Springer, and eventually Springer merged with Nature. So I worked in scholarly journals for over 10 years in a wide variety of editorial, product development roles where we were looking at launching new journals, and also publishing roles. And when I left BMC, I was looking to do something different. I wanted to do something different with my skills. And then a bit unexpectedly, I found myself in the tobacco industry, initially joining to help improve the impact of the material that was being published on reduced risk products. But then I got involved in other science communication activities. I oversaw the industry's first dedicated science website and also brought in other industry first initiatives, a biannual scientific report, and also the first visitor engagement program for the industry. After I left the industry, I set up a consultancy focused on science communication and engagement, including publication strategy. I'm working with a variety of other tobacco harm reduction experts. It's a bit of a family affair, so my husband did help with the slides, and my little dog, Fergus, is usually found at my feet during the day. Everybody in this room knows that the tobacco industry has been going through a massive transformation in the last 10 to 12 years, away from combustible cigarettes to reduced risk tobacco and nicotine products. There's now a wide range of different types of product categories. and an abundance of science that supports their reduced risk nature. So I would argue that a bigger challenge is actually communicating that science and communicating it effectively. So on to publishing. Why should you publish, and why are scientific articles important? So the research that you carry out is your scientific foundation, but you have to get it out there into the big bad world. I like to say that manuscripts in peer-reviewed journals are like the currency of scientific credibility. Peer review is a process by which other experts in the field review your material, critique it, improve it, so you know that there's an additional kind of quality and credibility stamp associated with a paper in a peer-reviewed journal. These papers can then be used to leverage other types of communication activities, which you can use to manage your reputation, and also can help in engaging with regulators. I think you all know that publishing in the literature creates transparency and openness and helps you build trust with stakeholders, a wide range of stakeholders. With regulatory dossiers, a lot of that material is kind of hidden in confidential submissions, and I would argue that, and I've heard from other people in the field, that they've been criticized by public health for not getting that material out into the public domain. And again, manuscripts in peer-reviewed journals are a great way of doing that. It also allows you to highlight the incredibly high-quality research that's being done by tobacco and nicotine companies on reduced-risk products. So what are peer-reviewed journals? Well, the sharing of science by manuscript format has been going on for thousands of years. It started in ancient Greece. The first modern peer-reviewed journal was launched in 1665 by the Royal Society in England. And if you fast forward to 2019, the STM publishing industry, that's scientific, technical, and medical journals, had grown to a value of $28 billion annually. At the time, there were 35,000 active English language journals, and around 12,000 of those were indexed to get an impact factor. An impact factor is a way of ranking journals with respect to each other, and it is a metric based on citations to the content in that journal. Impact factors vary wildly in publishing. So top-tier journals like Nature and Cell have impact factors of 40, 50, 60, and sort of journals in the polymers section of chemistry, a good journal might have an impact factor of 3 or 4. So it's a metric that is not brilliant, but it's the only metric that people have, and it's been hijacked by university departments and other stakeholders to sort of push people towards saying impact factor is the most important thing. It's not necessarily. Another sort of fun fact about the STM journals industry is that it was one of only 2 industries that successfully migrated from a print-dominated business to an electronic-dominated business while preserving the same high profit margins. And the other industry was the adult entertainment industry. So STM publishing is a very wealthy sector. It is composed of large commercial publishers, university presses, and learned societies that have some journals. So how do journals work? How does peer review work? Basically, an author will make a submission. All journals today have electronic manuscript handling systems. So you upload your files. The system then will run a series of pre-checks to make sure that you're not a crank, you haven't discovered, fusion in your basement. They make sure it's a real paper, that all the files are correct. Once those checks have been done, it will be assigned to an editor. The editor will then use keywords to identify scholars in the field who can look at your paper. He or she invites referees. The referees, it can often be hard to get referees to agree to look at papers. Good journals look to have at least 2 referee reports. We're starting to see emergence of lower quality journals that are relying on 1 referee report. But anyway, once your editor gets the 2 referee reports back, they read them and they evaluate them, and then they make a recommendation and they invite the authors to revise, or they reject, or they accept. It's very rare for a paper to be accepted on the first round with the journal, and most scientists agree that peer review tends to improve the quality of the manuscript. It's by no means perfect, but it's the best system that we have. Scientists and publishers have been talking about, is there a better way to peer review? And there isn't so far, but it can be a painful process, and it can take 6 to 12 months to get your paper published. This can be exacerbated by the difficulty of getting 2 people to agree to review the paper, getting them to return their referee reports on time. That is extremely painful. You can sometimes have wildly differing referee reports that can reflect bias, and then you often have to get a 3rd referee to sort of adjudicate. And you can go through multiple rounds of revision before you have acceptance. I would make one observation that most journals have very little expertise in tobacco and nicotine. And of course, with the problems with peer review, your manuscripts can get stuck all the time. But it's worth knowing that as authors, you can intervene, you can get in touch with the journal, and you can get your manuscript unstuck. But it can be difficult to work out who you should contact and what exactly you should say to them. It's also worth remembering that journals are typically dealing with hundreds or even thousands of manuscripts at one time. So if you feel your paper has kind of got lost in the shuffle, it probably has. In the paper-based days, I remember a manuscript fell down behind a filing cabinet and was lost for a couple of months. And when I was at Biomed Central, I used to have to deal with author complaints for manuscripts that had electronically fallen between the cracks, and I would discover that they'd attempted to invite 20 peer reviewers before they got 2, and they still didn't have 2 referee reports, and so things do get stuck. And I helped a client recently with a paper that was sort of languishing, reviewed the correspondence, identified what was going on, and we were able to get in touch with the journal, get it unstuck, and then get it published. So there are lots of problems with peer review. And another observation I'd make is that the science publishing industry is this massive industry built on the back of unpaid work by volunteers, the peer reviewers. And the peer review community is increasingly under more and more and more pressure. Journals are receiving more and more submissions all the time. So what journals are starting to do to try and cope with this and try and reduce the burden on their communities is to reject without review. And also you're starting to see transfer relationships between journals. And the best example of this is Nature, where Nature has a reject rate of 99%, but actually there's quite good stuff that's rejected by Nature. So it's cascaded with the referee reports down to the next tier, Nature Medicine, Nature Immunology, Nature Chemistry. And then if those don't quite make the bar there, they're cascaded to a journal called Nature Communications. And then at the bottom of the pyramid is Scientific Reports. But the key thing is that the referee reports travel with the manuscript, so they aren't lost. Otherwise, if a manuscript is rejected, all the work that those peer reviewers did is wasted. You also see journals experimenting with new types of peer review systems. Open peer review is more common. It's becoming more common. Biomed Central, all of their medical journals have open peer review where they publish the referee report and also the name of the referee. That can actually make it a lot harder to get people to agree to look at manuscripts because there's something about being anonymous that allows you to be not as polite as you would be. And you're also starting to see other types of journals. Post-publication peer review journals are also emerging. This is where you publish almost instantly, and then they seek peer reviewers. And what can tobacco and nicotine companies do? I would urge all of you to encourage your scientists to volunteer as peer reviewers. Industry is often underrepresented in peer review communities because industry scientists don't tend to publish as much as academics. Journals can be operated in different ways, and I think this is important because it can help in your detective work to figure out who you should be trying to contact to get your manuscript unstuck. They can be owned and managed completely by a commercial publisher with professional editorial staff. This is how Nature operates. The owner has total control and manages everything. You also get journals owned by commercial publishers with academic editors. So these are full-time professors appointed as part-time editors-in-chief, and they receive a small honorarium from the publisher. And then you get partnerships between learned societies and commercial publishers. So Oxford University Press is the commercial publishing partner for the Society for Research in Nicotine and Tobacco, and OUP publishes nicotine and tobacco research on behalf of the society. The society maintains editorial decision-making and also editorial policy, and the publisher does everything else. So there are lots of barriers to authors getting published. We've kind of been talking about them. big effort to get something written, get it through an approval process, deal with lawyers, find the right journal, submit, deal with referee comments. If rejected, revise, reformat, and start all over again. We see censorship. I'm going to talk more about that in a moment. But the industry can and does publish, even though it's not easy. The two largest tobacco companies have published over 350 peer-reviewed manuscripts on RRP science. This is in a wide range of journals, between 70 and 80 different journals owned by quite a big range of publishing houses. But it does feel like it's getting harder. Some useful journals have changed their policy on considering industry-funded work. Special issues have come under criticism, and a change in journal ownership can be really disastrous. So I'm thinking of Tobacco Regulatory Science, where the original publisher decided to sell, and he unfortunately sold to a predatory publisher, which I'm also going to talk about in a moment. But that meant that the journal basically is no longer fit for purpose. I wanted to take a closer look at censorship. So before I joined the industry, I did a project to examine censorship in journals against the tobacco industry. And my conclusion was that explicit censorship bans are found in journals owned by medical and public health charities that have a small publishing program, so 2, 3, 5, or 6 journals. These journals would be operated on a profit purpose, but the profit is donated back to the society. And what you see is that the editorial policy of those journals has become aligned with the parent learned society's views about the tobacco industry. My belief is that large commercial publishers are very unlikely to institute blanket bans. They're all on record as saying that science should be evaluated objectively on its merits through the peer review process. You do see some examples of journals owned by commercial publishers that have a censorship ban, and often this has arisen with the change in editor-in-chief. So regulatory science and regulatory toxicology and pharmacology used to be quite friendly to the tobacco industry, but when the previous editor-in-chief retired and they put 3 new co-editors-in-chief, they decided that the journal had published too much tobacco work and they would no longer do it. I also wanted to mention medical communications agencies. They also are unable to work with tobacco companies. They typically assist pharmaceutical and biotech companies with publication and other sorts of activities. But if they have respiratory drugs or if they have pharmaceutical clients, often it's written into their contracts that those agencies then can't work with the tobacco sector. Another thing is that, that actually, it sounds like an easy fix, but it wouldn't be, because they lack the specialist expertise that you need in order to sort of navigate things from a tobacco and nicotine perspective. The overall landscape of publishing is changing. So I talked about the size. It's a massive $28 billion a year industry. Traditional journals they're based on subscription, so publishers sell subscriptions to libraries. These journals have limited page budgets, so they can publish 120 articles a year. And success criteria is around impact factor. So this is about novelty and attracting citations to that content. And when submissions rise, like they are doing every year, year on year, the only thing these traditional journals can do is reject more as a way to cope. So open access emerged as a disruptive business model around 20 years ago due to the opportunities created by the internet. It was also influenced by a group of very high-profile academics who felt that it was wrong that work funded by governments was hidden behind subscription barriers and that publishers were charging to access this. The business model shifts revenues from library pays to author pays to lift subscription barrier. It was controversial at the time because this model accepts a lower profit margin than traditional publishing. I can tell you a funny story about that another time. I had a friend I used to sing with who was involved in the deal that created Springer Verlag. There was a venture capital funding to create Springer, and this friend of mine came up to me at a choir rehearsal and he said, I've read all the background documentation. Those profit margins are astonishing. That'll have to change. And so open access changes everything. Rather than the success criteria being about impact and novelty, it's financial. Each accepted manuscript attracts a fee. They are typically online-only journals, so there's no issue with page budgets. If a journal receives more, they can keep the same reject rate and accept more. And there's more experimenting with different types of journals. There's a journal called Scientific Data that is just data sets. You write a little bit of narrative around the data sets, and there are new peer review models emerging. Looking more closely at open access, this focus on sound science rather than novelty is really, really important for the tobacco and nicotine sector. And that's because regulatory research tends to be more applied in nature rather than really, really new and exciting. So the first article that looked at the aerosol of an e-cigarette, that was groundbreaking, and that did get published in a very high impact factor journal, one of the top toxicology journals. And that paper has now had 30,000 downloads and 200 citations. But the second and third and fourth and fifth chemistry papers like that, they're not got the same level of novelty. So you need journals that are focusing on sound science, and open access provides this because they're not looking to boost their impact factors. They're looking to publish as much sound science as possible. They're less influenced by moral judgments. You can be faster with open access journals than traditional journals if you prepare the ground in advance by improving the quality of your papers, preparing the submissions, making sure you suggest lots of different referees. And the most important thing is that credible open access journals are owned by commercial publishers, and they've invested a great deal in quality control and peer review, robust peer review. So you must beware of predatory journals. So the downside to open access business model is that the barrier to entry to becoming a publisher is now super low. If you have a computer, you can become a publisher. And that's what's happening. So predatory publishers, rather than having high quality peer review, they don't do any peer review. Or they might have a peer reviewer who knows nothing about this subject area. Instead, they're motivated solely by collecting a fee from the author. Journal titles sound familiar, so it's easy to be fooled. The International Journal of Scientific Reports is not actually the same as Scientific Reports. So organizations may need help to spot predatory journals and also predatory conferences, and the risk to publishing in these places is that it can undermine your very hard-won credibility. I wanted to talk briefly about research integrity. So research integrity is another way of saying good research practice. And the reason I'm bringing this up is that all major publishers now have research integrity functions, and they have teams of people that are looking to help safeguard the academic record. And they're dealing with things like paper mills, they're dealing with fraud, they're dealing with fraudulently made figures. And I think this is something that is important for the tobacco and nicotine sector, because the integrity of the research in this field is very, very high. So the UK Research Integrity Office defines research integrity as the conduct of research in ways that promotes trust and confidence in all aspects of the research process. The Singapore Statement, which came out of the first or second World Conference on Research Integrity, sets out 4 principles: honesty, accountability, professional courtesy, and good stewardship. And so I think this is worth bearing in mind when thinking about your strategy. Publication ethics is also very important, and what I wanted to say here is it's very important for everyone to openly and transparently declare their perceived conflicts of interest, because it will only come back to bite you if you don't do it. I'm going to take a moment to reflect on some of my own experiences. So I mentioned that I did join the tobacco industry. I was approached at first, and I was like, well, what is this? This was 2010. I didn't know that the tobacco industry did any science. I didn't know what tobacco harm reduction was. I grew up in Canada, which was very strong on tobacco control, and so I was like, I'm not sure. But I decided I'd go and meet some people and have a look at the research that was going on, and I was pleasantly surprised, really surprised, at the people I met, at the quality of the research, and how genuinely interesting it was. So I decided to join, and my first focus was around publishing strategy. I overhauled it. I introduced people to the idea of open access, and also improved the interaction between staff and journals, which started to improve the acceptance rate. And I would say that relationships are really, really important in publishing. And if you can find any way to build relationships or to meet people or to interact with people on journals, you should take it. If there's a Meet the Editor session at a conference, just go and make sure you introduce yourself. As part of this, I oversaw the strategy for at least 100 manuscripts on reduced risk products, and it's something that I was very proud of. So you can optimize your manuscript process. You can improve the quality of articles by introducing manuscript polishing services. You can get over the hurdle of reject without review if you're going to traditional journals by preparing the way and explaining why your manuscript is important. You can speed up peer review by being in touch with the journals constantly, and you can build relationships with journals. You have to proceed carefully when you're meeting people. Like everywhere, some people in publishing have very entrenched views about tobacco and the tobacco industry, but usually you can find someone who is willing to open up and have a conversation. I wanted to talk briefly about special issues, which have been incredibly useful for the industry over the years. It's a great way of putting a collection of material together on a single product. And that has worked really well. In the last few years, there have been criticism of a few special issues, in particular the Jewel special issue, which I think was deeply unfair. It's a collection of 11 manuscripts, very, very high quality, and the media picked up on the fact that essentially the company paid for the open access fees. And this is what the media covered, but the fees were very modest, really, and it was, well, as a publishing person, it was quite shocking. And having spoken to the editor-in-chief, I know that there were at least 3 peer reviewers on each of those articles, and there were over 100 pages of peer review comments that the authors had to respond to. I do think that over time, as we get away from that kind of media furor about it, I do think that that collection of papers will become increasingly important. I've been a guest editor on a special issue in a Wiley journal this year, Drug Testing and Analysis. This is a journal that normally looks at kind of drugs in other situations, doping in sport. And so the editor-in-chief's quite receptive to the idea of controversial topics, which is why he was interested in having a special issue on vaping. It's also a way for journals to test the water if they're thinking about expanding their aims and scope beyond where they are now. So there's a total of 22 articles. There's contributions from academia, from research institutes, from outputs from workshops, and also from industry, a wide range of topics, chemistry, toxicology, even some behavioral studies, which are kind of quite far from the normal aims and scope of this journal, but in the context of the special issue, this was okay with the editor-in-chief. We did receive one complaint from a well-known academic in Australia who was deeply concerned about one of the articles and didn't believe it had gone through peer review. And the Wiley staff were wonderful because they emailed myself and the other guest editor saying, "What's this? What's going on? What's wrong with this guy?" And so we sort of gave a bit of context. And the Wiley publishing people went back to this academic and said, "Thanks for your concerns. It has gone through peer review. The disclosures are there. And if you still have a problem, please write a formal letter to the editor." Because they had just uploaded a comment through the system, which isn't, and that's not the right way to do things. So I was really pleased with how Wiley handled that. Each article has appeared online ahead of print, but the printed collection will be available later this summer, and I'm sure I can get a copy to anybody who would like it. So that kind of takes me to the end. It's kind of a hop, skip, and a jump through publishing and some experiences being on the other side. I do think that, I'd just like to reemphasize that I do think the big challenge is getting science out, communicating the great science on tobacco harm reduction, getting it out into the wider world. I do think that publishing in peer-reviewed journals is essential. I do think you should invest in that to make your articles as good quality as possible. You can optimize your approach to publishing and try to remember that relationships are critical. The science journal landscape continues to change, so you may want to have some specialist advice in learning how to navigate that opportunity or those changes, because it creates opportunities, but it also creates risks such as predatory journals. And there will undoubtedly be other risks that kind of open up. But I'd just like to keep coming back to this idea that good research should stand the test of objective but fair peer review. And that then should set us up for, I'll hand over to Nick.
Thank you, Sarah. I'm learning, and that was part of my education. Thank you. I just wanted to pick up on a couple of things Harry said to start off with, quoting Michael Gove, that we don't need any more experts. I've always liked a definition that came out of NASA about what an expert is. An expert is an ordinary person very long way from home. I'm Australian. I'm very long way from home, so therefore I am obviously a deep expert. But most of the people in this room don't know me. I've actually been around harm reduction for more than 35 years, but my focus has largely been on harm reduction related to harms associated with illicit drug use. Can I have my slides, please? In terms of tobacco credentials, no slide. Oh, do I have to do that? No. There's one before that. Yeah. In terms of tobacco credentials, I have a couple. The first is that I was a smoker for 39 years, up until 15 years ago. One of the implications of that was that for every year for 39 years, I received some very well-meaning and supportive advice from my very good friend and colleague, Alex Wodak, about how and why I should give up. Eventually it worked, Alex. Only took 39 years. My other credential is that I was one of the founders of this organisation, not an organisation, it wasn't an organisation, it was a movement, Bugger Up. I don't know if people know Bugger Up or remember Bugger Up. Bugger Up was billboard utilising graffitists against unhealthy promotions. And it was one of the most effective health promotion campaigns, activist health promotion campaigns ever. And I'd love to talk about Bugger Up, but that's not the reason I'm up here. So, my major contribution to tobacco harm reduction as editor-in-chief of the Harm Reduction Journal has been to appoint the wonderful Marewa Glover as section editor for the journal. I didn't realise when I did that exactly what I was getting into. I have written here that I've seen what I thought was some of the most dirty politics in a whole range of different situations, including capital P politics with our Labor Party and internal fighting within our Labor Party in my own suburb, the professorial, medical professorial fights that went on when HIV first came along, fights for territory and credibility. But I really was not prepared for what I met when I came into contact with the tobacco harm reduction and its vitriol that I received, the public health masquerading, Puritanism masquerading as public health, and I'm going to adopt another one of Harry's phrases, the piranhas of public health, which I think describes very well what I've been exposed to. I think that one of the things I'd like to see happen more is that tobacco harm reduction become more integrated with the general field of harm reduction. I want to talk a little bit about that and about what we can do about that. I was having this conversation with Marewa and Alex and Colin last night about integration of tobacco harm reduction into the mainstream harm reduction movement, and the International Harm Reduction Conference was on in Melbourne a little while ago, nothing on tobacco harm reduction, resistant, as I'm given to understand, to proposals to include tobacco harm reduction in their agenda. I think this is a great problem. I think they need to realise, and we need to realise, that harm reduction as under whatever name, whatever guise, as a human reaction to difficult issues has been around forever. One of my favourite examples is that in medieval China, they had a problem with people going out at night time getting drunk and walking home and falling in the canals and drowning or freezing. Tried everything, they tried curfews, they tried prohibition, nothing worked until somebody had the bright idea of putting handrails along the canals. Harm reduction is a normal human response to difficult problems that aren't going to go away. I think the story of vitamin replacement in supplements in alcohol, people dependent on alcohol, is worth remembering, because there was actually a strong reaction from public health against the idea of vitamin supplements for people with alcohol dependence. Not unlike what's happening with tobacco harm reduction here, or what I've been exposed to with tobacco harm reduction here. Similarly, with prevention of HIV among and from injecting drug users, large components of the opposition to the establishment of needle syringe programs and sterile needle distribution came from orthodox public health. So let's not forget that history, and let's find allies. Those allies are, I think, within a wide range of other areas. The International Harm Reduction Association, the harm reduction conferences, are continue to focus on harms associated with illicit drug use, currently illicit drug use. I'm taking the journal in a different direction. I'm taking the journal towards including a harm reduction approach and harm reduction philosophies across a whole range of human and behavioural issues. And it's going places, I think. We define harm reduction as policies and programs which aim to reduce the health, social and economic consequences of a whole range of behaviours without necessarily reducing the behaviours themselves. Classic one in our community, I come from the jurisdiction in the world that introduced compulsory seatbelt legislation and compulsory motorcycle helmet legislation first. Classic harm reduction. In line with that, we've been building the editorial side of the journal to include section editors with a responsibility for a whole range of different issues, which I don't know if you can read those from back there, but alcohol harm reduction, tobacco harm reduction, as I said, Marewa has built that section enormously. Substance use harm reduction stays with me and my deputy. Gambling harm reduction, human enhancement drugs, drugs and the internet are really understudied and hugely growing and hugely important area. Reducing the harm of incarceration. Given that the vast majority of people, in my opinion, who are in prisons and jails should not be there, how do we work to keep them out of jails? But also, if they do go in, how do we reduce the harm that's caused by the process of incarceration? Youth drugs and harm reduction is the latest section that we started, and you can see that one of our section editors there is somebody I think known well to this conference, Florian Chabine. We're also looking to broaden our reach to the community and support from the community, and Dr. Annie Madden, who was the Executive Director of the Australian Intravenous League, Australian Drug Users Group for 15 years, has taken on the role as Associate Editor to build our relationship with that community, and I'm looking for further ways to build relationships with other affected communities to bring them into the publishing process, to bring Annie, for instance, is guiding a process to develop peer ethical guidance for peer review for research that's based around peer researchers. My own prejudice is that, in a simplistic way, often we have harm reduction because we have bad policy. If we had good policy, it would embody the principles of harm reduction. Bad policy in a lot of circumstances means criminalisation of issues that really are public health issues and do not belong in the criminal justice industry. They don't belong there because either they're normal, they're just normal behaviour, or they're public health issues. With illicit drugs, a rough estimate would be that 85% of users don't have a problem, don't need attention from either the criminal justice or the public health sector. 15% who do have a problem would benefit from a health response. Healthy public policy is the aim, and the abolition of harm reduction, because we've achieved healthy public policy across every sector, would be something to look towards. I'm therefore changing also the strapline of the journal. The journal is going to become a journal for research and commentary on harm reduction and challenging criminalisation. This seems to be working to some extent. Sarah talked about impact factors. Those blue bars on the left are the impact factors for the journal over the last 6 years. On the right, there's the downloads for the journal, which in 6 years, 2, 4, 5 years, have gone from 600,000 downloads a year to something approaching 3.5 million this year, which is, I think, is a phenomenal rate of growth. It means that the harm reduction philosophy applied across all these different areas is one that is acceptable, is promoted, is necessary and is working. The challenges. I'm echoing a lot of what Sarah said in talking about challenges. Peer reviewing has become a real issue for most journals. Finding people who are prepared to review it, particularly over the couple of years of the COVID pandemic. I'm not quite sure why. Finding people who are prepared to review, finding people who are qualified to review, or want to be qualified to review, want to learn how to review. It's not something that anyone can do. It's a skill that you need to learn and master. And my observation in a lot of academic public health is that the whole idea of mentoring seems to have got lost somewhere. Mentoring people into writing, mentoring people into reviewing. We have a process developing now to mentor young early career researchers and peer researchers into helping them with writing and with reviewing and trying to build that charter, but it's an increasing problem finding reviewers. The open access model itself that Sarah described so well, what I have there is a quote from my boss, the head of my institute, which I received just the day before yesterday, and I want to read it out. I, the director of the institute, am currently in an academic board meeting at the University of Melbourne in a bun fight about open access publishing. There are various views, but they're all about how to break the publishing houses, also known as the robber barons, pernicious model that makes profit off the free labour of academics. Sarah called attention to the volunteerism that this system is built on. It's not just the peer reviewers who are volunteers, all the editors that I mentioned before, including me, are volunteers. And particularly if you're having success with a journal like this, what that means is increasing amounts of work. I have other occupations, and I must say that through my own academic career, I've found that the two most thankless tasks in an academic career are organising conferences and editing journals. Career billing, that's another aspect of my observation of academic public health, that the value that was given once upon a time to editing and reviewing and contributing to the scientific community is decreasingly there within the academic community, university academic environment. That it's become much more a business model where you're judged on the grants you get, the publications you get, and the profits that you make and PhDs you put through. But other contributions around reviewing and editing are not valued nearly as highly. I worry and am working on trying to broaden the access to the journal. There are a whole range of people who are discriminated against or excluded from publishing. I put three there, people for whom English is a second language have enormous difficulty, and for whatever help we can give, we try, but there's not a lot of resources to help people. People from low and middle income country settings, I know from first-hand experience, I spent a lot of my life working in low and middle income countries, there's enormous energy, initiative, enthusiasm, invention going on across a whole range of areas, including tobacco harm reduction in a lot of low and middle income country settings that will never see the day of light. The light of day, because people don't have the capacity or the support to publish. And the community, and again, there's enormous research going on amongst affected communities in different ways, lived experience and worth documenting, lots of learning that's worth documenting but will not be documented. In relation to censorship, I'm again echoing Sarah, and my experience with the Harm Reduction Journal, I don't want to get into cases, but it's the first time I've run across this. And a couple of years ago, I was informed by my then publisher that the publisher was adopting a policy of not accepting publications that had anything to do with money that had somehow become acquainted with the tobacco industry. I'm not exactly sure how they put it, but it was very broad. And I talked to Morewa. We had a little letting off of steam, And I wrote back a very simple email to them simply saying, editorial policy is for the editors. Go and get stuffed. That's just an example of the problems of getting experience in publication and research from other parts of the world. The map shows you where our current publication is from. The graph down below, which you probably can't see all that well, but across the bottom there is Canada, Australia, the DAC countries, US, going on down towards Africa and Asia. And that's the acceptance rate, the green line. And that's an illustration of the sorts of difficulties that people have in publishing from low and middle income country settings. And that's something that we've set our cap at fixing. I think that's about all I wanted to say. Thank you very much.
Is this working? Yes, it is. Good. Gosh, I don't even know where to start with all of that. That was two astonishing and incredibly enlightening presentations, which told me an awful lot I didn't know already. I'm going to sort of take kind of host the liberty and sort of punt a couple of questions at you before I throw this open. I notice we've got at least one online question here. I mean, obviously, Sarah, your experience is actually trying to get actual industry material published by people who work within the tobacco companies. But my understanding is that it's incredibly difficult for people who might have had some historical or tangential connection. They may have been funded by X some years ago. So getting these, and also the conflict of interest is quite interesting, because if your paper is published and it's an anti-tobacco harm reduction approach funded by a medical agency whose approach publicly is to be anti-tobacco. There's conflict of interest? Yes, I think there is a conflict of interest. It's never actually stated in that way. But you're never going to get away with it if you said, my paper was funded by, one of the companies years ago, or, Foundation for a Smoke-Free World, or whatever it happens to be. So there seems to be quite a lot of hypocrisy there, and also a problem for people to get their material published who aren't necessarily coming from within the industry.
So I would say that people that are receiving funding from the industry directly or indirectly, they have the same, the censorship applies, that the number of journals that won't allow them to publish, but they still have other journals that they can publish in. They just maybe follow where industry has managed to be published. And I think that maybe some work needs to be done with a research integrity or a committee on publication ethics, oh dear, to try and get anti-tobacco harm reduction conflicts of interest disclosed equally. I don't know if anybody's ever gone to a publisher or the Committee on Publication Ethics to raise this as an issue. It's probably something that someone should do.
Yeah. Sorry. Thank you. Which kind of leads me to my kind of next question before I throw it open. For people who are on Clive Bates's nicotine group list, we'll see on a weekly basis Clive kind of forensically taking a lot of medical publications to bits. And some of the stuff he reveals in terms of methodologies, and this is almost on a weekly basis that all this nonsense is getting into journals. What's the best, as well as getting your material in there, are there strategies for actually challenging bad science?
You can use letters to the editor to challenge bad science, and there have been a couple of examples. Some of Brad Rodu was really successful in getting one of the Stanton Glance articles retracted, which was deeply flawed. It's a huge amount of work to try and get someone to do a retraction like that. But, you know, again, it's another thing that we should be collectively doing, is challenging the bad science. And that recent paper that Clive critiqued, I was really shocked that Tobacco Control didn't retract it, that they allowed the authors away with it. And again, it would be interesting to see what someone like Committee on Publication Ethics what sort of view they would take of that particular case. I don't know if anybody ever took it to COPE. And I know COPE isn't perfect and it isn't that strong, but it is something that focuses on publication ethics.
Okay. Did you have any comment? Right, okay. So I'm going to throw this open to people who are online and also out here. I think Clive mentioned that there is a bit of a dead zone in the corner here because of the searchlights in the eyes. So if you've got questions, best to try and move into the middle a bit, because otherwise I ain't going to see you. And Mara, oh, can you wait for the microphone thing as well?
Thank you. Is it working? Thank
Yeah.
you. Mārewa Glover, thank you for mentioning me, Nick. I just want to acknowledge or add to what you said, especially because Harm Reduction Journal and the tobacco section is so relevant to many of you here, and you could choose to submit at some point because of our focus. So how I got into that position, Jerry and Paddy approached me. They had approached 50 people to consider becoming the tobacco section editor. 50 people. So this sort of censorship and fear of backlash and what's going to happen to you is very widespread. And I had just set up the my centre. I shouldn't say stupidly. It's been a learning experience, but I took it on. So I think it's almost 5 years or something. I have now shepherded 100 papers that have been submitted to the tobacco section. And it's all voluntary work. It's a lot of work. And I just want to take the opportunity to apologise if I'm slow. I have a huge program of research myself, and I have to fit this in. And I also want to take this opportunity, if I can, Harry, to ask if there is anyone else here who would be interested in being an associate editor. You know, maybe a younger upcoming scientist who would like to learn, you know, what's involved and be mentored. You know, I've been looking for somebody to join me because we are getting more and more and more submissions, and I'm having to use this reject before review because I'm getting stricter and stricter and narrowing it down and the criteria for even getting through to go to review. Okay, thank you.
Thank you. Well, it's actually quite encouraging. You're getting so many submissions, of course, which is good news. Gentleman in the front row here.
Hello, Richard Prone from Safer Nicotine Wiki. It's very, very good that I've actually heard what you've said, because we actually share your pain in some of the challenges you face. I was just wondering, we're sort of a layer on top of your journals and published work, actually presenting that to the public and making it available and accessible for advocates and people to use and to be able to quickly reference what they need to find. One of my questions was, how can we work together better to actually get the information out there quickly so that people can use it? And also, I mean, it was just to say, yeah, we should talk and we should actually tee up cooperating as far as we can to actually help to get the right information to the right people. Thank you very much.
Yeah, I'm going to pass. I just wanted to know, to my absolute discredit, I haven't looked at Safer Nicotine Wiki, and I damn well ought to. But so do you make direct links to the sort of published material that we've been talking about?
Yes, indeed.
Right.
Most,
So is it...
most of our pages contain short summaries, bullet points,
Right.
ways to make the research more accessible to the general public.
Right.
And then we would link directly to the full article for those who want to read it.
Okay.
We've got a process with an arrangement with Filter magazine where we're doing that, and I'd be delighted to talk to you about
Yeah, absolutely.
making an arrangement with you. Definitely.
Thank you.
Likewise, there are probably other things that should be connected in with Safer Wiki.
Yes. The other thing I was also going to suggest is there are a number of people who work in the background for us, just sort of reading through and checking through things. I'm wondering whether they may possibly volunteer to do some...
Being a peer reviewer?
Yeah, review.
Fantastic.
Or to look at technical aspects or
Yeah.
things like that.
I mean, so, you know, journals are so desperate for peer reviewers, and I mean, everybody should be added to Maroa's list of potential peer reviewers. But journals are so desperate that they will, they'll try somebody out even if they're a bit skeptical at first. And every time you get a peer review report back in, the system I've been using, it asks me to rate the quality of the peer review. Did it come in on time? Was it detailed? You know, what was the quality of the peer review? So you know whether you should use them in future. So if people from industry do high quality peer review reports, or
Yeah.
they don't necessarily have to
and
be...
the other one was purely, you know, just as a request to say, yeah, we do actually need more people to volunteer for the wiki, even if it isn't to actually write the public-facing pages, to just go through, read, because scientific papers take some time to read and actually pull bullet points out of. If people would be willing to volunteer to just do that, or if you as a publisher could forward us on something that we can use as a starting point, it would streamline. We obviously have the same problem as you, time constraints and being very busy.
Okay, that's really helpful.
Great, thank you.
And I'm absolutely going to go and have a look at it now. I promise. Okay, we've got one online question here, and it's all about the future of the peer review process. It says, given the instances during the pandemic where actions claimed to be science-based were later revealed to be influenced by moral positions and the prevalence of false findings in peer-reviewed studies, I'm curious about the future of the peer review process. In your expert opinion, I think this applies to both of you really, where do you see the peer review process heading in the next 10 years? Do you think there will be a renewed emphasis on building trust in scientific research, or do you believe there is a risk of the system succumbing to regulatory capture, prioritising population perception control over the pursuit of truth? I can't give you a whole day to answer that one, but any thoughts?
Sure. I mean, I think I went to a talk a long time ago that said peer review is the worst system ever invented, but there's nothing else. There is no alternative. So peer review will persist. I think that the importance of research integrity and the efforts that publishers are putting into research integrity departments, I think that will hopefully help to improve things with peer review. Publishers are also starting to offer sort of training courses for scientists to learn how to be a good peer reviewer and what you need to do. And I think a lot of that's happening because as the shift to open access continues, the author is the customer, and so serving the authors better is what publishers need to do, whereas in olden days, the librarians were the customers, because that's where the revenue came from. So I think it will persist, and hopefully it will get better.
I couldn't agree more that it's the worst of all systems except for all the others. Yeah, absolutely. And I think, but it works when it's taken seriously. And that was my observation, that I'm afraid that I watch my colleagues in public health, academic public health, failing to take the process as seriously as I think it should be taken. The other thing that comes in that hasn't been mentioned is artificial intelligence, and where's that going? And I know nothing about it. I'm too old to learn about it. Bugger it, you know. But I had a conversation with somebody else, and I said, given the difficulty of finding peer reviewers now, could we make use of the ChatGPT or something like that? And he said, no, we tried that. And he said, the problem at the moment is that it doesn't just create reviews, it creates references. And I didn't realise that. It actually, you can do it, but it comes back with 5 fake references that it's created. But I don't think that's only temporary. We're only at the start of that whole AI thing. So I think that there's going to be something with AI in the future.
I think Alex had his hand up. Down in the second row, thanks.
Thank you. Alex Wordak, Australia. My question is to you, Dr. Cooney. I was surprised you didn't make a reference to the International Committee of Medical Journal Editors, and I wonder whether you think there would be scope for individuals or organisations, particularly this conference, to assemble the kind of comments you've made and pitch this to that very important committee.
I don't see why not. And you're right, I should have mentioned ICMG. There was just so much to cover. But I think that the societies that support the publishing industry, that we need to look at leveraging them more or raising these issues to them more to see if something can be done to improve, to improve the politics and to improve on, or at least get. Well, the short answer is yes, we should. And I'm happy to talk to you about it after and plan something practical.
Thank you. Colin Mendelsohn from Australia. One thought I had was the possibility of linking acceptance of an article for publication to subsequent peer review for that journal. Have you ever thought of saying to authors, well, we'll accept but we have a condition in which authors are required to peer review two articles? That was just one thought. But what I wanted to particularly ask Sarah about was, you mentioned the obligation of society journals who are aligned, they have an editorial policy aligned with their organisation. Now, I have a problem with that because I don't regard that as a scientific approach. So they publish articles that have a particular bias, which go into the media, which are presented as scientific evidence. Then they refuse to publish articles with opposing views, which is what science is all about. And this has happened to me, and I've discussed this with Nick with an article that I wrote in response to an article in the journal about tobacco treatment, which totally neglected vaping. I wrote an article which they rejected point blank. They only accepted it when a whole lot of other people signed a letter to them saying, you can't ignore this, and they published it. Then, to cut a long story short, they 3 months later threatened to retract it based on a spurious conflict of interest. And I've spent $10,000 on a lawyer having that overturned, although it hasn't been fully overturned. But my point was that I felt this was very unscientific, that they were putting out information, presenting as scientific, balanced information, which wasn't.
Well, it is wrong. It's completely wrong. But the project that I did was to try and understand where the censorship bans were coming from and to try and predict whether every journal was going to end up with a censorship ban. So I disagree with it, just like you do. And I remember when the BMJ instituted its censorship ban, and I remember I helped write the letter that the chief science officer sent in to the BMJ explaining why this was the wrong road to take. The editor just said, don't care, not going to change it. But the letters editor identified it as an interesting piece of content and upgraded it from the online rapid responses and included it in the print issue. I mean, maybe there's a way to get these organizations, as tobacco harm reduction makes more progress and as there are more products and smoking rates continue to come down, maybe there will be an opportunity to persuade these organizations to revisit their policies. I agree it's completely wrong, but it's more of an observation and an explanation for why those organizations have decided to censor wholesale a complete industry.
Okay. We've got 5 minutes left and hands up going all over the place. Right, lady in blue there, then Norbert, then Bengt, then Jenny, in that order. Thank you.
Hi, I'm Ariel Celia. I work for Pinney Associates and we consult for Juul, and I also help Clive out with his weekly PubMed review. Both of you mentioned the difficulty in getting peer reviewers and the high profit margins of publishers and the unpaid labor. So are there conversations being had at the higher levels to compensate peer reviewers? So like, for example, I've seen some offers, like if you review for a journal, they give you a discount on the next publishing fee, but academics don't actually pay that out of their own pocket. So is there conversations had about flipping that and offering an incentive? Thank you.
I can only speak for my journal, and it's been an ongoing discussion that I've had with my publisher ever since I was editor, and we're making incremental progress, but if anyone's got any good ideas, I agree with you about the discount. They will go to the extent of considering a discount, but for academic publishers, authors, that doesn't mean anything.
And I would need to check back in with some old publishing colleagues to see what to take the temperature on that, but it's only going to get worse. And I've seen some journals start to experiment with paying for peer reviewers, and I know that was, I'm aware that's happened in some journals. Some editors will offer authors a fast-track process for several $1,000s. I don't think it ever really gets publicly disclosed. So there are things going on, and they should develop some best practice around this, because it is a very wealthy industry, and there should be a way of compensating referees.
Okay, nice and sharp, Norbert.
Hello, Norbert Zilladron-Schmidt, German Consumers Organization, IGED. Considering all the junk science that passed peer review in several journals, I think, is there any possibility for serious journals to facilitate replication studies? These are seriously lacking. We need more replication studies that evaluate the original junk and validate and show the flaws in a real study. Is there any way for real journals to incentivize the scientists to do replication studies, to publish them?
Okay, I'm going to take the next two questions and then we can sort of bundle them together. Ben, this gentleman here. What happened? Okay,
thank you. I'm Bengt Wiberg, the snooze guy from Sweden. I find something very, very disturbing. Scientific publications of very high importance. I Googled while you were talking here, I Googled smoking cessation, Dr. Ramström, one of the Michael Russell Award winners. What can be accomplished by reducing smoking prevalence? The Swedish example. It has 20 views on academia.
Okay.
And as we go on and on, I would like to support Richard Pruin of the Safer Wiki, trying to make these scientific publications, which are written in a scientific way, but are for normal people perhaps
Yeah.
a bit boring. You don't get it.
Okay, thank you, Ben. Thank you. Can you get Jeannie in, and then we'll have to wrap it up.
Okay, first of all, I just wanted to say to Nick, thanks for reminding about Bugger Up. My mum was a member, and I used to get dragged round to all their meetings. Anyway.
Now I feel old.
Sorry about that bit then. But my question is more a serious one, and it relates to this industry as compared to the pharmaceutical industry. Clearly, when you read publications, you see heaps of things from the pharma industry which seems to not apply the same rules. So just from your perspective, how do you see the pharmaceutical industry and its ability to publish on new things and our industry not?
Well, I think the pharmaceutical industry has vast volumes of manuscripts because there are huge numbers of drugs that they're working on. They've got, every big pharmaceutical company has teams of publication planners developing material for journals. I think that the tobacco industry can publish. I think it's just a bit tricky, and you've got to, but I think it can publish, and I think well, I think the evidence is there that we can publish. It feels hard, but it is still, there are still doors that are open, good journals that are willing to take the research, and it's a matter of finding those and getting to them first, rather than going to a few journals that reject you and then adding more and more and more time. But I don't think it's impossible, and I you know, I am optimistic still.
Okay, thank you. Right, very quickly, Ben's point about the value of Safer Nicotine Wiki, I think, is established and is a good enterprise. As far as Norbert's question about replication studies, I don't think the publishing industry is going to do anything about that. I mean, that's just down to university research departments, I assume. But I'm going to wrap it up now. I'm going to say thank you very much to Sarah and Nick, and big round of applause, please.
I'm Carrie Wade. I'm the Senior Manager of Global Scientific Engagement at PMI, but I cannot stress enough right now that due to the last minute change in hosting a panel, which is my first panel I've ever chaired, my views today do not necessarily represent those of PMI, so please keep that in mind. Today we're focusing on 10 years of science and what we've learned, and I will change it a little bit with my questions of what do we need to learn in the next 10 years. On our panel today is Summer Hanna from BAT, who is the head of scientific regulatory engagement, focusing on product categories, and today she'll be talking about oral and heated. And then we'll move to Jaz Alawalia. To me, he's the most well-known for investigating how tobacco harm reduction affects minority populations in the US, and he's published over 375 papers, many that are focused on tobacco-related health disparities, and he was the chair of the study section on health disparities in equity promotion. And then Dr. Amalia from Indonesia, and she studies oral health and is the principal researcher for the SMILE study, which investigates the oral health implications from switching to from cigarettes to non-combustible products. About a week and a half ago, I was in Hong Kong at the Asia Pacific Dental Conference, where one of my colleagues, Yvonne, presented on some oral studies, and so I learned a lot, so I think this is very interesting to learn about. And then we'll move to Bern Mayer, who does a lot of work on nicotine toxicity, and he's spent a lot of time evaluating the actual estimate of nicotine toxicity. His background is in pharmacology and toxicity, focusing on cardiovascular pharmacology. So thank you, and I will move to you.
Thanks, Carrie, and really appreciate you stepping in at the last minute like this. And thank you all for joining us this morning. So when I was asked to give a summary of the science on heated tobacco products and oral nicotine pouches in 7 minutes or less, I felt a bit intimidated because it feels a bit insurmountable and like boiling the ocean to consolidate all of that information in such a short period of time. But one of the things that really struck me about both of those product categories was, while the scope of today is the last 10 years, really the origins of the story here go back 40 and 50 years for both of them. And starting with heated tobacco products, having grown up in the Reynolds world, I can't help but start with Premier and Eclipse. And if you've ever seen the volume of science that really began the foundations of learning for the heated tobacco product category, and the Premier monograph that, if you've not seen, makes a great doorstop because it's about this big, and thinking that 40 years ago we were already considering what the last 10 years today would look like for the heated tobacco products. And then in 2014, with the introduction of IQOS, and fun fact, in 2015 there was a small resurrection of Eclipse known as Revo, which if you were ever in the great state of Wisconsin you'd be familiar with. But then in 2016 the introduction of Glow, and that really just changing the landscape of what heated tobacco products would look like, and understanding and creating so much scientific evidence that really substantiates that 95% reduction in toxicants through our chemistry studies, the breadth of preclinical evidence that's out there. Most recently looking at studies around the 360-day study for tobacco heated products, where you're looking at over 500 subjects and you're seeing almost 80% product compliance when you get people to switch to a tobacco heated product, and that translating into a 94% reduction in toxicant exposure, and that's amazing. And then you can combine that even further with the great work that's happened in Japan, where you can track the introduction of heated tobacco products, then you can look at hospitalization rates, and you can see that correlation, that reduction in hospitalization associated with the introduction of the heated tobacco products in Japan, and just the contribution, the positive impact to public health that that has. And it's really hard to argue such a compelling story that's really just over that last decade been built into something that's come to life for so many people in so many different ways. Switching over to oral nicotine pouches, and forgive me if I slip into some very industry-specific terminology, and I'll try to keep to avoid that. But thinking about the Swedish experience, and yesterday, if you were at Isentech, the great work that was shared by colleagues at PMI, at Swedish Match, and Altria, I certainly won't do the hours that they had justice in the next 2 to 3 minutes to talk about it, but they shared so much insightful data, and thinking about how oral nicotine pouches build on that great foundation that you see in Sweden with the introduction of snus, and then even this week taking that a step further in the release of the Smoke-Free Sweden report that says, when you think about the Swedish experience, that story, the introduction of all of, not just snus, but oral nicotine pouches, a wide variety of other reduced risk products, and that in Europe you would have had 3 million fewer deaths and 103 million additional life years if you had seen that same kind of adoption of reduced risk policies. Thinking, again, recently with oral nicotine, and I think, Carrie, you touched on this, it's not just where we've been in the last decade, but where we're really going, and I think you see for oral nicotine, a good example of where we're going next is the science really working. I think we have set the foundation for the story associated with reduced risk products and what they can deliver. But now it's about thinking about what the questions that we receive associated with those are from regulators, from people who are skeptical of novel product categories, and how we respond to those. And so I think about the BFR report that was released in Germany and thinking about nicotine ceilings, that 16 milligrams pouch limit, and how we start to think about those kinds of scientific questions and preparing for that journey. And for me, that becomes really important, not just with the insights that we've already generated, but really where we go next. So I think I'll pass it to you, Jazz.
Great, thanks. So I was asked to cover e-cigarettes and that technology. With regards to the past 10 years, but I think, as Carrie said, the next 10 years are probably more important. I look to the future rather than the past. And I think about other industries, and I think that innovation is going to become key, right? When you think about, I remember when I bought my first 30-inch LCD TV many years ago, I paid $3,000 for it. Now you can buy a 30-inch TV for $129, I think. And if you think about hybrid cars or electric cars, the same thing. The first cars, I don't know who they were, Toyota something, it went from 0 to 60 in like 10 hours, you're pressing the gas pedal, and I'm sort of a heavy-leaded, fast driver, and now you have Teslas that can go 0 to 60 faster than a Porsche, and then you have autonomous driving, and so on and so forth, and it wasn't safe, there were some accidents, there were battery fires, but this is the wave of the future in the automotive industry, and the very companies that sort of put out tons of carbon emissions, Ford, and so on and so forth, they are all on the bandwagon. And likewise, I think we see the industry, the tobacco industry, of switching, whether it's PMI or Altria with their tagline, smoke-free future, or X number of revenue dollars from smokeless, non-combustible products. As a physician, to me, these are all very, very good things. And I think that we're going to see more. I personally think, obviously, that a fourth generation e-cigarette is both safer and better way to deliver nicotine than the first generation e-cigarettes, the Cigalikes, or whatever the case may be. And I think we're going to see more innovation. For example, I know that Juul 2 is available, I think, in the UK, not in the US. And there's some technology, which I'm not an engineer, which makes the delivery of the nicotine better, whatever that case might be, so that you have less inhalation but more nicotine, which is, of course, from a physiological standpoint, the goal. My conflict of interest, we all have them, is that while I'm an academic and I do research funded by the government, I'm also a equity owner and chair of the scientific advisory board of a startup company called Cunovia. So Cunovia is working on a delivery device. Some of you saw it on Tuesday when Brian Quigley was there. Brian used to be at Altria. And we are working to develop a device to deliver nicotine through a medication route. So through the FDA, it will be a prescription product. So it won't go through the Center of Tobacco Products. It won't be a vape. And it doesn't use a battery. So there's theoretically no thermal degradation products. It uses what's called a vibrating mesh nebulizer. No idea how it works, but I think it's breath actuated. But it vibrates at such a rapid speed that it then aerosolizes the liquid with nicotine into these 5-micron drops, which is invisible to the eye, just like an e-cigarette, and then it goes down to the alveoli and works. I mean, the lung and the nose are the two best vehicles to take in nicotine if you want to emulate the pharmacokinetics of a cigarette. So I think there's going to be innovation in the medicinal route. And by the way, just the fact that there is a medicinal route doesn't mean or speaking for myself, don't feel that there is a space for recreational e-cigarettes, if that's what we want to call them, that go through the Center for Tobacco Products in the United States and that are available to consumers at shops, wherever they may be, so that there's much choice. I'm a big fan of choice. I like different coffees. I like different flavored candies. I like different kinds of cereals. And I think, so therefore, I'm a fan of flavors of e-cigarettes. I don't know that we need 75,000 flavors, but I think some flavors are very reasonable. So I think there's going to be a lot more innovation, and the products will only get safer. We'll better understand the science of PG and VG. We'll better understand the science of battery, the metal coils, and the leaching of metals, and so on and so forth. And I think the products will just get safer. They will always have nicotine in it. So I think, as Neil Benowitz says, one has to decide, is there a role for recreational nicotine in society? I know that the audience here probably feels the answer is a strong yes. And I think in my case, I think it's also yes. I mean, some people like to compare nicotine to caffeine. I don't know if that's the best comparison, but I think, it's a legal product. It's a product that people enjoy. It's relatively not dangerous, if that's the way to say it. Surely doesn't cause cancer, even though 80% of American physicians think it causes heart disease, COPD, and cancer, which it doesn't do any of the above. I think that with regards to, often you'll hear from people, we have no long-term data, we have no long-term data. And I think, as each year goes by, we have more data. And I think the snus example in Sweden is an amazing sort of real-world example of what has happened over 30 years. Hannah, is that your first name or Summer? Yeah, I got it right. I always do that, sorry. And we've met a number of times. Summer, sorry. Summer talked about the Japanese data with heat not burn and the hospitalizations, and that's hospitalizations, and then we'll know more about incidence, that takes longer, and prevalence, and so on and so forth, of COPD. I think we're going to see the same thing with e-cigarettes. We don't have that kind of epi data, but I think we're going to get it from New Zealand, and we're going to get it from the United Kingdom, where there's a high acceptance usage of these products, and we need that kind of data. The Cochrane Review, which in the world of science comes out of Oxford University in the UK, is sort of an unbiased, non-industry funded, clean scientific organization that does meta-analyses and reviews. And they have said there is very strong evidence that e-cigarettes help people quit smoking, if that's what someone wants to use it for. The United States can't decide what it wants to say, the federal government, but the National Academy of Sciences issued a report in 2018, about 5 years ago, I think 2018, saying that there appears to be evidence for it. It's a cautionary statement, but that's old data. And now if it's updated, there are a number of clinical trials that are done. We published the first one using a 4th generation pod. It happened to be Juul about 2.5 years ago, which showed strong evidence that it helped people quit. There was significant reduction in biomarkers of exposure and harm. And interestingly enough, that with dual users, people who smoked and used e-cigarettes, this is always a big concern. People go, oh my God, they're going to be using e-cigarettes and smoking cigarettes. It's more dangerous than smoking cigarettes. Well, it turns out that's not true early on. So early on, what happens is that when people are dual users, let's say they're using vapes to get off cigarettes to substitute, and they're using both, early on, they tend to be high e-cig users and low cig users. So in our study, at the end of our measurement time period, which is short term, 6 weeks, people were only smoking 2 cigarettes a day, down from about 15. Now, if you follow them over another year or two, what naturally happens is either they completely quit their combustible cigarettes, which is not very common spontaneously, or they actually end up, unfortunately, going back to more combustibles and rarely using the e-cigarette. And there's been some papers, Mohammadi in the audience published a nice paper from the PATH data set looking at dual users. Ricardo might be here in the audience. Ricardo Pelosa, Chris Russell, myself, and some others have 2 papers. One has been accepted, one I think is in review, which use varenicline versus placebo for dual users. So people dual use, and you give them varenicline versus placebo to get off the combustibles, but encourage them to stay on the e-cigarette. And it worked very well. So that's one important thing to remember about dual users. So people think dual users is like, you know, the never bad land and so on and so forth. I view it as, for someone who wants to get off combustibles, it's not a great place, but not a bad place. And then you can do something about it. And then for people who want to quit vaping, there are people who want to quit vaping. This study showed that, in fact, varenicline helps people quit vaping as well. So I think there's going to be more innovation in the field. There'll be more choice. Pouches are an incredibly safe product. They're basically nicotine gum. I would love to see the industries take the pouch through cedar as a medicinal route, but they're not going to do it, of course. But I think they should, and it doesn't prevent them from marketing it both as a product for consumers and as a medicinal product, but I'll leave that for the corporate people to figure out. So I look forward to the Q&A.
Is it me now, or? Okay. Ladies and gentlemen, it's a pleasure to be here. First of all, I apologize. I cannot impress you with a fancy car. I'm driving a VW Tiguan with a diesel engine, so I really appreciate your car. And I cannot...
I don't have a Tesla, just for the record. I have a combustible Subaru.
Okay.
Which is less fancy than a Volkswagen Tiguan.
Okay, and the second thing is I cannot impress you with any clinical studies. I'm not doing this. I'm not from the tobacco field. I'm an outsider. As has been mentioned, I'm in cardiovascular pharmacology. I'm a pure scientist and just stumbled into the field of tobacco control. So why I'm invited here, the basis is one paper that I published a couple of years ago where I corrected a little dose of nicotine. I corrected it by a factor 10 or 20 upwards after 150 years of misinformation. And I think this is the basis why I get invited to this kind of conferences. It's a good, fine paper. I won't talk about this. I provided a PDF file if you're interested, and you can download this. And I explained the history also of the discovery of this little dose, how everything started. I don't talk about this. So what should I talk about? I don't know. I accepted this invitation under the conditions that I don't have to give a talk. Yeah?
But to be clear, you do have to talk.
I have to talk, but not to give a talk. Yeah. But then suddenly I saw in the program, burned 7 minutes nicotine. And I complained, Jessica noted, yeah, I complained, I said, come on. Yeah? But this is the tricks of the girls. Yeah? The trick of the organizing girls. Anyway, what could I talk about? I thought, I'm really not prepared. But I think we all agree that the war on tobacco has shifted to a war on nicotine. Yeah? That's where we all agree about. Yeah? The wording is different, as we yesterday heard. First it was just smoking, then it was tobacco use, now it's nicotine use. Yeah? Everything goes against nicotine. But we probably not agree about the time frame. Most of you may have the impression that it just started in the last 5-10 years. And I can tell you my experience. When I was presented the first e-cigarette, this was in the spring 2006. I think most of you didn't know about e-cigarettes at that time. Yeah? I got this Chinese stuff in my hands. Yeah? I was impressed. I was a heavy smoker. I tried it. And I predicted that within 15 years, nobody's gonna smoke anymore, because you don't need tobacco cigarettes when you have, even though this was a poor performance, this Ruan stuff. Yeah? Okay. So what I did immediately, because I was so enthusiastic, I wrote to different non-smoking organizations, you know, anti-tobacco and so on. Yeah? And I was enthusiastic, as now we have the problem solved. You are fighting for 30 years against smoking. Now you have it. You just have to promote this, and we're getting rid of smoking. Tja, the reply, I was not in the tobacco control field, and the replies that I got, this was, I mean, it was amazing. It was insulting emails. This was apparently a network of anti-tobacco people. Yeah? It was insulting emails, probably hundreds of emails that I got from different areas where they said, oh, you are crazy. And they still, and this is the same arguments that we hear today. This was 2006. I heard exactly the same. They continue with the ritual, with the behavior, and you're going to normalize smoking by this, and so on. It's all these arguments. And then the other mistake I made was, as an outsider again, because I didn't know what smoking cessation means, I wrote a report on this and recommended these e-cigarettes for smoking cessation. And of course, this was the keyword for the government, and for all the authorities. Smoking cessation is a medicinal thing, and it has to go to a pharmacy, and they started to ban all these products in Austria. Not officially, but practically. Nobody dared to sell it anymore. Yeah? So this is the story. And what they also did already at that time, and we see it again now, is that they blamed nicotine for whatever they had in mind, what it could do. And in the same paragraph, they wrote me, the only thing we recommend is medicinal nicotine replacement therapy. It's the gums, it's the inhalers, it's the patches. So suddenly, and that's why I always say, nicotine is converted somehow. This is a mysterious conversion. It's converted from a helpful remedy sold in pharmacies to a possibly toxic, highly addictive neurotoxin as soon as it leaves the pharmacy and enters a liquid of an e-cigarette. Yeah? And they are not ashamed about that. They do it regularly. And then I just recently read an article in Nature Outlook. Nature is a very famous journal. And this was a series of articles on tobacco control. And they had a nicotine article there, and with all this bullshit, even in Nature. And they started to argue in this article that the medicinal products are safe because they are FDA approved. So the stamp from the FDA converts nicotine from a potent neurotoxin and highly addictive as heroin, from this kind of compound to a very helpful and recommended drug. And the final point that I want to make, in Austria, I don't know if the regulations are different in different countries. In Austria, these medicinal nicotine products are approved for children above 12 if they are smoking. So this is tobacco harm reduction for teenagers and for kids. And this makes sense, of course. If they are smoking, they should take a nicotine replacement product. But they are flavored and they're sold to kids, legally sold to kids. If I promote an e-cigarette, even nicotine-free e-cigarette for kids, they say I'm a child abuser, I'm a monster. Yeah? Nobody would tell this, and this is a really crazy thing. Well, maybe you can do your best. The best you can is to really expose this hypocrisy, this discrepancy between public views and public perception of nicotine. That would be really helpful, because you don't need a PhD and you don't need to be a professor to understand this extreme discrepancy between the good and the bad nicotine, the two nicotines. There's a pink and the black. Okay, I think I'm ready. Huh?
Thank you. As mentioned, Gary, that I'm Amalia from Indonesia. Maybe a few of you know Indonesia, where is located. Indonesia has one of the largest or greatest smoking rates in the world. So after China and India, we have very, very greatest rates of or prevalence of smokers. And it's about 65 million of smokers in Indonesia. So it's really, really big. And as a researcher, and I'm a dentist, I'm deeply concerned that this is happening to our country without any measure or preventive program that successfully decline the rates or the prevalence of smokers. And as a dentist, I frequently see how the smoking deteriorates the condition in the oral health. So from the very mild condition, from tooth staining, gum staining, tooth decay, bad odor or halitosis, or maybe when you talk and somebody can smell bad odor from your mouth, and then to the life-threatening disease like oral cancer. And then as a dentist, I also see that smokers have a sign of really mild inflammation despite the oral health condition that is severely deteriorated. So it's like smoking has a masking effect on the gum or other tissue in oral health. So when you have plaque or bacteria attached to your tooth surface, the gum has to be respond to the plaque or to the bacteria. It will be reddish or inflamed or maybe painful or bleeds. But in the condition of smokers, I cannot see any clinical sign of inflammation nor bleeding. So it is well known that smoking has, as I said, masking effect, or we call it hiding the factual or the true condition of a smoker's condition. And so let me tell you interesting finding of my recent studies that we invite 3 groups in our dental faculty, and it is non-smokers, smokers, and smokers who switch to vape, and we instruct them not to brush for 21 days. So, only in the lower jaw. Only in the lower jaw, because if we instruct them to not to brushing in the upper jaw, they will be rejected because they have to see colleagues, maybe relation and relates on something like that. So I only instruct them not to brush for the lower jaw for 21 days to see how the gum will respond to the bacteria. Because they say that in smokers, the inflammation or the response of the gum is masking by nicotine. Nicotine will constrict or narrowing the blood vessel of the gum. So when bacteria came, nothing will happen because the vascular or the blood vessel is narrowing. So this is the key point of our body response. The blood vessel or the wall of the blood vessel. It could be narrowing or widening, depends on the response that we need. So it's flexible. But in smokers, I could see that nothing. Even if we have a plaque accumulation. So I would like to see in this experimental gingivitis or artificial gingivitis, what is the response of smoker versus vapers versus non-smokers, taking into consideration that vapers also use a liquid containing nicotine. Yeah, so nicotine is something to be blamed. Then I see this interesting finding that after 21 days of abstaining from toothbrushing or other tooth cleaning measures, I can see that smokers fail to respond to the bacterial invasion or plaque accumulation in their tooth surface. No bleeding, no inflammation, no reddish coloring, just fine. But it is alarming because they don't respond to the invasion of the bacteria for 21 days. You can imagine. And I can see that it is not expected at first that vapers respond similar as non-smokers did. They bleed, they have inflammation, they have body response to this plaque accumulation. So instead of the abundant and similar plaque accumulation, smokers fail to appear or to show or to demonstrate the normal body response, while vapors with nicotine-containing liquid they still respond well to this plaque accumulation or bacterial invasion. And non-smoker have the same or similar response as vapors. So I think that we conclude from this experimental gingivitis that instead of nicotine, there is something else to be blamed. Because we already confirmed from the saliva that smokers have higher nicotine levels in the saliva. It's confirming that they take nicotine. Vapors as well, they also show elevated nicotine level in the saliva. So it is also confirming that they use e-liquid containing nicotine. And non-smoker had no nicotine level or only a small amount of nicotine levels in the saliva, confirming that they don't take any nicotine. And we conclude that maybe there is something else to be blamed, not nicotine, that constrict or narrowing the blood vessel and masking or hiding the clinical sign of inflammation which is normal. So it is not nicotine itself, but instead of maybe tar or maybe something else. Yeah.
Thank you all, very interesting. Something that I want to think about and what I'd like to bring more conversation to, not just here, but in general, is what do we need to know in the next 10 years? And what more do we need to be focusing on risk perceptions? Do we need to continue focusing on toxicity and individual risk reduction? Or is it case closed on that one? I don't know. Should we invest more? Should society invest more in exploring the benefits of nicotine? These are some of the questions I have. I will ask each of you, if you can just keep it to a minute, because I do want to be able to give the audience lots of time to ask their questions. But for instance, Jazz, we know a lot of what you do. I know a lot of what you do in other populations and focusing on African-American populations. What do we know about other populations? What should we know about other populations? What's important to them with regard to switching? And what should the next 10 years look like?
It's a lot, but I'll...
Yes, it is.
I think we do know about other populations, like, for example, just in the United States, those who are Hispanic or Latina, they smoke fewer number of cigarettes per day. They're more likely to be non-daily users of combustible cigarettes. In fact, a vast majority, almost 60–70% in the United States. We know very little about older smokers. It's almost like they're invisible. People seem to forget about them. So that is sort of like an unknown group. I think that we also know that, for example, that different groups of populations, it gets a little touchy because we're talking about genetics, metabolize nicotine differently. Like Asians, Japanese metabolize differently than whites, which metabolize differently than African Americans, and that has ramifications for the consumption of the number of combustible cigarettes or the ability to quit smoking or whatever the case might be. I think for the next 10 years was the other part of your question. I would say that, we need to continue to innovate these products, need to keep making them, I'm all about safety, make them safer. I think societies have to decide, is there a role for nicotine in society? I mean, that's the bottom line. I mean, the 80s, 90s, 2000s, it was all about the end game, as you know, or most people know. The end game was combustible cigarettes, or tobacco, if you will, if you want. But it was always that. Then all of a sudden, we were making progress in that. Then certain groups, I won't name them, sort of dominate the noise level of the media, and it's converted to the end game is now nicotine. And that's like, whoa, how did that happen? And by the way, that leads to the confusion amongst people and even our intelligent doctors who apparently don't know the role of nicotine in disease.
Summer, question for you. What regulatory targets concern you from a scientific point of view, and what should we be focusing on in industry?
Thanks. I think one of the things that I've spent a lot of time thinking about most recently would be nicotine ceilings. So thinking about nicotine pouches, for example, how we navigate that. The BFR report was obviously incredibly helpful in giving some kind of guidance in terms of a level to be seen in nicotine pouches. But when we think about the use of those products, the regulatory concerns that are becoming more present, this week in Finland, for example, they discuss, the idea that small children might go and eat nicotine pouches, and then they have, they die of toxicity exposure, and and on and on and on and on. And so you think about, eventually it becomes a very easy place to contemplate nicotine pouches that are available but no longer useful for the audience that they're intended to be used by. So how you navigate those kinds of questions, for me, I think is definitely a space that requires more scientific attention. I'm thinking about also the insights that are developed from a scientific standpoint to substantiate these kinds of positions, and what you can do in terms of really just like very purist scientific experimental design. A lot of research that's generated that presents negative views around nicotine and products. Once you start digging in, you find a lot of really just fundamental design flaws, and how you can think about things like physiological relevance and actual use, and building that into the scientific process really across the board to help respond to that as well.
Thank you. Bernd, I told you I was going to ask you this question, so I hope you've had time to prepare an answer. So what about regulating nicotine, and what do we need to know more about regulating nicotine? Summer just spoke on it a little bit, but your work on nicotine toxicity calls into question some of the current thoughts about nicotine toxicity and what the lethal dose is and that sort of thing. How do we extend that to abuse liability, and does abuse liability need to be regulated? And should we question the idea that nicotine PK is a good metric and that parameter should not be exceeding that of cigarettes?
With PK, you mean the
pharmacokinetic profile?
The pharmacokinetic profile. Well, I mean, let me start maybe with the 20 milligram per ml limit that we have in the EU. Yeah? So in the public perception, people think that this is fact-based somehow, that this is a scientific result. And whenever you have a liquid with 25 milligrams per ml, you're going to fall down, you will be killed immediately. Yeah? That's simply not true. This is a purely political limit, this 20 milligrams per ml. It could be as well 5 or it could be 50. There's no reason to limit this to 20 milligrams. This was a compromise in the discussion before they implemented the TBD2. Yeah? So this is the first thing. So you can, and I mean, when you say lethality, we don't want to have lethal doses of nicotine. I mean, it would be sufficient if you're pretty sick and you're in intensive care. Yeah? You don't have necessarily to die, and it's still bad. Yeah? But the positive thing about nicotine consumption is, and this was shown for smokers, and it was also shown for vapers, is the so-called self-titration with nicotine. Every smoker knows this. When you have the feeling it's too much, you get some headache, you become dizzy, then you automatically, unconsciously, you stop consumption. That's what the late Böttcher-Langer said, that vapers will draw it on the e-cigarette as long until they fall down unconsciously. This is a fairy tale. That won't happen. Everybody stops the consumption of nicotine if it's too much. So I'm really principally against regulation. Of course, there should be some kind of upper limits, just this clear. And because you mentioned the pouches, yeah? The pouches are different because the pharmacokinetics is so fast. So the e-cigarettes are bit slower, probably cigarettes, or at least comparable. But about the pharmacokinetics, the appearance of the nicotine in the plasma from pouches are very fast. This was shown by the BFR. I agree, this report is excellent. And they come up with a limit of 16 point something milligrams per gram pouch. And I think this is a reasonable limit. If you go higher and on the market are pouches with 40 milligrams or something, then you can imagine it takes about 30 minutes until this nicotine is in the plasma. So you have in 30 minutes, you have the amount of nicotine corresponding to 2 packs of cigarettes. You won't smoke this in 30 minutes. Yeah? So I think then it makes really sense to limit this. Yeah? And as we heard, there's someone in the audience who needs it higher concentration. Okay, then it takes 2 or 3 or whatever. Yeah, if you really need them, you can put this up. You have a lot of space in your mouth to put these pouches in. Yeah. So principally, I think we shouldn't regulate. Yeah, we should, and the society should accept. And this is an important point. I think society should accept that there's a certain amount of people, yeah, who wish to consume nicotine, who find some pleasure with nicotine consumption, who want to do that. Yeah? And it applies to teenagers as well as to adults. We will always have a certain fraction of the population who want to consume nicotine for whatever reason. Yeah? And that it won't help. You can ban it as much as you want. It's like smoking. We have smoking bans all over the world, and still we have 10, 15, 20% teenagers smoking. Where does it come from? Because they want it. And this has nothing to do with advertisement, because advertisement was banned. And like the late George Carlin, which I really like, yeah, what he said in one of his appearances, he said, children don't smoke because a camel with sunglasses tells them to do so. They smoke for the same reason as adults do, because it decreases depression, it relieves anxiety and stuff like that. There are positive effects of nicotine, and it would be worth to emphasize this. This is always under the carpet. From public health doesn't talk about the positive cognitive effects and anti-inflammatory effects and so on of nicotine, and I think we should push this in the next 10 years.
Thank you. And then finally, for you, Amalia, I have one question, and it's also a very similar question to a question from Ignacio Livia, who's watching online. My question is from the industry perspective, but he was asking more general. How do we reduce the skepticism of doctors and health officials about the lower risk nicotine delivery products? My question, which is very similar, is how do we as industry convince people that our science is reliable?
So maybe we have to conduct more research, especially clinical trials and also systematic review. Because with the clinical trials, you can also extrapolate what you have found in the lab and in the preclinical trial, and as well as write a systematic review and meta-analysis, which is already written by me and my colleagues in Indonesia, that this kind of alternative tobacco product has effectiveness in smoking reduction and smoking cessation, as well as safe. So you can see it in a journal from Dove publisher, that we already conducted systematic and meta-analysis. So we can adopt this in our daily practice from this systematic and meta-analysis, that this product is effective in reducing and stopping as a stopping aid for smoking cessation, and also it is safe. So I think it's we have a long journey to keep on doing what we believe and keep on researching. That's why it's not search, but research. Yes, you already search, you find something, and you search, so it will be a research.
I absolutely love that, and I'm totally stealing it. So thank you. Does anybody have any questions from the audience? Happy to moderate that. Somebody has a question. Well, then I'll just continue to ask mine. So, should we? What is? I'm going to follow up on this. How do we convince people that our science is reliable? I mean, I come from industry, and we do so much science. And when I was at the think tank in Washington, D.C., we focused our policy positions on the scientific basis, and a lot of what we used was industry-based science. I mean, now I work for industry, so I'm obviously pretty accepting of that, but I don't know how we in industry can actually convince people that what we're doing is in the right direction and is robust. And I would like to know anybody's thoughts, or each of your thoughts, on how we should be tasked with using science, using what we do, using what we produce to reach healthcare providers, to reach regulators, to reach consumers.
There's an opinion in the back.
I can attempt to answer that, and then we can take the question, I guess. But I think it's hard. I think, some of my colleagues in the audience have told me, and I heard from before, and then new people I met told me that if they're from an industry, a big tobacco industry, that they have trouble getting their papers published. I feel sad by that a little bit, I mean, either you accept it at face value or you don't. I mean, and some journals, of course, have an absolute ban on publishing tobacco industry funded or from the industry itself papers. So that's black and white, so there's that. But then for those that don't have a ban, apparently they're treating you worse than they'll treat me, right? I mean, that's the bottom line, what you're getting at. And I think that's unfortunate. Today's world is very different than the 1980s. In the 1980s, you may not have been born, I don't know, but you people were lying. You were publishing misinformation, you were lying, you were hiding data, you were perjuring in front of Congress. It was an unbelievable field day for you guys, and you were making money hand over fist. In today's world, you still make money, but you are watched like a hawk. The FDA, I believe, I'm not an expert on this type of stuff, but can subpoena, if that's the right word, any of your paperwork, any of your research, and look at it. So you're being watched carefully, they're breathing down your neck. Your science is monitored much more tightly than my science. I can actually get away with fake science better than you can. I don't do that, by the way, but I probably could. And I think, I tend to generally trust the science from the industry. I mean, I'll have a little bit more of a cautionary eye. But by the way, just as much as that, you have to remember that everyone has an agenda. I mean, you have an agenda. You want your science to look good, but you will be ethical, I'm sure, Carrie. I hope I'm ethical, but I maybe have an agenda, and I know some other colleagues, without naming names, who have had to retract papers, sometimes have had agendas on the other side too as well. So agenda-driven science, in my opinion, we're all driven by that to some extent, is a little bit dangerous for all of us, whether it's me or for you. I think science should be science and should be of the highest quality. Yeah. There's some questions if you want to take it.
Great, thank you.
Yeah, my Khosi Letlape from South Africa. My question is about the TPD and setting the limit for nicotine liquids. Are you suggesting that that should be open-ended?
Not open-ended.
And the follow-up is, in the 10 years, has there any science been done as to what the reasonable maximum should be and what the basis of that should be, just like you have in pouches?
I mean, the point is that the industry started to handle this 20 milligram per ml limit by developing devices that are with a sufficient performance. But still, for the small devices, the 20 milligrams are probably not enough. And we see this from the Juul in the United States, where this is I think, sold at 55 milligrams or 60 milligrams per ml, and this is successful, and with the 20 milligrams limit, it's not successful. I'm not suggesting that it's open-ended, but the initial suggestion from the Parliament in this discussion in the EU was 32 milligrams per ml, and this would probably be acceptable for most vapors. And then the Commission suggested 4 milligrams per ml. And this, at that time, this was homeopathic. Today, there are some vapors who have this direct-to-lung vaping. They have enough with 4 or 2 milligrams per ml. But at that time, in 2013, this would have been a ban of nicotine, in fact, because the devices were not good enough. Yeah? And then there was this trilogue discussion, where they then found this compromise of 20 milligrams per ml. So what I'm just saying is that this number is just, this is an arbitrary number. This has nothing to do with science. And now even in the United States, they take Europe as an ideal country with this 20 milligram per ml limit. And they say we should implement the same because they know what they are doing. No, they didn't know what they are doing. They were just dealing. This was a deal, nothing else. No scientific basis. I think it should just be sufficient for everybody, even if a smoker switches to a low performance, a poor performance device, should be able to get enough nicotine. That's the point. Satisfied? Is it sufficient, or should I? I can continue for hours.
Just one very quick comment on that, is that I would just say that a number of scientists, I think there's some truth to that, but I think there is some science. You can look at PK curves. I mean, there's some science. You can look at it. And the goal should be, in my opinion, to try to get, let's say, an e-cigarette to have a curve that emulates a cigarette and maybe just right below it so that theoretically its dependence or abuse liability would be less than a cigarette or something like that. I will say that, let's say a Juul 2% versus a Juul 5%, I vote for the 5% any day because for a variety of reasons. One is if you believe that vaping is not safe, which I think at least industry people, we all agree it's not safe. It's dramatically safer than combustibles, but it's probably not completely safe. So if that's the case, then the goal is, if the goal is to get the nicotine, get the pleasure, then why not get pleasure with using as little of this not so safe stuff possible? So then you get the 5%, you will use it less than if you use the 2%. It's not particularly rocket science. And if you want to switch off combustibles, then you want it to work, which is why something like the 2 milligram gum is like, excuse the American expression, pissing in the wind.
Let me get to this because the pharmacokinetics. I mean, the pharmacokinetics of nicotine delivery from e-cigarettes is pretty complex, and I don't think that anybody has ever looked for the pharmacokinetics or compared mouth to lung versus direct to lung. So my hypothesis is that when you vape direct to lung, it's much faster because you get this in the lungs where the uptake is faster. While when you do it mouth to lung, you have the vape has contact with your epithelial cells, and it goes much slower when you resorb it through the saliva. Yeah? So I think that there are differences. There are documented differences, pretty high differences in the kinetics of nicotine uptake that are published. So some are very slow, some are steep, and then it depends on how you vape. Yeah, that's the other thing. This is a matter of many factors, and I don't think that you can generalize this over all devices and all vapors.
Yeah. All I'm just raising is that if we're negotiating with policymakers and regulators, there needs to be a number that gets put out there. Yeah. So let's do the work of making it based on science.
Yeah,
and compromise will always occur when you negotiate. It's like speed limits. I mean, you go to some countries, it's 60 kilometers, and people will tell you, I drive a Lamborghini, it's more efficient with brakes. My limit should be 160. On the Escort, you can put a limit of 60. And we get into variable discussions. But with the regulators, you're going to need a number, and all I'm just pleading for is that there was an arbitrary number of 20 or a compromise of 20. Has the science been done to say actually it should be 18 or 25 or 30. Here's the evidence. When you review the TPD, take that into account so that you can adjust that upper limit appropriately.
Thank you. I see a couple questions here and then one there. So since you're standing there, why don't you, and then we'll get to you. Thank you.
Thank you. Joe Thompson, Imperial Brands. I just wanted to share a little bit of some of, thank you, some of the science that we've done that I think is relevant to this. So one of our clinical studies, a PK study on nicotine pouches and looking at low, medium and high levels of nicotine. And we found two things, one we expected and one we didn't. What we expected was that effective delivery of nicotine satisfied craving. We expected that. What we didn't expect was that there was a lack of correlation between dose and satisfaction. And what it showed us was that the consumer is important, the adult smoker is important, and the level of nicotine, what they require from the product to be satisfied is different depending on the consumer. And I think that's important when we're thinking about levels. It's not necessarily higher is best. It's not necessarily about a limit. It's recognizing that consumer needs are different.
No, I think that's very important. And I would also add that I think we have to do a better job at industry when we talk about what we're learning from, or not just industry, everybody, what we're learning from animal models, what we're learning from talks, and that how it may or may not apply to actual human parameters. And I think we have to do a better job at explaining that, but yes.
Zillatron Schmidt, Consumers Organization, Germany. Your question, how could tobacco industry science better reach regular science? And I want to pass on a suggestion by science fiction author David Brin. He suggested you make a bet. You bet scientists that they can't do a replication of your study and come to different results, significantly different results. So if you're confident in your results, in your study, offer money to contradict you, if they can. This way, scientists from the opposing, the anti-tobacco scientists will try to get this money from you. And maybe... I
think that's a very good idea. Yeah.
This would be replication studies that could be published.
Yes, thank you. Actually, I do know that there's a few studies or a few projects out there that actually investigate the repeatability of industry science, and so I'd like to see more of that for sure. Does anybody else have a comment on that?
Actually, in Indonesia, it started on 2021. We have a replica project, and it funding from University of Catania or Kuehar with the spin-off. So my colleague in the medical faculty will reproduce or have a replication of studies conducted in epithelial cell of lungs and also in animal, so that will confirm the results that already conducted by tobacco company. But we are from academician from university, prominent university in Indonesia. So I think that this replication or confirmation study will address your question. Thank you.
May I just add one point? I want to make this clear. The best studies I've seen on toxicity, cell biology, and even clinical studies of vaping, it includes e-cigarettes and the tobacco heating systems. The best studies were published by the tobacco industry. This was Philip Morris, and this was British American Tobacco in particular. They did excellent studies. Why is it? Because they have the money, they recruit good scientists. I wouldn't get a job there because then they need better scientists. They have the excellent Yeah, of course. They have the excellent people, and they have the equipment that my tongue goes down to the stomach when I see all these equipments. I've seen such a lab. They had 10 machines where I was fighting for 3 years with our dean to get one. Yeah, I mean, this is a huge difference. They did excellent studies, but the problem is that just nobody talks to them. When I argue with a study from the tobacco industry, then public health just pushes it away. Says it's the tobacco industry. They don't even look at it. That's the problem. So if I were the editor of a medical journal, I would ban Bloomberg-funded studies. Yeah.
And maybe one thing to also touch on in terms of acceptability of the industry science, the points that Bern just made, one of the things that I think is already done, and part of your question, of how we create that dialogue, how we generate more buy-in on scientific concepts, how we increase our credibility as industry scientists, you and I, is also just the participation in many of the things that we're already doing, but we don't do a good job of talking about. So I think about like the 21st century toxicity work that was done. So that was a collaborative piece of work with members of the tobacco industry, government officials, independent scientists, all coming together to really look at, say, how do we reduce the use of animals in scientific testing for tobacco products. That was a giant piece of work. It was wildly impactful. It was innovative. It drives the points of things that we're trying to achieve broadly as scientists globally, not just as tobacco scientists. And it's a really well-respected piece of work. What we don't do a good job of is telling anybody about it. Those people who are involved in preclinical testing, maybe they have some experience with advocacy of moving away from animal models, they know about it, but how many people in this room outside of those communities have ever heard about anything like that? Those are the kinds of venues that I think when we talk about gaining more acceptance of science, we need to do a better job at not only participating in very intentionally, which I think is a PMI and a BAT employee, we'd argue we try to do a lot, but also talking about it in venues outside of our normal places, going to meetings where people have not encountered us before and saying, we've had a hand in this work, we've done this, these are the insights, this is how we behave, this is how we operate. And I think that that's really important because the feedback I got this week, which was always a helpful reminder, is you have a good message, you're a terrible messenger. So thinking about how to do that a little bit differently, I think, is also pretty critical.
Thank you.
Thank you. Alex Wodak, Australia. My question is really to any member of the panel, but especially to the two members of the panel from the tobacco industry. This is a difficult situation we're in. We're losing every year around the world the equivalent of the population of Switzerland from smoking-related deaths. We're dealing also with the legacy of decades of behavior by the tobacco industry that was beyond reprehensible. And I think it's good that that's now come out and accepted and acknowledged by people across this issue. But I'd suggest to you that in the next decade, there is one area of science that could make a huge difference, that is real data that exists already, that isn't released, and that would make a big difference. And that is data that the tobacco industry holds on cigarette sales and also of reduced risk product sales. We know that data exists, it's referred to frequently, and if that data was made available, and currently it almost isn't at all, and if it is released, it's very, very sparing, but if more data was released, we know it's high quality data, it would do two things. It would help drive the policy debate, and it would help improve the reputation of the tobacco companies. How could that happen when the tobacco companies are in presumably fierce competition with each other? And I think the answer to that is also fairly obvious. If all the tobacco companies got together and discussed this problem and worked out a way in which they could all release the data together, the same kind of data with the same kind of quality, that would help drive the policy debate. And the more the policy debate is driven, the more the sales of the reduced risk products would go up. So I'd suggest that if you think that's a reasonable suggestion, I'd hope you could take that back to your colleagues that you work with and make that suggestion. Now, I have to acknowledge that this is something that David Sweenor from Ottawa has been banging on about frequently and regularly for years, and I think he's right. It's a difficult issue, it's stuck, and we need to have more things like this. And here's an advance that is really hiding in plain sight.
So I feel like by default, I'll pick that one up. I assume, having had the same conversation with David as well, part of the thought with this is that if you take the sales-weighted data of cigarettes, you take the sales-weighted data of reduced-risk products over a point of time, what you, and correct me if I misstate this, that you could say, we've watched the sales of cigarettes do this in a specific geography, we've watched the sales of reduced-risk products do this, and we see the inflection point, and we can say that, you know, here are the insights that you can gain from that, roughly. So we've talked a lot about this as a concept because I think at that level, like, that's an amazing story. Like, why wouldn't we say that? What I can say as a person who has dug through this to try to tell that story is, while our sales data can often look very flawless from the outside, it's only about 75 to 80 to 100 to numerous different inputs coming in to make a model. It's not necessarily as simple as it appears when you look at it in, you know, marketing presentations or when, you know, our senior leadership hits the street to talk about our numbers. So when we attempted to do this kind of thing, and you may ultimately walk away feeling like I'm trying to avoid the question for a thing that feels obvious, that when we start looking at the models, it's not as simple as that. And when we start trying to track over time, what we wind up seeing is if you start tracking in, you know, let's say a reduced risk product's introduced in May of 2012. And in May of 2012, we had one mechanism that was tracking the sales data of that. And in August, we had 17. And in, you know, October, we had 74, and next year we had 378. Like, because you have so many moving inputs into that data over time, once you start trying to actually do the math, you have a bit of a garbage model. Because you've got such a good reporting mechanism up in FMC just of how long, or factory-made cigarettes, over how long it's just simply existed. As you look at the way that that sales data is captured for these other outlets, that's changing all the time. So you can never do a good one-to-one comparison on it. So while I appreciate, you know, David and probably now yourself, after hearing me talk about it, say, that's probably bullshit. But I will say that having looked at it, that becomes the problem in telling the story. That when we use this sort of proprietary company level data, there's just so many inputs into the model that it becomes really complicated to tell what appears like should be a simple story. I don't know if you have anything to add to that.
As the moderator, I think I get to bow out and not actually answer the question. So thank you. But no, I know that we've spoken with David Sweenor about this too, and expect that hopefully we can get to a place where those questions are answered. I know it's time to close the session. I'm going to leave us on one question to think about, which is came from Ignacio again, who's online. And I think it's a kind of an interesting question, and so we can all mull it over and discuss over the networking lunch. Is there any science which could be done which would satisfy the naysayers in tobacco control? I think we have a lot to think about. Thank you so much.
Yeah. Yeah.
Hello, my name is Sule Castro from Knowledge Action Change. Welcome to GFN-TB. Today we will be talking about the illicit market of safer nicotine products in Latin America. And here with me is Ignacio Leiva from ASOVAPE Chile and Secretariat of ARDT Iberoamerica, and Jorge Sidion, who is a professor of philosophy of law and president of Mexico y El Mundo Vapeando. Some of the major markets in Latin America of those safer nicotine products are not permitted. Those are the major markets, in Brazil, Argentina is one of them. However, it's common knowledge that those products are available everywhere, and there is a clear demand for it. Brazil, for instance, there is a considerable number of shops, physical shops, as well as a strong online presence, where people can buy those products. However, they do not know what is it that they buy and what is it that is inside. So I would like to ask my colleagues here today, what is the situation? By that I mean the legal situation as well as the actual situation on the ground. I would like you to cover a little bit Mexico in more detail, and then Ignacio can talk a little bit more about other countries in Latin America, especially the big markets one where those products are sold and are quite popular, but are forbidden.
Okay. I start? Okay. When we think about what's happening in Mexico, there is some special issues that have to be addressed. First of all, the prohibition doesn't come from the Congress making laws to prohibit it. The problem is that the prohibition comes from presidential decrees who doesn't go to the Congress to be passed as a law. So with these kind of prohibitions, in Mexico we have a kind of trial called Juicio de Amparo, where a federal judge can revise if there is a violation of human rights, and some companies already started these kind of actions, and they've already won these actions. So we have 3 scenarios with these legal procedures. First, companies or people who already won these actions and are entitled to sell these products legally, and they are selling them on the market with the permit of these legal actions. Second scenario is the people who didn't start these trials or didn't want to, and they are selling these products outside the legality. They are selling this on the black market. And the third scenario is people or companies who just quit selling these products to avoid rates and fines or even prison. What is happening is that the market is moving in a very irregular way because there are products sold legally and some products sold on the black market. That's more or less the scenario in Mexico.
Thank you. So just summarizing, in Mexico there is a presidential decree in which the products are not allowed to be sold unless you took part on this action. You were part of the companies that raised this legal action against the government. So you end up with shops that can sell and shops who cannot sell, and obviously you always have the parallel market, which is the illicit trade market. Brazil, similar situation, but not as much because we have, since 2009, the commerce, promotion, and importation of what they describe legally as electronic devices for smoking banned based on a precautionary principle. I'm going to pass it on now to Ignacio, that we will discuss a little bit more of the other markets in Latin America and what is the situation at the moment.
Well, as you said, in some part of South America, these products are forbidden, mainly vaping. You have the case of Brazil, as you state. Also, we have Argentina and Uruguay, which also have this ban. And the problem is that bans never work, and in Latin America, even less. In case of Brazil, as you stated, you can find these products easily in the market, I mean in the black market or informal market. And in Argentina, you have mainly the same situation. But in Argentina, I will tell that they went in a step further, because even if it's totally banned, you can find physical shops where to buy. But these shops are hidden in normal houses where you knock the door, they need to know you.
Yes, I heard about it.
And they open the door and it's a normal family house, and then one of the rooms, it's a shop. And the thing is that Brazil and Argentina are getting all the products from Paraguay, who have not a ban in this product. Actually, they are the ones that produce more products of vaping in Latin America, and they are supplying because the borders are very open, widely open, through Brazil and Argentina. But the funny stuff that other countries that have these products forbidden, it's Uruguay. But Uruguay is receiving the black market not from Paraguay. They receive it through Brazil and through Argentina, what shows you that you can't try to ban the people to get access to it. It can even cross that country to go to another one, but it's the very bad part, because there it's the very problem. First, the quality of the product. If it's the black market, the one that is doing this, no one knows what it's inside of their e-liquids, or if the e-cigarettes are of good quality. And the second one, it's that the mafias grows, because obviously the ones to get this market, the legal market, it's people that will cross the law. And they said that this is to protect the young people, but someone that is acting illegal doesn't care who will get it. So that's the main problem of these countries. We have also the case of Chile. In Chile, the e-cigarettes are not banned. You can sell e-cigarettes, you can sell e-liquids, but they restricted the nicotine. So the nicotine can only be sold by the pharmacies. And the pharmacies don't want to sell it because they are the ones to oppose the e-cigarettes. So in Chile, you have something that we call the gray market. You can sell electronic cigarettes, but you can't sell nicotine to the users. So it's like, I let you play football, but you can't have a ball. So there is a black market over the nicotine, but there is a formal market on cigarettes and e-liquids, what have no sense.
Yeah, but from what we've seen, there is a huge demand for those products because people find a way to buy it. From what I understand, speaking to some people I know in the country, the people that cross the border, buy the products and take back to Brazil. However, obviously they take a huge risk because if they stopped on the border, but apparently there is a fee to charge. It is a bit, in my opinion, naive of us in Brazil and obviously Argentina, who shares the border, to forbid a product beside a country which we share borders, because we have a history of contraband. So it is not permitted in Brazil, but you can just cross the road and buy a whole container of it in Paraguay and bring it back. Although obviously the governments are losing a huge amount of money in taxes, and also the consumer, which is there and we should protect, don't know what they're getting, but are desperate to have some sort of alternative and probably can't understand why in some countries they are allowed and why we cannot have in Brazil. And we're not talking even about other countries in Latin America. We are talking about countries like the UK, Sweden, where we know the governments are not trying to commit mass murder. So what do you think? Do you think regulation would help to solve some of the issues related to that comes with buying products underground? Do you think that would help us a little bit more to control as well? Obviously, the primary purpose is to help consumers and help people to acquire products that are
Actually, regulation is the solution. Because if you regulate, you can know what products are coming in, who is selling them, you can see what's going on and you can protect the user. Finally here, the main thing is to protect the user and don't let the kids to get access to this product. Another stuff that I wanted to point out of something that you said before, you said they take a huge risk. Actually, there is no risk in LATAM. It's difficult to see it from Europe that there is no risk. How? It's banned, you cross the border. Until now, in Argentina, there was only one case
that was my next question, but thanks for
I'm
answering.
so sorry.
No, it's okay.
So
that's
sorry.
fine. That's fine.
But
yes, I was going to ask about that. What is the
is
actual index of prosecution
no, in
on
the
those countries?
prosecution,
If
it
you
barely
caught?
doesn't exist. We have only one case in Chile, only one case in Argentina. I think there is not even one case in Brazil that someone have to pay or go to jail. No one.
Yes, that's what I've been told, that there are sometimes, they are caught, but obviously being in Latin America, we know sometimes people can pay their way out of anything.
Yeah.
So there are
Or they
prosecutions.
just don't continue the prosecution.
They are caught, but they are never,
They
they
are
never go to
never-
prison. So in a sense, they
Not
don't
even
see
paying
it as
not
a
even
fine.
paying a fine. Not even
Yes.
paying a fine. There is only one case with fine in Argentina, 0 case with fine in Chile, and that's the reality. You said, I will ban it, but actually the people have access, but to products that you don't know the quality, and the kids can get it because the people that go for illegal stuff don't care who is selling. So the regulation is needed in these countries. Banning products have shown to be totally inefficient way to protect the users or to make them stop using these devices.
As Ignacio said, in Latin America, we know that the notion of law enforcement is very low. Even we have laws, the law enforcement does not apply regularly as it should be in all the countries. So in Mexico, for example, we have right now 20 bills that are trying to regulate the electronic cigarette market. Most of them are trying to make a differentiated regulation from cigarettes, from traditional cigarettes. Some of them want to make a equalization between both of them. And that is the only way we can solve the problem. What I told you, some people legally can sell, some people cannot legally sell. So the market is very irregular. Only with some regulation, we can put all the people that want to sell these products in the market, in a legal market, collect taxes, and protect the consumers from what they are buying.
And we know from experience here, obviously, in other situations in Latin America, that border control has a very difficult time catching up with everything that is going on, let alone to try to control a border between Brazil, Argentina, and Paraguay. Sometimes I hear the comment that Paraguay is not actually keen that we regulate those products in Brazil, because as one of the biggest market in Latin America, if we regulate these products, Paraguay will obviously stop making as much money. Obviously, each country will have their own interests to defend, I guess. But what do you think about that? I mean, it is a difficult balance to get because we don't have enough money to control all of those crossings. But once we regulate, obviously we're going to have to devote money and education to make sure that those products are not going to be used by the wrong people. By that I mean the younger population. And that's obviously something that we have to discuss and think properly, that we can regulate, but we have to devote money and effort to make sure that those regulations are applied throughout the countries. But we know those countries are huge. Brazil has 26 states, therefore, but that is not an excuse for not regulating.
And having no regulation is worse when we talk about minors, for example, because a guy who is selling on the black market some product is the same for him to sell it to an adult than to sell it to a young.
Yeah.
And about the money, you're not collecting taxes now that could give you the money to make
able
the
to-
policies, not or to educate the people and
To make the law enforcement.
to make the law enforcement,
Enforcement.
not to let the kids to
Have
get
access.
these devices. But something that I might say, because it sounds like nothing or everything is going in the wrong way, actually in Latin America, even if we're talking about the countries that have problems, in Chile there is it's advancing in a very good way through the regulation. Actually, in this moment, it's being discussed the last part of the regulation. We hope that we will have a law at the end of the year or even at the first month of next year. In Peru also, they are working a lot enforcing the regulation. Colombia, it's also in a very good way discussing now in the senators or in the deputies chamber. So it's going forward. We were talking about the ones that are kind of a little stuck, but also there are coming good news from Latin America in the fight over to getting a regulation that it's acceptable and it's well done,
Workable.
thinking in the best for the users, for the kids, and for the governments.
So that's good news. I hope we are on the right path and that we have some countries in Latin America that will eventually start progressing in the right direction. I know that you are one specialist in the topic of human rights, and I would like, if it's possible, for you to expand a little bit the correlations between human rights in Latin America vis-a-vis the access to reduced products.
And when we talk about democratic states, that is a questionable affirmation for Latin America countries. We think that the law is supposed to protect the personal liberties of all the population. In our case, when we think about the concept of harm reduction, we see 3 human rights directly linked to this concept. The first one is the right of free development of personality, that says that everyone can choose whatever he wants to be or to do or to consume. In this case, you have the right to consume cigarettes, you have the right to consume vaping or tobacco-heated products. The second one is the right for information. And this is a very difficult situation in Latin America, because the ones who are spreading the false evidence about vaping are especially the governments in Latin America. So when there's a violation coming from the same government, then the human rights are violated very flagrantly, and that is what we must try to stop. And the third right is the right for health. Everyone has the right to have the maximum kind of health that can be achieved, but human right for health is not an obligation, it's a right. So when a government wants to impose a lifestyle, trying to forbid something for their population, they are violating the human right for health, because you are the one who can choose what is good for you and what is not good for you. When you connect these three human rights, then you get the concept of harm reduction, who has to be inserted in the regulations that has to be made by Latin American countries.
In what have to do with health, there is 2 human rights. One is to get the best kind of health or state of health that you can get. And the second one, it's that I have a human right that it's obviously that I have the right to choose over my health. When I've got cancer, I'm the one to choose if I want to go for this treatment, other treatment, or non-treatment. In the case of people that want to use nicotine, they have the right to choose which way they want to get the nicotine to their body. tobacco, combustible tobacco, is the worst one. It's impossible to understand that the governments are trying to force the people to take the nicotine in the worst way that they can take it and making the most amount of damage that they can have. You have vaping that it's 95% less harmful than normal tobacco, heated, burned tobacco, sorry. You have nicotine pouches nicotine pouches have shown to be like 99.7 less harmful than tobacco. And obviously, I have the human right to choose on my health in which way I want to protect it, and that it's totally against human rights.
And there's another thing. When you're a smoker, you can choose the treatment you want to use to quit smoking. And these alternatives are one of the treatments. Even they are consumer products, it can be chosen as a treatment to quit tobacco. It's like herbs or alternative medicine. They are not exactly medicine, but they are options for treatments according to the way anyone can solve the problem they are thinking.
And that it's proven by science. Science have shown that using e-cigarettes can be 2 times more effective than the best pharma products that you can have, even with the pharma products and with medical assistance and so on. Yes. From 2 to 5 times more successful you can be with using e-cigarettes than those meds. So
yes, obviously we don't advocate for one product or another. What is important that the people have a wide variety of products to choose, because people are people and people will have different tastes and needs. Some people will be okay with one product, some people won't know. But we won't go into detail talking about the illicit trade of the actual traditional cigarettes in Latin America. That will be discussion for another day, but we know, we didn't discuss here today, but we know that it's very big. In Brazil, it's considered as big as the actual legal market, and there is a huge demand for it as well. But considering the challenges in Latin America, the things that we just discussed about how much we lose in terms of revenue for the government, considering that our people, our fathers, our siblings, our friends do not have access to a product that can help them to have a much safer and better life, because I do find that a lot of the time we talk about the smokers, but the smokers do not come alone. They have families, they have people around them that is also affected by the habit. Personally, I have a personal stake because my father smokes 2 packets of illicit cigarette a day, and everything that we do around him has to be catered for him to be able to smoke a cigarette every minute or so. So considering the challenges, could we just summarize what it's your advice for regulators to deal with the challenges and obviously look after the people that they're supposed to, which is the population? And
I think the main thing here, it's not to forget ever the main objective, that it's save lives. Those people that it's regulating now need to think that today, every single year, we are losing 8 million persons dying for combustible tobacco. So they need to think on that. In the case of Chile, 52 persons per day dying. And taking this regulation seriously, basing it on science, not what it's misinformation, would take them to make the best for their countries, for their people, and finally to those families that are losing members, that are having very, very sad endings towards most of the worst ways to die in this moment. So I just ask the regulators to focus on this, to see the evidence on science, to hear the users, and don't let the money of a philanthrocolonialism to force them to take very, very bad decisions that will affect all the countries in Latin America.
Thank you, Ignacio.
And even it's very important that we have laws to control the market. Our governments have been taking a lot of time and haven't solved in many of the cases these issues. So just one word, regulate. What we need is that they regulate these products.
Okay, thank you very much for all your comments, the input. I know you two work on your respective countries as well, liaising with other colleagues in Latin America to raise awareness about the concept of harm reduction, that in some of the countries they don't think much about it, but although this is where it's most needed, right? Because we know that the countries that has the highest smoking rates are low and middle income countries with huge populations, and people are not having access to, or when they do have access, the choices are very limited in the case of Latin America, or they don't have access. When I say don't have access at all, obviously I mean access to the legal products, but we know it's everywhere, and you can buy anywhere or knock in anyone's door and you buy the product. It is a difficult situation that people are put in, people that tried, helped them, and then they decide to help others, and they open a shop, and then they are driven on the ground. You know, obviously, like you said, you knock in a door, there'll be a family having dinner, and they'll stop to help you. And from what I heard, those people are not just selling those products because they want a quick profit, because there are many other products that you can buy in Paraguay if you cross the border and you make less, I would say, less troublesome sale and to you. So I am going to pass it on now to Lindsay Stroud, who will be doing a session on science, regulation, and morality. So I'll pass it on to Lindsay now. Thank you very much for being with us and listening to us. So I'll see you soon.
Thank you. Thanks for the
Thank you,
invitation.
Leon.
Thank you.
Thanks a lot.
Oh, and here we go. It is that seamless. So thank you guys for joining us for the Science, Regulation, Morality panel. My name is Lindsay Stroud. I'm a director of the Consumer Center at the Taxpayers Protection Alliance, visiting fellow at the Independent Women's Forum, board member at the American Vapor Manufacturers, and there's a few other things I'm just not going to mention because you're here to see all of these people. We do have Martin Cullup in the room, and he's a big fan. He's a big... he's just really good at the Consumer Center at TPA. So again, thank you for joining us. So I'm just going to start introducing the panel. We've got Dr. Marwa Glover from New Zealand. She's got 25 years of experience in reducing smoking-related harm. She's chair of End Smoking New Zealand, and she's published over 100 studies. It's pretty impressive, girl. And she's focused on reducing smoking rates among Indigenous peoples and reducing smoking during pregnancy. Next to her is Dr. John Oyston. He's from Canada, my neighbor to the north. He's got degrees in medicine and medical research before training in anesthesiology. He's also a specialist in both the UK and Canada, and he's also worked in Ethiopia, New Zealand, and Rwanda. And he retired in 2019 from the medical practice, and he's been focused on cessation advocacy and knowledge transition on safer nicotine products, as well as publishing numerous editorials in the Canadian medical journals. We got Dr. Ariel Salia from the United States. She's a scientist at Penny Associates, and which is also associated with they consult for Juul. Her primary focus is on tobacco use behavior among youth and young adults. And prior to Penny, she spent a decade in academia studying adolescent substance use and addiction. She has over 50 publications to her name in behavioral and methodology. And last but not least, and he's not a doctor yet, but and from the United States, as Kevin Garcia. He's a graduate student at Colorado State University studying public health and social work with a focus on global health and disparities. He's also a harm reduction fellow at Filter, content strategist for Next Distro, and a research assistant. And we're just going to start out with an icebreaker, given our, our panel topic. So, and I'm going to start with you, Kevin, and it's the same question for all of you guys. What is the most immoral thing you've seen globally in regards to adults both accessing the information on safer products as well as accessing those safer products?
I guess I feel like my main point is that I want to make here today is that tobacco harm reduction is harm reduction. And I mean, I've seen a lot of people stigmatize certain types of harm reduction and approve of some types, but not approve of other types. And I'll see it a lot with like smoking kits, for example. I hear the notion in the US, Biden's giving out smoking kits. This is harmful, but it's not harmful. It's another type of harm reduction tool we could use to reduce harm, just like we do with vaping tools, with non-combustible forms of nicotine. These are all different types of harm reduction, and we shouldn't be stigmatizing either one. We should support all forms of harm reduction, whether or not they're deemed socially acceptable at the time.
So in addition to what Lindsay mentioned, I also help Clive Bates with his literature review every week. So the literature is what I see. I see a lot of bad errors in the literature, but usually I try not to attribute intention behind it necessarily. Never attribute to bad intent, what you can attribute to ignorance instead. But one thing that I would say was really immoral was the claim out there on Twitter that Cochrane was funded by Big Tobacco or had Big Tobacco connections, because whether or not that was an honest mistake, if you're going to throw out a claim like that, you have a responsibility to fact check before you do a lot of damage. And that was, the Cochrane review obviously is the gold standard for why e-cigarettes are effective. And to throw out a claim like that really undermines the science.
There were so many things that had me upset, it's kind of hard to choose, but just three at random. The tobacco companies that claim that they're wanting to unsmoke the world and they're wanting to make transformations, but are refusing to produce medically licensed and prescribable vapes. In the vaping industry, been recently involved with a company called SpongeBob Vapes that produces a disposable vape based on a TV character aimed at 6 to 11-year-olds. They also sell a plush toy, a little teddy bear with a vape inside it. I think that's just disgusting. And then from the regulatory point of view, in Canada we have a smokers helpline, and they're sponsored by the Cancer Society. And so I went online there recently and asked them what their advice is about vaping, and they said, well, there's not enough evidence to recommend vaping as a way to quit smoking. And I asked them what they thought about EVALI and popcorn lung, and they said these are valid concerns and I should be worried about them. So this is what the Canadian Cancer Society is sponsoring. So there's plenty of problems to go around.
Thank you. And thank you, everybody, for coming today. I thought about this question, and obviously, you could say that what's most immoral is tobacco companies continuing to sell a product that kills people. But I see morals as being more at the individual level. And the most immoral thing to me is that I know many people in tobacco control, public health, they know these products save lives and they are blocking access to them. They are facilitating increased rates of disease and premature death among people from 35 years up. I think that this is the most immoral thing that's going on.
Woo woo. Well, we're going to go back to you. So if you guys haven't seen them yet, I actually have the best panel of GFN. Every single one of my people did a video, which made me hosting this a lot easier. I knew what they're going to talk about, but if you haven't seen them, please watch them. Every single one of them did a really good job at presenting the information. And I'm going to start with you, Marwa. I'm going to give a little bit of what they kind of did, and she can explain it better. So your video examined historical human development and unification theory with differing spheres, including the social group forming, spiritual rule forming, and these all play a role in everything humans do, from family to governments and regulations. Can you describe your video a little bit more to all of our listeners, and as well how that applies to tobacco harm reduction? And kind of go into how each sphere, while essential on its own, is also determined by the other spheres?
Yeah, so it's quite complex, but I guess being Indigenous and having sort of a Western training, but also Indigenous worldview, which tends to be holistic, so more of a systems thinker. And I came across this unification theory by a theologian, and it was polyspheric model. So I thought, oh, this is too complex to present, but I've done my best to break it down. We have one of the biggest questions that keeps getting asked is why? Why are people against these low-risk alternatives to smoking? Why? People are saying, oh, it's a moral disgust because they see a cloud of vapor and, you know, they have this physical reaction. So the morals, or saying it's about morals, is a key kind of narrative. It's way more than that, and I try to show all of the other underpinning rationales and motivations for the anti-vaping, anti-harm reduction actions and narratives that are going on. So I'll just take an example that Roberto talked about yesterday, and that was the ban on vaping outside, let's say outside, on a breezy beach. I could say smoking, but we'll focus on vaping. Now, why would they do that? And he said it's all about denormalization. He's quite correct there. And he said that they don't want children to see anybody vaping. So one of the spheres is the language meaning-forming sphere. So when you do something, it is seen as significative. I had to practice that. Significative. Every act you do signals your beliefs. So if you vape, or people do what they do, their acts, because they think it's a right act. So a person vaping is sending a signal to others that they believe it's right, and therefore other people think, well, they were vaping, so it must be okay. So in the meaning language forming sphere, things are significative. Banning vaping is significant as well of the group forming of the rules the group sets to control their group. So banning signifies wrong. It's wrong. And that's part of the rule-forming sphere, and it's also part of forming the group. So our group is, you know, we say tobacco control. They have an idealistic dream for how society will be. Public health has a dream for how society will be. Nobody will smoke, nobody will drink, nobody will eat unhealthy foods, unhealthy things are labeled unhealthy. So everything that's happening is all bringing about, it's all about controlling the group, forming the rules, keeping people inside of the rules. It's all about control. The problem is, and I try to explain it, we have different societies and different communities in the world and we don't all agree. So, you know, we end up fighting about, it may be religion, it may be capitalism, you know, that's an ideology. And communities make these up, they're made up. I know that it can be offensive to say that a religion and the beliefs of a religion are made up. Everything is made up by the group to control the group. So I can sort of say, you could give me anything that they do and I can say, okay, in this sphere, it's significative, how they're changing the meaning of words even. It's all about control.
And vaping or novel, you know, nicotine products too, because they're a new thing, they feel that they need to control it before anything starts, is what you kind of see with some of the alarmism.
It's against their, you know, they are, I think I called them fundamentalist tobacco control.
I have that over here. It's Oh, yeah, the fundamentalist, which is one of the best ways to describe them, anti-harm reduction fundamentalist.
Yeah, and there are public health fundamentalists. So somebody else who spoke, again, Roberto said it was about social engineering. Absolutely, it's about social engineering. And yeah, so everything that is said, everything that is done, all of the bans, there are multiple motivations.
Oh, absolutely. Well, and that's a good segue into John's video, actually. And yeah, your video discussed this deep conflict between capitalism and public health, with conflicting value systems, is kind of how you put it. Capitalism prioritizes individual freedom, personal responsibility, while public health promotes overall good of the community versus individual rights. And then the greatest good for the greatest number. Can you, again, explain how those kind of apply to tobacco harm reduction, and also answer the question, can they work in tandem, or are they always going to be in conflict with each other?
Thank you for the introduction. So one example where the goals of capitalism and public health are matched is PMI and heat-not-burn products in Japan. And this is a brilliant example of a situation in which the innovation and the productivity and the activity we get from capitalism can actually work with public health. And as people in this room know, probably the heat-not-burn products like IQOS have captured something like 30% of the Japanese tobacco market, and they've decreased the sale of combustible tobacco by, I think it's 74 billion cigarettes a year in Japan. So that's an enormous success, but that's, I think, almost an aberration. I think in other circumstances, things have not worked out so well. So if you look at, for example, PAC Systems and Juul, they invented a brilliant product, and Clive Bates said this could have been the most successful smoking cessation aid ever made. But they decided that there was more profit for them in marketing this as a toy for kids or for young teenagers, and they went that route rather than selling it as a smoking cessation aid. And that's proven to be really unfortunate, and that's why we have this whole discussion about the epidemic of teen vaping. So I think there is normally quite a conflict between capitalism and public health. And I think it's also fair to recognize that obviously we think of the tobacco industry as a capitalistic organization that depends on profits and shareholder value. The pharmaceutical companies also do that, and they see safer nicotine products as a threat to their nicotine replacement market and to products like Champix and bupropion. But then, as we talked about this morning, academic journals are also in some ways capitalist because they're concerned about the impact factor and they're concerned about placating whoever owns the organization. So this whole conflict between profit and innovation that you get from capitalism and the public good extends to almost all spheres of our activities.
It goes back into Mara's point on the, the different spheres and how they influence, what comes out. Ariel, as a researcher that breaks down, you beat me to it. I know you do all the work with Clive's group, and thank you for all that. And breaking down those studies is fantastic. So your video features how to examine these studies, and specifically you looked at, because I think you pointed out like, oh, we can't go through everything with the limited amount of time, but you looked at confirmation bias and spin, and oftentimes how these are all presented in the abstract and the conclusions of papers, which, I mean, I'm a busy person, that's usually what I read. How can you teach our audience how they can be better researchers by identifying these problems and how they can, read the conclusions better?
Yeah, sure. So I think the first lesson is that you can realize that the abstract doesn't necessarily reflect the underlying results that are presented. And as I say in my video, there's so many problems out there that I could go into that others have really documented well as far as methodological flaws, study design flaws. But what I'm focused on in my talk this year is let's take for the sake of argument, which granted is a huge leap, that everything presented is correct, that all the analyses are correct, there's no flaws in the study design. Even so, there's still a pretty serious mismatch sometimes between what the results show and how that's spun in the abstract. And usually this takes the form of selective reporting. So one of the things, after week of doing this, I'm starting to kind of better detect what might be red flags in the abstract. So one thing that sort of tips me off is if there's qualifiers. So in one of my studies that I cover in the video, for example, the results are presented among smokers who have never vaped. the who have never vaped is a qualifier that describes a particular subset of the sample that they're looking at. And it makes me wonder, well, were other subsets looked at? And in fact, in this paper, there were the other subsets that were looked at were smokers who currently vape and former smokers who currently vape. And these are all also very important populations to look at. And in fact, the results went the complete opposite direction as the first group, smokers who never tried vaping. And the abstract only selectively presents the one group that kind of supports what I assume is an a priori assumption or a policy stance. So looking for those kinds of qualifiers is a good place to start. And you know, after a while, you kind of get into, unfortunately, you have to put in the time. And part of the problem is that we're all limited with time. So I myself sometimes only read the abstract, but after a while, you can kind of learn some of the signals in the abstract. And you know, not all qualifiers are bad. Sometimes it's appropriate to look at that, but it's something that makes me want to take a closer look.
Yeah, it's all pretty bad. Sorry. Last but not least, Kevin, your video went over misinformation, disinformation, and dishonest science. And all three of these lead to bad drug policy. And yeah, you kind of focus on the drug aspect of it, because I guess nicotine kind of is a drug, but access to any harm reduction tools leads to increased harms. You examined how nicotine bans and other drugs bring similar consequences. Also, the ways that the vaping industry seemingly and ironically supports some of the same stigmatization that you're seeing, and misinformation and disinformation against these products that you saw in the drug war. Can you explain that more and how it could be addressed so we're not working against each other?
Mm-hmm. Yeah, so I definitely want to highlight some parallels between these two movements that I've identified. You know, we have the traditional harm reduction movement and we have the tobacco harm reduction movement. And I've been noticing that, you know, there's a disconnect between these two communities. If you go to the, you know, the traditional harm reduction conferences, you go to the tobacco harm reduction conferences, there's different populations. And I feel like this disconnect is leading to a lot of the harms associated with both our movements. So, you know, Mariah mentioned like the NIMBYism. You know, I don't want people vaping in my vicinity because I see them. And it's the same argument that people use against harm reduction. You know, I don't want a supervised use site in my neighborhood because, you know, they're going to be in my backyard. But if we pay attention to the science says that supporting harm reduction policies doesn't increase drug use. And that extends to all types of drugs. And then, because this goes back to my point of the standardization as well. In the vaping industry, I hear a lot of notions that, you know, vaping is different from vaporization, which is different from heat not burn, and it matters if we have a liquid as the starting substance or a solid. And I feel like that's all nonsense. You know, the important thing that we should focus on is that we're vaping. It's vaporization, it's a harm reduction tool, and by focusing on that, we could then bring together our communities, you know, bring together the harm reduction and the tobacco harm reduction communities. And why do I identify this as like a big issue? I mean, I'll give 3 examples. First one is at public health trainings. You know, I remember working at a syringe exchange, essentially, and somebody came in, a physician, came in to talk about vaping and then talked about how vaping causes a popcorn lung, and it was the cause of EVALI. We know that's not correct. It was due to drug prohibition. If there was no drug prohibition, there probably wouldn't have been EVALI. Second point, city council events. You know, I've gone to, in Denver, I've gone to a city council event on supervised use site, and guess what? There's only like the traditional harm reductionists there. I went to another event on a flavor ban, and there's only the tobacco harm reductionists there. But if both communities were there to support each other, you know, the supervised use site bill probably would have passed, and the flavor ban probably wouldn't have passed. And it didn't because the governor ended up vetoing it, which is good. But, you know, we need that support from the beginning. And third example, like I mentioned, was the conferences. You know, I was just at the National Harm Reduction Conference, and it's probably the biggest harm reduction conference in the US, and I interviewed people about tobacco harm reduction, and the information that people knew about it was extremely limited, and that's such a big missed opportunity for both our communities. We'd only be stronger if we supported each other, and for us to be able to support each other, we need to, you know, respect basic science. And by respecting basic science, you know, we need to standardize things. And by standardizing things, we get to points like, you know, vaping is harm reduction, tobacco harm reduction is harm reduction. And by, you know, by supporting connection, I think it would be a better result for both our movements.
Fantastic. Well, I expected you guys to talk a lot more on your videos than what you did. So we're at question time, and you helped segue it into the science. This seems to be like the big problem, and all of this, you know, this seems that following the science doesn't really seem to work for everyone. How can we better address this? And I'll start with you, Ariel.
Gosh, so this is a tough one because the science supporting harm reduction is out there and it's strong. I think we have to, as discouraging as it is, I think we have to keep publishing sometimes. I know it's getting harder and harder, especially for those of us with industry ties to get stuff published. But it is worth the effort to get stuff out there and be able to cite it and have that stamp of approval as far as a peer-reviewed publication. But I would say the other side of it is that science is just not convincing to some people. Like we are, as humans, are fundamentally not always rational, and I think you know, it's not the science that's necessarily driving a lot of the opposition. So I think having the consumer voices is really, really valuable to tell those anecdotes, because there's plenty of anecdotes out there that are alarmism about you know, EVALI or youth vaping, but there's also really, really compelling anecdotes. And at the last panel, I watched Lindsay moderate some really compelling stories from people who used to smoke and found great success in vaping, and they credit it with saving their lives. So I think having those personal anecdotes out there is really important.
You guys can just pass it along to each other. I don't care who goes.
Yeah, I find it immensely frustrating because I think the science is there and it has been done, and a lot of things are, I think, settled science. Vaping is less harmful than cigarette smoking. Vaping helps people to quit smoking. Nicotine does not cause cancer. Nicotine vaping did not cause EVALI. Popcorn lung is not a problem with vaping. These are all settled science. These aren't debatable anymore. And yet we're still debating them, and people are still using these arguments. And I don't know how we get beyond that. And as a physician, I feel I have an obligation to educate other physicians. But I'm just finding that such a hard thing to do, not least because of the funding issue. I have previously accepted funding from the tobacco and vaping industries, so Health Canada isn't going to hire me to be a spokesperson on this topic. So it's just very frustrating how we actually do the knowledge translation, and if anybody has any good ideas, I appreciate them.
So I think that I would talk about why are they lying and why are they misrepresenting the science. So I think it's very important to look at the language that they're using. So this is, again, you know, the language sphere. Most publications occur in the event-forming sphere. This is an event where they are propagating their ideology and their ideal vision and their utopian vision for the world. So it's done through publications, it's done through regulations, and the language they use, so there's a really useful and analytical tool which is called discourse analysis, and that is very, very revealing if you use discourse analysis. Why have they used that word? You know, and it reveals their underlying ideology and utopian vision, which is everyone is to be, you know, no offense, white, skinny, you exercise a certain number of times. You know, it controls, there are rules about absolutely everything, how many times you should be having sex a week and whether or not you should be wearing, you know, or using barrier methods of control. Absolutely everything. There are rules, what you should eat, what you should do. And I guess most people, it's like being a goldfish in the goldfish bowl, and they're not aware of the water around them. They're not aware of all of the rules about how you should behave and how you should be like, what language you should use. And so the lying and misrepresenting is all part of this multi-sphered, polyspheric action to control the group. What we have is one group who believe you should all be like them, and we have people who are not like them, who just want to be like they are. And the lies are all about that. They don't want us drinking, they don't want us, all of those other things, using substances. There's also the religious kind of, many religions are, so when people have the whole argument about addiction, this is another huge narrative they're using about addiction. Addiction is bad. Addiction is, then you're not healthy. What they're partly talking about is this person is fallen. They're in the spiritual sense, they're a fallen person. If they would do something outside of the rules, what else would they do? They're a dangerous person. We don't know what they're going to do next. They're possessed. These are words they use in their narrative. Possessed by nicotine, brain worms, you know, and all of their imagery they're trying to get across to make people scared. What you need to be scared of is what they will do to you if you disobey and you don't follow the rules they're trying to form and the group.
A lifetime addiction to nicotine is one of the things they put out. But I think also what you kind of pointed out in your video too, I mean, when you start identifying us, there's automatically a them, and especially people who smoke or use safer nicotine products, I mean, they've already been stigmatized for being people who smoke. So, and to Kevin now, following the science.
Yeah, a lot of great points made, and I feel like it really highlights why we have to understand and remember the fact that harm reduction is a movement for human rights, and it's a movement about the rights of people who use drugs. And by remembering that, we remember that, you know, drug use shouldn't be associated with, you know, something negative or bad or whatever. It's just drug use just is. In certain contexts, it could be beneficial, it could be harmful, just like anything else. And I also want to highlight, as a person who's been vaping for like 10 years and kind of been entrenched in THR and have seen how, you know, the science seems like it's going backwards. The more time that passes, the more that people believe that nicotine vaping is the culprit of like EVALI. And I feel like this really highlights why the disconnect aspect that I've been talking about is so important. You know, we also talked about like language and standardization. And when we talk about tobacco harm reduction, people don't put it in the same, like, you know, same box as harm reduction. At least in the US right now, we see like, you know, our president, our federal government supporting some harm reduction policies, but tobacco harm reduction is not spoken about in that same vein. And it goes back to, you know, that lack of disconnect and supporting that bad science. How do we combat people from supporting this bad science? Well, we need like the consumers, we need the people, we need people to rally up, we need numbers. And with, you know, with disjointed communities, with no standardized definitions for what harm reduction is, then we're gonna continue being disjointed communities, and people are gonna keep supporting the bad science because there's not like enough people to be like, hey, this science is not good, we should be paying attention to this because, you know, maybe they don't have conflicts of interest, or, you know, they have good, you know, good methods, for example. But yeah.
Go on.
I was just going to make a point about what you said, John, about public health versus capitalism. You know, universities are now businesses, and they are profit-making ventures and entities. And many people working in public health, it is a capitalist structure. It is about making profit. And many people in public health, it is about the money. Some people maybe have social justice, a commitment to social justice, a commitment to equity, but at the end of the day, you've got to feed your kids, right?
Absolutely. Well, okay, this goes into the next question. We have a few Q&As, and I will get to you guys that have been joining us online, but who ultimately is responsible for informing the public of both, you know, on reduced risk products? Is it the manufacturer? Is it the public health community? Is it the consumer? And I'll let Kevin start this off and just go on down.
Does anybody else have something more, Press?
Yeah. Sure. So Olivia Wachowski recently published a really great paper looking at a version of the IQOS modified risk claim that was recently authorized by FDA. And doctors, by and large, are unaware of IQOS and the harm reduction potential, but that's sort of a separate story. The point of the study was that doctors didn't trust the reduced risk claim unless it was presented as being authorized by FDA or endorsed by FDA. So I think that's really important. I think there is some distrust of government health messaging. And some good examples why that might be the case. But I think the fact is that most of the public will trust a claim endorsed by public health agencies more than they would trust an industry claim. So I think it's essential for public health agencies to effectively communicate about reduced risk products and correct some of the misperceptions out there.
As a physician, I'd like to say that physicians should be at least part of the answer to this question. And people who smoke attend their physicians regularly for smoking-related illnesses. And as part of that discussion, they should be informed about all the options that are available to them. But that conversation can only take place if physicians actually themselves are aware of all the options that are available to them. And at the moment, they're not. So we do end up in a situation in which a lot of the information is coming from the industry. And that can be okay. I mean, we trust when a car advertisement says this car does this many miles per gallon, that's going to be a true statement. But in Canada, we have an awkward situation. In which the people in the industry, the people who run vape shops, are not allowed to tell their potential customers that vaping is safer than cigarette smoking. So we're banning the industry from communicating effectively from consumers. At the same time, when physicians aren't able and aren't willing to communicate effectively. So it's not surprising that Canadian consumers and probably consumers around the world are very confused and very unaware of their options.
Thank you, John. That, gives me something to say. No. What you say, what you do, your acts and your words in this competing ideologies world, which what you say and what you do are political acts. So we have ideologies, they form, say, a political party or a religion or public health, a sector. And if you vape, many people who vape see they're just doing something personal, it's a personal choice, but in this environment, it becomes a political act. It's seen as, by the other ideology, an opposing political act, a protest. The blacklisting, the cancellation, the censorship is about shutting down that other ideology and opposing political parties' ideology or opposing religion's ideology and opposing ideology in public health. We don't all agree.
Is it okay?
Did you want to add? Well, did you want to do the Q&A that was specific to you, or did we want to do? Well, we'll do Paul Blumers first. So Paul Blumers asked, "Do you think that the science presented to the public and the agencies is too complex? I kind of like this. I deal with American lawmakers, and they prefer everything in bullet points, as they've told me. As I've joked with them, they'd prefer it if it was in crayon." Should we be writing the science in more simple terms for people to understand tobacco harm reduction? Who wants to go with that one?
So I feel like we're all talking about how kind of how do we parse out the good, bad science, whatever that means, and I feel like the next question really goes together with that last one. But somebody put while the benefits of a unified harm reduction movement would clearly benefit all those involved, from a scientific standpoint, THR vaping is clearly different from marijuana vaping versus dry herb vaping versus heat not burn. the risk, liability, particulate matter, toxicology are all widely different. Is it really beneficial to lump all vaping together? And I feel like the answer to that question is yes, especially going back to the last question, because should it be written in more simple terms so it's understood? And I believe yes, it should be put as simple as possible. Any sort of vaporization, heat not burn, vaping, whatever, it should all be lumped, because obviously we're having an issue where people don't know what the good science and what the bad science is, and it's obviously presented in a way that people don't know about it because it's been overly complicated for no reason. And we run into this a lot in science, and that's how people use science to misinform and disinform the community. We need to just break it down and make it simple. Vaping is vaping, it's harm reduction, period. And I feel like that would be beneficial to our movement.
The words good and bad, which we're hearing here, that's where the whole moral thing comes in. So something's good or bad, that's a moral opinion. But they're all created. What's good or bad in one group may be completely thought of as bad and good in another group. So I believe in terms of the science, it needs to be communicated, Communication 101, in different languages for different audiences, and everybody's opinion is important. It shouldn't be that there are just good science, and bad science. There obviously is very poor, methodologically and flawed science, but everybody's opinion should be on the table and be able to be aired if we're going to get through this.
I think when you're communicating science, you have to do it at a whole pile of different levels. And some people just want the 140-character tweet, and you can do it that way. But you also need to back that up, because anybody can make a tweet that says anything. And so you do have to have the things that go into more detail. And I'd like to take issue a little bit with Kevin, because I agree that there are similarities between all forms of vaporization, but it matters absolutely and critically what the thing is that you're vaping. And if you're vaping vitamin E acetate, you're going to be in big trouble. If you're vaping cannabis, that's another thing. And there is a very real difference between a heat not burn product and a vape. And that makes life more complicated. It offers people more choices. But I think you have to explain that those things are different and explain why some people might prefer heat not burn and some people might prefer vape.
You want to respond to it?
Yeah, sure, they're different, and I feel like getting super nuanced about it, it's an issue with the audience. So sure, heat not burn and vaporization, they might have their small differences, but I feel like those differences are better for like the researchers, the academics who want to get into the nuance. But for the consumer, all the consumer needs to know is that vaporization is harm reduction, when you're not smoking, you're vaporizing. It doesn't matter if you're starting from a solid or a liquid, you're still vaping. And what the consumer needs to know, what policymakers need to know, is that it's harm reduction compared to smoking. And I feel like all of these nuanced details, it's not bad to get nuance, but it unfortunately confuses people. It's led to misinformation because people are taking this info and just not representing it clearly, if that's making sense. So I feel like, yes, we need to have some sort of distinctions, especially if we're academics, if we're in a research lab trying to study this. But for the general population, for all things concerned, vaping, heat not burn, and vaporization, I think it's the same thing because it all causes, it's harm reduction, especially when you compare it to smoking. Yeah.
You have anything to add, Ariel? I mean, you work with the Kleenex of vaping, is what I call it, what I call Jewel, but so you know how much the language can matter.
Yeah, so I have mixed feelings on this. I think on one hand, it is good, if possible, to get a simple message out there and communicate the scientific results in a clearer manner that's accessible to a lay audience, and also to get away from some of the academic, esoteric language, which is difficult to parse unless you have a lot of expertise in research. But on the other hand, I think there's a concern that in trying to simplify too much, that stuff can be swept under the rug that's a little bit hard to explain. So, like, for example, it's a clear message to say that there's a lot of youth vaping and that youth vaping might lead to smoking, that the gateway argument, which I've had a lot of papers sort of debunking, but it's a complicated argument to make that. It's it kind of takes a technical explanation to explain common liability and how, the youth that vape have pre-existing risk factors that would have otherwise predisposed them to smoking. It's a very technical argument to make. So I think there is a danger of losing some of that if simplifying the language too much. So I think it's a fine balance.
Yeah, I think, Kevin, you may be guilty of undervaluing the intelligence of the nicotine consumer. And if you look at the amount of time and effort people make into choosing which car to buy, which golf club to buy, which cruise to go on, people are capable, when it's a matter that they take seriously and they're interested in, on evaluating relatively complicated information. And I could summarize the difference between heat not burn and vape in one page, and I think I could do it at a high school level language. And I think that's the information that should be available to people, because I think there is a significant difference between choosing heat not burn and choosing vape.
We have questions, or? I don't, how are we doing Q&A on the, oh.
And there's Excellent, thank you. Richard Prone from the Safer Nicotine Wiki. Would you be able to talk a little about going by Dr. Glover's kind of model, how do we try and bring those different groups of people closer together so that we can maybe, find out what we have in common and use that to actually work towards shared goals? And also, if you would be able to talk about how we can bring information to people at the right level for them to understand, so that if they want to go digging, they can find the technical details if they want them, and also that they receive a summary from somebody who they find trustworthy enough so that if they don't want to go digging into it, they can read a short summary and go, oh yes, well that's harm reduction, for instance. And the third point was, as I came into vaping, and yes, it saved my life, I see the harm reduction principle there. That actually opened my eyes to harm reduction elsewhere. Why and how have we ended up so siloed that harm reduction isn't harm reduction? It's tobacco harm reduction or drug harm reduction or gambling harm reduction. Thank you very much.
Thank you, Richard. And so kind of summarize what you mentioned, talking to the opponent organizations, summarizing the science, and then also how did we get to this misinformation in regards to harm reduction. I think they all kind of work together, and I think that goes along with your video a lot. So, Marwa?
Yes, so I do want to acknowledge Carl Phillips, who helped me write the paper on the model. And unfortunately, I think if you accept that there are different societies that have formed over our history as human beings, and that those groups develop different belief systems to control their societies. And in the world, we have very many different societies with different belief systems. We do not all agree, and we're not all going to agree, ever. Unfortunately, with the anti-vaping fundamentalists, and fundamentalists in that sense, with the spheres model, all of their spheres align. So then they don't see any need. It serves their purpose to not communicate with us because we are illegitimate in their mind. We are wrong, we are fallen, we are not worth speaking to. And
how do we actually solve that problem and start to move towards each other?
Right, so
At the moment, things are just getting further and further apart.
Yeah, we're getting further and further apart because at some level it is a war, although it's a war of ideologies. But wars are a fight, and it's a fight to win. We kind of, social justice, people first, regardless of where they are at, so the person at the centre, and we seek to understand their circumstances, and so we are ideologically opposed on a number of spheres and levels. What we need to do is fight. We need to fight. We need to stand up for the human rights of people. We need to stand up, and it is a social justice fight. And we need to expose their ideology and what's the purpose of it. We need to expose the lies. Thank you for doing what you do and what Clive does. We need to do that more. We need to explain why they use that word. Why are they creating this moral panic around a vaping epidemic? Why are they saying to people that vaping harms when there is no evidence at the moment of harm? 0 people who vape have died in 20 years, 20, how many? 20 years so far. So we just need to keep fighting. We need to exposing the lies. We need to be analysing the language and communicating to people as well why that doesn't apply in this instance.
So one more question, sorry. How do we differentiate between the people that we need to fight then, because we have no choice, as you've just made clear, and the people on the harm reduction side who should be allies, but we seem to be fighting them as well? Thank you.
In a war, if you're on the other side, then you face costs. Costs of injury, costs of the loss of your career, the loss of your salary. So, everyone's going to consider that it's going to be different for every person, whether they can afford to fight, and not everyone can. In harm reduction, and you can speak to that probably more than me, Kevin, but I do think that there is a fear of getting dragged into this other war. There's, they've had their own sort of war for quite some time, and what we have is a very vicious war going on. Kevin?
Yeah, I mean, like you just mentioned, we know that vaping is safer than smoking. Leads to reduced harms. But when I go to harm reduction conferences, I don't see that notion mentioned anywhere. So I feel like a simple answer is, I'd encourage anyone in this room to attend the traditional harm reduction conferences and get to a point where we're more unified. I interviewed people at the, yet again, traditional harm reduction conferences, and when I asked people about vaping, people were just scratching their head like, I really don't know. But when I asked them about, sterile syringes, it's like, well, of course, sterile syringes is a harm reduction tool. So we're getting to a point where vaping is not considered a harm reduction tool by many, but sterile syringes is, and they're both harm reduction tools. So my call to action for everyone in this room is go to those other harm reduction conferences and collaborate with each other, learn from each other.
I don't know how bad it is in other countries, but you talk about the need for communication and to talk to people on the other side. In Canada now, it is almost impossible for me to do that because I am physically banned. So the big Canadian Smoking Cessation Conference every year in Ottawa, I've been banned from that from the last 2 years because I attend events like this, because I've written a report on flavors for the Canadian Vaping Association. The people who are involved in tobacco control that I used to get on with when I talked about raising the age for tobacco to 21, when I talked about getting people to stop smoking for safer surgery, these people were my friends. Now, the majority of them will not reply to my emails. They just ghost me. I gave a talk to physicians on safer nicotine products. I invited one of my colleagues, a guy that I used to work with. He said it would harm my reputation if I attended your event. So he's not prepared to come and listen to me to speak because that was an industry-funded event. So I can't talk to people in Canada anymore. It's crazy.
seem to have picked a side, and now I'm stuck with it, even if I change my mind.
All right, well,
And the sad thing is, I love this expression, I never learned anything by talking to people who agree with me. Because when I do get the chance, and it's interesting to understand where these people are coming from and why they think the way they do, but unless I give them the chance to explain to me why they're saying what they're saying, you know, and someone says to me, okay, there is a gateway. And I said, well, look at the graph. Like, where's the graph? Like, smoking is going down, vaping is going up. And he said, oh, well, we haven't seen it yet, but it's going to come. Well, now I know something about where he's coming from. He's not looking at the data as it exists. He's looking at some hypothetical data that may or may not exist in the future. You know?
That's why I tend to get involved in...
yeah, well, actually, and Ariel can, and then we also have another question. So if she goes, and then you'll go with your question next.
Sure, I'll be quick. So starting off on your third question, why is it that tobacco harm reduction seems to be going or completely disconnected from other types of harm reduction? I think part of the driving force is from academic incentives. And I'll have another brief academic rant. If you haven't seen my first one on peer review and Clive's list, I'll be happy to share it privately. But part of what academics are told is that you have to hyper-specialize in something. So there's separate grants, there's separate agencies. People devote their entire careers to hyper-focusing on something. So if it's the case of e-cigarette use in youth, that's what they spend their entire careers focusing on, and then they lose sight of other things in that have been published in the YRBS recently, such as the extremely prevalent binge drinking, alcohol use, mental health challenges, and both of these are both more prevalent and more immediately harmful to youth than vaping. But because academics are not talking to each other, this kind of gets lost. And now, of course, we see a split within the tobacco community research itself, that there's two different factions. And I think one way of addressing that from the literature, at the end of my video, I talk about some kind of preventive actions to prevent some of the issues that arise in the literature, starting with good peer review. And I know peer review is a problem, as you talked about this morning, especially for Harm Reduction Journal and others. But peer reviewers have to do a really thorough job, and it's a thankless job. Everybody's swamped, but it does start with peer review. And I know myself and a couple of colleagues have been able to balance out some of the initially imbalanced manuscripts to provide a more comprehensive perspective. There's also things like post-publication critique. Oftentimes, if you write a letter to the journal, sometimes it's censored depending on who's writing the letter. Oftentimes it's not published at all, but there are more and more options nowadays for posting a critical review on PubPeer or Chaos. It doesn't get much visibility, and it usually doesn't have an effect, but there have been some important corrections that have led to either retractions of articles or corrections that basically defang a potentially harmful article.
Fantastic. We have a question over here.
Yeah, no, it's two very brief comments, Roberto Sussman. One is that, yeah, it's true that there are differences between the different harm reduction products, like heated tobacco is not the same, but there are even more things that these products have in common, which is lack of combustion. And this is the way to describe them, because you can cascade later with details, but in general, the issue is the lack of combustion. And whether that you produce an aerosol, whether it is from a liquid or from biomass, or as it is done in dabbing and different forms of cannabis, from a solid, right? And it is important because it intersects all this usage. Cannabis can also be smoked, and the smoke of cannabis is as toxic as the smoke of cigarettes, right? And those who vape cannabis are also doing harm reduction. And those who have their instruments, it's a plethora of instruments there that you put the stone and then you light it up, and you are also generating an aerosol there. So there is more unity in these things, and it intersects several substance usage. So And this has to be exploited, not separate in compartments, but to emphasize the unity of this. This is one comment. The other is on the fundamentalists, which we have all bumped with one of these, and I have bumped with them personally, and there was a time around 2000, it ended in 2019, where you could still talk to them, right? Before happens what you are saying in Canada, but there was a time you could talk to them. And something important we have to understand about these people is that they think they are doing something good for you, right? This is important because you have to distinguish between the scoundrel that wants to beat you up or hit you or whatever, wants to cause you harm, and those who are doing horrible things to you for your own good. These people, they will never repent. In the factory, the foreman who is hitting others, he feels sorry sometimes. He goes to church, confess, but the person who is crusading, it is never going to feel sorry. He's doing the right thing. He will say, or she will say, well, some people die, these are collaterals, whatever, but the goal is, etc., you know? So the model for understanding them, and I understand them because I come from a Spanish-speaking country, is the Spanish Inquisition. The Spanish Inquisition, officially, they said, we don't want dead people. We want repented people, right? And they were honest in that. And this is the type of thing we're facing. They don't want to kill us. They want to convert us, right? And they think they're doing it for our own good. It's important to bear this in mind, right? So these are my comments.
No, thank you for them. I kind of want to go to his first one, though, and I think that's what's the harm and combustible cigarettes as combustion and this whole demonization of nicotine. I guess, I mean, we are looking at tobacco harm reduction the next decade. How can we try to, solve that? And, I just remember a few years, I remember back in the 90s, you could quit smoking cigarettes and they said 3 days. And then now it's this whole lifetime addiction to nicotine and bogeymen are coming after you and your kids. How do we reconcile that?
Just want to say that I'm a big fan of your one comment that said we should focus more on the similarities, which is not combustion. Just go with that. Yeah, it's a great way to summarize it.
I agree. I would say maybe it's appropriate for messaging on different levels. So I do think that, given the cliff of harm reduction, I think it's appropriate to talk about combustibles versus non-combustibles, but also maintain the precision that allows someone to distinguish between heat not burn and vapor and that sort of thing. So I think precise language, but also simple would be good.
I just wanted to pick up on what you said, Roberto, and I can attest to the fact that they are believers. It is like a religion, public health religion. They do believe that in their, and that they are doing what is the best, what is for your good, and what is for the good of the world, the complete world of humanity. And politicians, I think, are a little bit different. Most of the people we're up against are not politicians. They're academics. They're the true fundamentalist believers, the priests. And politicians understand about negotiating. These people don't. They're not willing to negotiate. And there were times when I was getting to the end or I started to see cracks, the use of brainwashing techniques, because I was trained in psychology, and, really blatant brainwashing techniques used at conferences. It is more like dealing with people who belong to a religion.
Yeah.
And I think we have an audience question, or a couple, so you and then you. Okay.
Well, ladies first.
Oh, there's a gentleman. Woo.
Thank you. Fiona Patton, Australia. So, again, I'm sorry. But I take up your point because, I've been a harm reduction activist for decades, long before I went into politics. But now, when I speak to my colleagues, and, we started a supervised injecting room, and I speak to the medical director at the supervised injecting room around tobacco harm reduction because, he's saving the lives of many of the clients of that centre, but they're going to die from smoking-related illnesses. They may not die from a heroin overdose. Big tobacco immediately. First thing he says to me. And it is with even at the International Harm Reduction Conference that I went to in Melbourne this year, we were talking, there was concerns about big pharma. So, I know the Canadians with some of the work that they're doing in distributing cocaine and heroin. Again, the activists were complaining about the influence of big pharma in that. But the minute I start talking about tobacco harm reduction to people, again, it's big tobacco. And I don't know how to get around that and these are harm reduction activists. And I know, John, you've been facing it in the medical profession, but how do I circumnavigate that?
In my ideal world, we would have 3 separate commercial sources, maybe 4 separate commercial sources of nicotine, right? So I would love to see combustible tobacco, oral nicotine pouches and snus, and vape as 3 separate businesses and 3 separate categories. And so everybody would be in their lane and everybody would be competing for the nicotine market. And I somewhat regret the fact that Swedish Match has been taken over by PMI because I like the idea of having a company that was an oral nicotine pouch product. I kind of regret the fact that Juul has been taken over by Altria because I think it would have been easier and simpler if we had an independent vaping industry that was not bought up by tobacco. Unfortunately, particularly in the States, we've now got a situation where all forms of nicotine, except medical nicotine replacement therapy, are controlled by the tobacco industry. And I think that's unfortunate. It's a step backwards, and it's going to make it more difficult for people to accept tobacco harm reduction.
Do you want to go on that, or do you want to? We're running out of time. We have another question. So, and I want to kind of follow up with a future question for y'all. So.
Hi. First and foremost, full disclosure, I am from the industry, but I have a second professional hat, and that is a military medical professional. And the reason I'm bringing this up is one of the issues I'm encountering in Israel is the fact that the military, on the one hand, acknowledges that vaping is better than smoking. On the flip side of it, we have an epidemic of disposables blowing up, no pun intended, of course, with the military authorities that don't know how to deal with it. And my question is, how do we prevent independent authorities, medical authorities like the Israeli military MedCorps, from falling into the landmines that, again, no pun intended, that PH, MOH, for example, in Israel might put in place to those who are willing to actually listen, learn, and create an independent opinion on a topic like tobacco harm reduction or harm reduction? Thank you.
So with both your questions, there are strategies. You might understand, coming from the military, there are strategies, war strategies, strategies for controlling. So they create these narratives to control the way that people think about things. And now, I was picturing this kind of circle. You do, it's bad for children. Then there's so many, and we use them in tobacco control. So I can recognise, them, the gateway, so they're just strategies they roll out. And when we fight back with intelligence and with evidence, and the evidence isn't there for what they're claiming, and that one falls over, they just pull the next one out. It's like, they have an armory of strategies, and they'll just pull one out, one after the other, And the narrative is put out there based on lies, based using very strong communication strategies, brainwashing, manipulating the way people think about things. So on the one hand, yes, look to the evidence of what are the harms of disposables, what could be done about if it is bad for the environment, but look at what the purpose is. So, in Māori we always say, for anything, for any question, he aha te kaupapa. What is the purpose? What is the underlying purpose of this action? So you look at that. The big tobacco thing, that of course we had that when we only had combustibles, and now they've dragged it out again. It's just a strategy, and try to look at their purpose that's underlying it. What's their ideology trying to achieve?
One of my other hobbies is I'm a hiker, and in the hiking community we have a big philosophy. If you can pack it in, you can pack it out. The stuff that you take, you bring back. And I'd have thought in the military it'd be fairly easy. Like if you have room to take a disposable vape onto an exercise, into a war or whatever, then you have the room to take it back. And I'm surprised military discipline can't cope with that.
I think, again, maybe the solution is to take a step back and look at the wider context. So, like for disposables in particular, the thing that comes to mind is the work that Harry Tatton-Birch does out of the UK, suggesting that among adults, total nicotine use of any product has remained stable even as disposables are increasing, which suggests that it's taking away from smoking. Might be a slightly different story in adolescence, although much of that is experimental in nature. But again, taking the wider picture of what's happening with other products, again, I think we have to fight this hyper specialization of focusing on disposables without taking into context the wider picture, because there's a lot of great evidence from population level trends and econometrics showing the strong substitution between tobacco products. So always taking a step back and looking at other products is a good idea.
Okay, well, we're going to be Oh, we got another question, or? Yep, I mean, well, there's... Richard, you're good. Okay, sorry. Tom.
It's on. Hello, Tom Gleeson, Nicotine Alliance Ireland. I'm going to be devil's advocate. It's not tobacco harm reduction unless you're already addicted to tobacco. If a naive user uses these products, that's a harm imposition. So are we left with a situation, specifically to you, Maria, what we're facing in New Zealand, where you will have to sunset combustibles for harm reduction to be acceptable to the antis?
Oh no, they're going to sunset the whole lot.
Oh yeah.
Yeah,
well,
it's
obviously,
cigars and everything, yeah.
Combustibles is the first step. Then vaping, they're looking at sugar, not driving cars anymore, the whole World Economic Forum plan for the world. The people, one of the strategies is to co-opt every group, to get on the board of the Society for Research on Nicotine and Tobacco, and change the criteria for membership, and change the purpose of it and the policies of it. Get onto the Cancer Society, get into politics. That's also a strategy that's being used in New Zealand. Get a public health person in there. Our Associate Minister of Health is from the University of Otago, our centre of anti-vaping fundamentalism. So you infiltrate. Looking at war strategies is probably very useful in this area.
And I'm going to push back on the idea that it can't be harm reduction if it's a naive user, because there are predisposing risk factors that precede different kinds of tobacco use, and there's strong substitution between them. And exactly what we're seeing if there's an increase in never users or never tobacco users that are vaping, that's exactly what we would expect to see as substitution happens on a population level, because it's an alternate initiation pathway.
Any more questions from the audience? Well, I've got my, Martin, we only have a few minutes left, so I'm going to do my last question, if you don't mind. What's the next decade of tobacco harm reduction? Is there hope? You know, and if you guys were going to give a message to consumers and policymakers, especially over the next few years, of what we should be doing, what would you tell them?
I guess I'll go first since I have the mic. Part of me is pessimistic, just seeing the worsening division that I see in the literature. But on the other hand, I think there's maybe, even in academic circles, more of an acceptance that e-cigarettes can have a harm reduction potential for adults who smoke. So I think of the saying that, you know, a truth is first ridiculed and opposed and then eventually accepted as common sense. And knock on wood, I think I'm seeing the first signs of that.
We're going to be optimistic. Although we live in a capitalistic society, governments are prepared occasionally to put their finger on the scales and weigh the balances a little differently. And if we look what's happening in transformation of transportation, the government is prepared to subsidize electric cars. And recently the government in Canada has given billions of dollars to set up an electric battery manufacturing plant for Volkswagen. So in a logical world, why isn't the government subsidizing Swedish Match or Juul to make vape? Like, that would be a logical thing to happen because this is in the public interest. And I mean, I know that's a fantasy world, but if you want an optimistic vision for the future, imagine one in which the government is supporting transformation in tobacco in the same way that they're funding transformation in the fuel industry or in the automobile industry.
I'm not so sure. I think if you look at history, there have been countries that were a democracy, and in a very quick time they fall, and they're no longer a democracy. They become one of those other political systems, and people lose freedoms. One of my reports, I looked at where all the indigenous people were in the world, what countries, and to understand what had happened there in terms of colonization or the country being taken over. And it was interesting. I think there's like 99 or 120 countries. It's a thick report available online. But you know, it was a really interesting exercise with what I learnt looking from Ottoman Empire to today, that around the world empires form, they expand and they contract. And this is going on all the time. So we're all part of this. We're all being affected by this. There's a new empire forming, think Star Wars, and we're all being subjected to the thought control and manipulation to get us to accept this new empire. Or it might be more like The Matrix. The Matrix is another good movie. You're either plugged in or, you know, you're Neo. And I'm going to be part of the resistance. I like that there are lots of different cultures in the world. I like that we have difference. I think that innovation comes from difference. I think that the future of humanity actually relies on us being different and maintaining our cultures. But there is another almost becoming predominant ideology in the world, or certainly trying to, that believes we should all be the same. We should all speak English. We should all believe in the same God or religion, that we should all, you know. So I would just caution, don't think that your current democratic system or your current socialist system will be forever. It won't. This is going on all the time. Learn some history and see that things don't last, they do change.
It's up to you now. You want to say any
All
more
right.
thoughts?
If I have any final words, just try to go to those other harm reduction conferences. Let's learn from each other. Let's collaborate with each other. Let's get to a point where we all agree on like the definition of like what vaporization is, what vaping is, heat not burn is. Let's all get standardized and let's collaborate so that we could support harm reduction policies. Because if, tobacco harm reduction policies are supported, so are other harm reduction policies and vice versa. The more we help each other, the more all of these movements will be able to push forward into the mainstream society and, be a thing that we all have the harm reduction tools that we need.
Close out, thanks. Well, thank you everybody for joining us. And I was so worried we wouldn't have enough to talk about. We made it on time. Again, if you haven't seen their videos, watch all of their videos. They're amazing. If you need like a little summary, you can see my tweets on it too. And I also have notes. If I'll just email them to you. And thank you, panelists, for joining us today.
Again, Moira.
Yeah, that was lovely. My name is Martin Colley. I am from Glasgow in Scotland. I'll explain a wee bit more about what I do in a moment. Often when I do sessions like this to an international audience, I'm very conscious of my accent. But as it turns out, it's like when you're waiting on a bus, you've actually got 3 Scots on the panel today, so this is a major test for you. And if you're struggling to understand anything we say, just tune in to the translation service and turn it to English, and you'll be fine. My name is Martin Colley. I am the chief executive of a cancer charity, the Beatson Cancer Charity, which is based in Glasgow. I've had a career predominantly I'm a nurse by profession, but I had a career predominantly in the third sector, working and managing organisations who deliver services for people with drug and alcohol issues, people involved in the criminal justice system, people who experience homelessness, and of course very much driven by harm reduction principles, so I can resonate with this subject matter. The subject matter for this session is actually who has skin in the game, who's got a stake in the game here, and perhaps maybe exploring in a wee bit more detail what that means for each stakeholder, what are the responsibilities and accountabilities that go along with that. Right through from a consumer's perspective, right through to a manufacturer's perspective, and indeed a regulator's perspective, albeit we don't have a regulator on the panel, but it's a very important aspect to think about. We'll do this in the way that generally the conference has been following. I'll ask each of my colleagues around the table here, our virtual table, to say a few words by way of introduction, share a few reflections and observations, and hopefully what that will do is stimulate some thoughts in your own minds about asking questions, and then we'll just take it as it comes. And we'll try and moderate that in a way that covers all sorts of angles that we've talked about at the beginning. So please bear with us. I'm conscious again of the lighting in this room, so it's really quite difficult to see up in that far corner if you do raise your hands. So if you want to move into the main body of the hall, please do so. That might make it a wee bit easier. But as we get to the question and answer time, just please put your hands up. Say your name. Maybe if you get a question directed to any particular panel member, just let us know and we'll take it from there. Sound okay? Cool. So let me introduce my panel then. To my far left, we've got Chris Russell, psychologist and director of the Russell Burnett Research Consultancy, and a fellow Scot. And as we were chatting last night, I discovered that he actually lives right on the bonny banks of beautiful Loch Lomond. It is one of the most stunning places. Next to Chris is Moira Gilchrist. Moira also from Scotland. From the east of the country, actually, Moira from PMI. And we've actually just been talking before we kicked off about how strange it feels back home, but because the weather has been so good for the last 3 weeks, and you don't often get sunny weather back in Scotland, so it's been most enjoyable. To my right, we've got Fiona Patton, who's
Half Scottish.
Half Scottish. Yeah. Oh, well, there we go. You're getting I'm sorry. Fiona, who's an ex-member of Parliament for Victoria in Australia. And to my far right, we've got Samrat Chowdhury, a journalist and consumer advocate who'll give us very much a consumer perspective on the state of play as we stand. So, the subject matter, who's got a stake in the game? What's that stake about? What are the relevant factors to consider? And what does that mean in relationship with other stakeholders who are part of this game? Chris, can I start with you?
Sure. Just checking it's on, yep. Okay. So I'm going to hopefully make, over the next maybe 2 or 3 minutes, just make the case for why my field, behavioural science, behavioural research, is a key stakeholder for the future of tobacco harm reduction globally. I'd start by arguing that 10 years ago, the primary concern about e-cigarettes and other non-combustible tobacco and nicotine products, the primary concern among regulators and health authorities was what's in these products, what are the toxicological risks to individuals from using these products, and the world was very precautionary. We just don't know. They've not been around long enough, used by enough people, or tested sufficiently, so that was the regulators' concern. I would argue that for the past several years, and I would say for the next 10 years, regulators' primary concern about non-combustible tobacco and nicotine products will be about the risks to the wider population, the whole population. Who uses these products, and what impact does the use of these products have on the use of other potentially more harmful tobacco products? So I would argue, first of all, that the target of concern has shifted somewhat from the toxicological risks to individuals to the risks to the health of the whole population. And this then presents a new challenge for the manufacturers of the products and for people working in universities and other research groups in terms of what they study. I think, obviously, there are differences between regulators globally, but regulators fundamentally are looking for 2 sources of evidence in relation to these products. What is their effect on smoking cessation among existing adults who smoke? And what is their effect on initiation among youth and ultimately a progression towards more harmful tobacco products? And I would argue, unfortunately, and I'll use the example of flavours because that is perhaps the hottest topic of debate in tobacco harm reduction, flavours in different form factors. I would argue, unfortunately, I don't think behavioural research has been of the necessary quality in the past several years to adequately demonstrate the actual or potential benefits that flavored ends, flavored e-cigarettes, flavored other THR products can provide to adults who smoke. And as just a single example of this, there was a systematic review published in March of this year by Alex Lieber and colleagues, Ken Warner and David Levy, authors on the paper. And they reviewed 29 studies that had assessed cigarette cessation outcomes among adult users of e-cigarettes and had reported differences in cessation outcomes between users of tobacco, menthol, and then non-tobacco, non-menthol flavors, mostly fruit flavors. And they concluded from the review of these 29 studies that the role of flavored e-cigarettes in smoking cessation is at present inconclusive. Now, I'd take a guess that there's probably 10, 20, 30 people in this room who would personally testify to the effectiveness of a flavored e-cigarette in their own journey in switching from combustible cigarettes to an ends product. I imagine there's a lot of consumers who have primarily used and benefited from those flavored products. But my point is that and as was the conclusion of this systematic review, is that the studies that have sought to assess or test the hypothesis that flavored ends produce higher cessation rates than tobacco flavored ends have largely been of not of the highest quality. There are substantial methodological limitations with those studies, substantial heterogeneity in how these studies measure outcomes, which outcomes to measure, and ultimately what we're left with is a mess of studies that are all speaking different languages and no clear message emerges. So whereas there will be people who have personal lived experience of the benefits of flavors and multiplied by 1 million people not here today, unfortunately, the scientific research that has taken place in the past 5 years, as argued by this systematic review, have not been of the sufficient quality to adequately test the hypothesis that flavors do, in fact, reliably increase smoking cessation rates relative to tobacco flavors. The problem then is, in the real world, what we see is that regulators look at papers like this and they cite it in support of prohibition or restrictive policies. And as a consequence, flavors in the United States have largely gone away. There's an EU directive coming into effect in a couple of months that will ban characterizing flavors in heated tobacco products in the EU. And all of this, maybe we agree, reduces the consequence of reducing these options for adult smokers will, in all probability, be fewer adult smokers contemplating switching to a less harmful product, fewer adult smokers attempting to switch, and ultimately fewer adult smokers succeeding in their attempt to switch. So just to conclude, why I'm arguing that behavioural science is a key stakeholder here is behavioural scientists like myself and research groups that we work with and the behavioural science in-house at manufacturers, I argue, need to be better in designing the studies that will be a fair test of the benefits or absence of benefits of flavoured products versus tobacco and menthol flavoured products. We need to take a more uniform approach so that when we all conduct our studies and submit evidence to a regulator, we're not speaking 27 different languages to the regulator. We are agreed on standards and standardization of design and assessment so that when the regulator receives our evidence that there are commonalities of design and measurement across the evidence being presented. So sorry if I've went on just a few minutes longer there.
Thank you very much, Chris.
Yeah, sorry, just to say, behavioural science in conjunction with the other stakeholders who are on the stage.
No, thank you very much. A few themes that I'm sure delegates in the audience will want to explore a bit further, but let's move on. Moira, sorry, nearly called you Fiona there. Sorry, Moira.
My sister's called Fiona, that's fine.
Oh, you look very like her.
Here's the third Scottish accent. I have the Edinburgh version of the Scottish accent, which some would say is a harm reduction version of the Scottish accent. So
softer.
I hope I'm understandable. So I'm here, I guess, to argue the case of why the industry should have a stake in harm reduction. I just want to preface what I'm going to say is by I don't speak for the industry as a whole. I speak for my company, Philip Morris International. But I'll just give some broad thoughts of why I think we have an important role to play in tobacco harm reduction. And it really comes down to two main things. First of all, the will. So the will comes from ensuring that we have a sustainable business for the long term. And for my company, this vision about having a sustainable business started more than 20 years ago, before I even joined the company. And the vision was driven by the acknowledgement that smoking is harmful, it causes serious disease and premature death, and probably we should do something about that. It took us a long time to do something about that. It took us a long time to develop the products and the science that have ended up with us in the state we are today, which is having a bright future, I believe, in tobacco harm reduction. But nevertheless, it's a path that we set ourselves on 20 years ago. And in 2016, we announced that this is the future of our company. It's in fact the purpose of our company is to replace cigarettes with non-combustible alternatives that are a better choice than continuing to smoke. The second point of why we should have and do have a stake in tobacco harm reduction is kind of a dirty word for some people, and that's money. So the money, the investment that we have been able to make, which is $10.5 billion since 2008, have unlocked innovation, number one. So we've been able to design products, a range of different products that meet the needs of adult consumers, that deliver the aerosol that we would like to see, that is, has a much different toxicological profile than cigarette smoke. The second thing that money unlocks is science, and we've invested extremely heavily on the highest quality science, I think, that exists in this field today. That's going from laboratory science at the very basic in terms of chemistry, through to toxicology, clinical studies, behavioral research, and longer-term post-market surveillance studies. So with that investment in science, I believe has come an ability to build trust with consumers, build trust with the public health community, and build trust with regulators and policymakers. We don't assume trust. We make all this data available and ask people to make up their own minds. The third thing that we bring to the table under the sort of money bucket is an ability to understand consumers. So we knew our smokers before, but we've invested in understanding how to switch them and switch them as quickly as we possibly can away from combustible cigarettes to better alternatives. That has required diligence. It has required one-on-one conversations all across the globe, which we have carried out since even before the products were on the market. And then the final thing that this investment brings is also scale. So I'm not knocking startup companies. I believe they have a really important role to play. I'm not knocking small individual mom and pop vape shops. They have a really important role to play. But what the industry can bring to the table is scale of distribution, scale of manufacturing, and simply getting these products out there as quickly as we possibly can to the biggest possible audience that we can in as short a time frame as possible. So that's why I believe my company has a stake at the table. We didn't kind of wait to be asked. We kind of went and did it. And I think we've gone as fast as we can. We would like to go faster, and we call on all of you to help us do that. That's my case for industry.
Thank you very much. I'm sure the issue of trust again will be explored in a bit more depth a bit later. Why don't we just keep going, Fiona?
Thank you. In thinking about where my position might be in this, and as a former member of Parliament, I have a role to continue to influence politics, and I have a role to continue to influence in these areas of harm reduction, and particularly as a harm reduction activist. So I've spent decades in this area in establishing a supervised injecting room, in decriminalising sex work, in pushing for reforms around the decriminalisation of the use and possession of all drugs. With those campaigns, I've had allies. I've had the medical associations, the College of GPs, the harm reduction associations. But when we start to speak about tobacco harm reduction, those allies disappear, and we're standing there alone. And that's why, I think I continue to have a stake here and to continue to work. And, from what we've learned over the conference, particularly today, it is the justice issue as well here, and it's an equity issue. Because in Australia, we are a relatively wealthy country, and most Australians who are relatively well off don't smoke. Unfortunately, if you are one of our First Nations people, if you're Indigenous in our country, that you're probably we've probably got rates of around 40% smoking. If you are experiencing poverty, if you're from disadvantaged or vulnerable communities in my country, you are much more likely to smoke. And that is going to have a significant effect on everything. And I've been involved in inquiries into homelessness, inquiries into the criminal justice system, inquiries into drug use. Every time, disadvantage is one of the components and one of the issues that we need to address. So we need to address that equity issue in tobacco harm reduction as well. I get very frustrated. As an example, I was speaking to the medical director of the supervised injecting room. Now, here is a room where people who use heroin come into the space with their heroin, inject under supervision so they don't overdose and die. They then go outside and have a cigarette. 99% of them go outside and have a cigarette. Now, when I broached the topic of tobacco harm reduction with the medical director there, he just looked at me aghast and askance, like, what? You think we should be supporting big tobacco in here? And I'm afraid that in harm reduction spheres, that trust is not there yet. And I feel I need to start working on that. Also, I suppose, being an Australian, where we are leading the way in what not to do. And I apologise to all of you. Sometimes we are infectious in these areas, and I really hope that we do not infect your communities and your countries in the way that some of you are moving forward far more progressively. We now have an enormous illicit black market. Now, I come from the adult industry. I come from, from the first screeches of protect the children came when we wanted to ban pornography. Not just in my country, but around the world. It was protect the children, ban pornography. Now, of course, that it didn't happen, and it was we were able to argue for far more sensible restrictions on adult access to this product. The same as we need to be arguing for similar restrictions on adult access for this product. But I come from that background of fighting for the rights of adults to access a product that they should legally be allowed to access, but also fighting for the rights of small businesses to provide these products. Now, in Australia, when 92% of people who vape buy them on the illicit market, when it is illegal for a tobacconist to sell an ends with tobacco. They can sell a unit without tobacco. I'm yet to find one, but they can't sell them with tobacco obviously they can sell tobacco. They can't sell them with nicotine, they can only sell cigarettes. So from a small business perspective, we're going to see businesses go out of business. Legal shops that have been providing vape supplies, whether that's coils, whether that's juices, all without nicotine, mind you, but providing those devices to adults, they will actually be criminalised in the forthcoming year if we do not fight hard in Australia. And I fear that when Australia does do things like this, it will infect other parts of the world. And I think finally, and probably most importantly, New Zealand. Australia hates to lose to New Zealand. We absolutely hate it. You know, sometimes it's our reason for getting up in the morning is to beat New Zealand. And seeing that our smoking rates used to be, you know, we used to be doing better than New Zealand. We're not now. We're falling behind. We're seeing New Zealand really beat us at this game. I mean, we beat them at netball. Actually, I'm not sure we did beat them at netball. But, you know, we beat them a lot in sport. We win a lot. But right now, in tobacco harm reduction, they are leading the way. And I think that gets me out of bed in the morning. Thank you.
I'm not sure if I understand that conflict between Australia and New Zealand. You know, as a Scot living next door to England, it doesn't really resonate with me. Samrat.
Hi, I'll be making the case for consumers, which I think should be self-evident. But the reality is that the space for a tobacco user, you know, their space is shrinking. I mean, it started, I guess, you know, when the secondary risk, and then from there on, the autonomy and the respect. And at this current state, even basically humane treatment of consumers is also sort of something, you know, that you have to fight for. The problem is the people who are charged to protect us and our health, tobacco control, don't see us as human beings. I mean, they're not thinking about us. If that were the case, we wouldn't have been pushed and punished to make you know, decisions that they want us to make. There would be a more collaborative approach. Despite being 1 billion people, we don't have representation, a true, genuine representation. In fact, you know, the groups claiming to represent, you know, past smokers are actually AstroTurf. You know, where the genuine consumer is not allowed in. You know, we are when we try to engage, Article 5.3 is thrown at us. But the tobacco company, which is run by the state, is somehow not a problem. You know, and that country is not a problem, despite being stakeholder in a tobacco company. So, you know, the system is designed against us. You know, we don't have a voice. We, in fact, cannot even directly engage with the industry, the people who make products for us, to tell them what we would like, because that also disqualifies us. And so we are in a very, and we are also a vulnerable group, you know, because most of us are poor. 80% of us live in a developing world where there isn't public health care to talk of. So health prevention should have been, you know, considered really vital as a strategy. But what we have is limiting of choices, you know, vape bans and the spreading, I mean, you know, each country is making a decision, but, you know, every day you do hear, you know, someone has banned, Taiwan banned. And so, you know, in countries where these harm, you know, risk reduction would have really helped, we have bans, you know, and it's surprising that in Western nations where they do have public health care, you know, there aren't bans, but, you know, where they could have really helped. So we are also frustrated. We don't have, you know, no one is listening to us. People who are supposed to be on our side are not on our side. Numbers like 8 million and, you know, 1 billion are just thrown about, but there's no humanity involved in those numbers. You know, we people, like, we don't exist, we don't have rights. And also, you know, one really well-known doctor from my country, India, was making the case that anyway, very few of them quit, so let them go, they are lost. And that's about 1 billion people you're trying to disenfranchise, and it is published in a mainstream newspaper and no one challenges it. So that is really a problem. Until we start looking at these people as human beings who are making choices, who need to be worked with, and not given directions and not, you know, punished and pushed into corners, this problem will continue. Also, if you're using something which is among the deadliest thing that you can use over time, and if there was something safer, then it is our right to protect our health, and it is therefore also a human rights issue, which, for example, a drug user has more respect, and as part of the UNDP program, they are part of deliberations. But in tobacco, despite there being that many more people and so many more deaths, you don't have that. So,
okay, thank you very much, colleagues. I mean, I think we've heard an array of different perspectives there. One very driven by a consumer rights, human rights movement, if you like. The interest of both a political perspective but a social justice underpinning to that. The motivations of tobacco industry and maximising the benefit of different markets, and obviously a behavioural science perspective, and what the influence on individual human behaviour and their motivations for decisions that they might make in life. Are there any questions? Well, let's open this up a bit. Are there any questions? I've got a few things in my own head that I want to ask, but any questions from the floor, first of all, that you'd like to explore in relation to what my colleagues have said so far? One down the front, I'll get a microphone. Is there a microphone? Just a question down. Oh, we'll go there first then, okay. I'll come to you next, sir.
Hi, John Oyston. I'm a doctor from Toronto, Canada. Particularly for Moira, given the amount of distrust in the medical community and in the wider harm reduction community of vaping, why hasn't the tobacco companies spent some of their enormous resources on developing a licensed medical product for vaping? Because the Canadian government, the New Zealand government, the UK government have all expressed an interest in such a product, and yet it doesn't seem to be in the works.
So I think tobacco company did. I believe BAT certainly had a medicinal licensed product in the UK. We as a company have not pursued that path. I'm not going to say that we've completely cast it aside. But if you think about it from a smoker's view, and I was a smoker myself, smokers very rarely even admit to their doctors that they smoke. So you're already putting in place a barrier for somebody going and getting a product that could help them. The second thing that we've thought about is also a little bit the stifling of innovation. When you go through the medicinal products route, you're kind of locked into almost yesterday's product. We see this. We see this also with the US route, the FDA Center for Tobacco Products. The timeline to develop the evidence and go through the review process is extremely long. And in the meantime, innovation is going at light speed, and in countries outside of the US, you have products that are 2, 3, 4 generations ahead of the ones that are authorized for sale there. So that's a little bit the concern that we would have, is that you lock a product in order to get through the regulatory approvals, but you then can't innovate on it because it's not necessarily what a consumer wants. So those are two things that really have made us pause. I'm not saying that we would never do it, but it certainly made us pause and think, okay, what would be the right product to go through that process?
You okay, John?
I think the BAT product is no longer available. And I'm not suggesting that this would be the only route, but I'm suggesting it could be an alternative route. And I don't see why you couldn't have both a medical product that may be a little dated and a commercial product that may be more up to date.
Just on the commercial front, I mean, a question that was floating around my head listening to your introduction, Moira, those motivations, where do they lie? If there was a market opportunity or a moral obligation to try and change behaviours, where does that balance swing in PMI?
So I can't speak to the original motivation. I can speak to the story that I sort of came across in 2005 before I joined the company. And it really came down to a sort of a desire of 1 or 2 or 3 individuals within the organization, and seriously, maybe even one individual in the organization who basically made a decision that the further he got up in the company, the more he would advocate for investment in science and research that could solve the problem of smoking. And he eventually became our CEO. He's now chairman of our board. He doesn't like this story being told, but it came from the vision of one man, one individual who had the courage to say, we can do better than this. And he also had the courage to stick with us in R&D, because I was in R&D at the time, whenever we had problems. So any product development, anybody who's worked in a pharma industry or anywhere else, you know you come across problems as you're developing a product. And sometimes you require more time or more investment. He put his money on the table every time we came and asked, because he was so convinced that this was the right thing for the business and ultimately would be the right thing for adult smokers and the right thing for society.
And does that culture permeate throughout the organisation today?
It does now, and I'm not going to say that it was a dream scenario from day one. You have an organisation where people's careers were built on knowledge of the combustible business. So in the beginning, I do recall some resistance from some areas in the organisation. We are well past that now, and I think the leaders of our combustible business have actually done a really good job of showing people who work in that part of the business how they play a role in our transformation to smoke-free alternatives. It's about being the conduit to communication to smokers who ultimately can be encouraged to switch to smoke-free alternatives.
I don't want to hog the mic, but there's some really important messages in there about how you would relate that message to regulators and others, I would have thought. But there was a gentleman at the front, you wanted to ask a question. There's a mic just on its way.
Thank you. Yeah, Colin Mendelsohn from Australia. I just had a comment to Chris about that LIBA study. The results were inconclusive. Of course, it still may well be that flavours are effective, but there's so much more about flavours than what that study was looking at. So flavours, we know, are an important incentive for smokers to switch to vaping. They do seem to play a role in preventing relapse. Studies have shown that when you ban flavours, people do relapse to smoking, and there's they find flavours on the illicit market as well. There's growing evidence that it's not such a high priority for kids as we used to think it was. Surveys in the UK and the US have found that it's down the list below peer pressure and curiosity. So flavours aren't the driving force. And there's research that shows people who use flavours are more likely to make a quit attempt. So I agree, and why I'm bringing this up is because we've got a flavour ban proposed for Australia, and it's coming up in other countries as well. And I think it will be a mistake, and I think that paper shows something that we need to be aware of, but there's a lot more to it than that, of course. And I just wanted to make those points.
Yeah, and the authors of that paper, while they're concluding that the state of the totality of evidence at present is not sufficient for concluding that non-tobacco, non-menthol flavours produce better cessation outcomes than tobacco flavours, much of the discussion section of that article was saying, well, it's because of the quality of the studies. It's not necessarily a true effect or the absence of evidence. It's more saying that the standard of the studies that were included in the review were not sufficiently of high quality and were not designed actually to test the hypothesis. For example, it's really important if you want to really ask or test the hypothesis that flavoured products produce higher cessation outcomes than tobacco-flavoured products, you need to enrol a sample of people who actually have an intention to quit smoking. It's unfair to assess cessation in a population of people for whom cessation was not the intention. So many of these studies would include people both with and without an intention to quit smoking. And usually when you do the subgroup analysis of cessation outcomes among the people intending to quit versus not intending to quit, there you see the effect. The problem is that most of these studies will just lump everyone in together, and maybe you've got 75% of the sample with no intention to quit, and then lo and behold, 6 months later you find out that barely anyone quit. Well, yes, because that was the intention of most people at the start. So that's just one of the methodological limitations that are pointed to by the authors and by me and others in the field. But the higher quality studies, as you say, do show that flavors, non-tobacco, non-menthol flavors, are more strongly associated with intentions to quit, attempts to quit, and succeeding in those attempts to quit. And that's been shown in the UK, in the US, and several European countries. My broader point is that there's so much heterogeneity in how these studies are being done that when they're all put together in a pool, no clear message is emerging, because you have high quality mixed in with medium quality mixed in with low quality. And my argument is that we, people who design these studies, need to be speaking to each other to decide on a uniformity of approach, agreement on best standards and so on, to create the conditions that will allow any positive or negative effects to emerge.
But the danger is that people will say to the regulators, well, research shows that vaping flavours is no more effective than non-flavours. That's what I'm worried about.
That's precisely, the conclusion of the abstract of the paper, which is unfortunately all many politicians will ever be pointed to, says there is, at present, evidence is inconclusive. Evidence of the role of flavours in cessation is inconclusive. And unfortunately, many people will not read down to the caveats and limitations of the paper. So, yes, my broad point being that paper will be used as a weapon against flavours, where it shouldn't. What the paper is advising is that higher quality studies are likely to, the higher qualities that were included in that review did reveal a superior effect of flavours, but there's not enough of them.
Samara, do you have a view at all, or do you want to make any observations just from a consumer perspective on flavour bans?
About flavours?
Yeah.
Well, see, I mean, we do go to restaurants, we enjoy flavors. I mean, flavors are part of adult life, you know, and there has been this notion, and I don't know why it exists, that quitting should be a not pleasurable activity. You know, it should not give you any pleasure. So I think they're just against the fact that, you know, we were smoking, and when we got away with something less harmful, and that's like cheating the system, you know, somehow we should have died to prove them right. So flavors are an important, so quitting if it's not pleasurable. The reason I think why vaping took off and has, you know, had so many people doing it in such short span of time, despite so much misinformation and laws and regulations, so it's because it works for a lot of people. And you know, when I started out, for example, I wanted first the tobacco flavors because, you know, I didn't know like vaping anything, you know, I just wanted to do that. But then I realized, why would I want to, you know, when I'm trying to get away from tobacco, trying to get away from the smell and the taste, why would that be the only way that you're asking me to quit? You know, I mean, you're just setting us up for failure then. Which is not to say that, you know, kids may not find them attractive. I'm not coming into that, and that could well be true. Point is, there are a lot of things, you know, which kids could have access to. I mean, alcohol comes in so many flavors nowadays, but no one talks about that. So when, it should not be an either-or situation, you know, because you have to find solutions for all the constituents and not pit one against the other. You know, we have nothing against good, effective measures to, you know, prevent teens from taking it up, and the best of which would be to tell them honestly what is the, you know, risk relation between these products. Because kids today are smart, you know, they are making calls, and a lot of them, if you did a survey, would accurately tell you that, you know, vaping is much less harmful, which again somehow doesn't sit well, and it feels like, you know, someone did something wrong, you know, which is accurate information that they have. And it's remarkable how, even in India, you know, when very few people know about vaping, when they did surveys with the teens or the youth, they seem to have the correct ideas. So flavors are important. You know, if you took flavors out of the equation, it just makes it less attractive. And I don't know why that would help anyone.
Okay, let's move it on a bit. John, I know you have a question here. I'll come to you shortly, Brent. And Charlie, you had a question. So we'll do John, Charlie, and then I'll get to you again, Judy. We'll go to Brent.
Yeah, sorry, Martin. I'm not sure if this is going to be moving on, but I just wanted to ask an additional question in relation to this point about flavours. And I apologise, Chris, this might sound like an attack on you or behavioural science, which is not intended as at all. But it strikes me that the problem is that you're having difficulty proving in these studies what most consumers in this room would tell you. And I wonder, isn't there a bigger problem here of regulators and academia not giving proper weight to what consumers will tell you? And why is that? Do you think that's true? And why is it? And is there perhaps more of a role for a sociological or anthropological approach and just giving more weight to what people say?
Perfectly valid point. I'm a big believer in giving the regulator what they ask for, and we can argue about how clear or ambiguous different regulators are in telling the research community and manufacturers what types of data and information they need. But how I interpret, say, the situation in the United States is the regulator saying we need longitudinal prospective data, either from a randomized control trial or a longitudinal observational cohort study, which I won't go into the details, but it demonstrates reliably that a change in smoking behavior is attributable to use of the product under assessment. Now, people can disagree on whether that level of research is necessary. FDA is saying it is, I interpret. The problem then is that those types of study designs cost money. They take a long time to do. There's no fast answer. When people say we want to know what's the 6-month rate of switching or cigarette reduction, you need to wait at least 6 months for something to find something out. It takes money and people and resource, and perhaps there's only a small number of companies that can afford to wait that long, to invest that amount of money. So I completely appreciate that while the regulator is setting a standard or specifying the types of information they need as clearly as they can, not every applicant will be able to meet that level of investment and time. The problem with more qualitative assessments, cross-sectional assessments, is FDA and other regulators will say, well, it doesn't demonstrate change or allow us to attribute the change to any intervention or any product. So we can certainly, there's a great deal we can learn, and I certainly have learned in 12 plus years of sitting down one-on-one listening to smokers and vapors, people who use other products, especially from people who have who smoked all their life, tried using e-cigarettes or something else, and ultimately went back to smoking, to understand what was it about the product experience which didn't stick, and they felt they needed to go back to smoking. There's a great deal that can be learned about how to innovate products to be more satisfying and appealing and affordable. But in terms of convincing a regulator or demonstrating to a regulator that a certain flavour is the product feature, product characteristic that's driving change, there's certain types of study designs that are big, expensive, long, and not easy to do. And that's a hurdle we're all facing. But certainly there's much that can be learned about adult smokers' decision-making, about using or not using products from the one-on-one format you're describing there. I hope I've answered. Thanks.
There are a few people who wanted to ask a question. Are your questions around this particular theme, or are you looking to move it on a wee bit more? Alex, was yours around this theme? Okay, let's take Alex, and then I'll sort of shift it on a wee bit. I'll come to you shortly, Sharon.
Thank you. Alex Wodak, Australia, and I'm happy for anyone who would like to, on the panel, respond to this question. The traded tobacco companies in the world are said to be worth around about $800 billion collectively, and of course we don't know what the non-traded tobacco companies, government-owned, are worth, but presumably it's at least as great, if not as great again. We know that the share price of the traded tobacco companies as a category rose faster for over a century, and then until 2017, when they fell by 50% over the next 4 years. And the presumed interpretation of that is that investors started getting nervous about the lack of tobacco harm reduction on the part of the tobacco companies. So my first question is, do investors have a stake at the table? And if not, why not? And my second question is, if the workforce of tobacco companies around the world is said to be around 100 million people, and maybe that's not accurate, I'm not an economist, but if it's around that figure, it's a lot of people, do they have a stake at the table?
Moira, you anticipated that I was going to come to you by lifting that mic right away there, so why don't you address that first?
Okay, thanks for the points and the questions, Alex. On the first point, I think it's difficult to talk about the industry as a whole when talking about share prices, so I can only again talk about my company. When we split from Altia back in 2008, I think our listed share price was in the region of $35 or $40 a share. Yesterday, I think it was $95, $96 a share. And I personally think that's a reflection of the promise of harm reduction for us as an organisation. And I think the reason that the share price has risen, I'm not an analyst, I'm not a finance expert, but we spent a lot of time and effort in bringing analysts and investors along on the journey, even before we launched our products, our first products in 2014-15. We explained the innovation, we explained the science, we explained what we felt the market opportunity was. And I think that was done absolutely deliberately because, of course, they have a say. If they don't believe in what you're doing, if they believe it's too risky, then they're not going to invest, they're going to withdraw their support, and without their support, obviously, you're going to get pressure to reverse course. So it was a deliberate strategy of ours to ensure that we kept them informed and on side from the get-go.
I think I have a wee follow-up question there. I'm not sure if it's a fair one, but I mean, so you're suggesting there that investors are making the decision to invest in PMI for the reasons of the strategic intent as opposed to the profitability of the organisation?
Look, I'm definitely not a finance expert, but I think there are multiple types of investors. There are ones that are there just for the dividend. There are ones who are there for the long-term future and value increment. Maybe John Fell is the better person to answer this. But maybe I forgot to answer your point, Alex, about employees. Absolutely, employees really have a big stake in the game. And I remember I was one of the first people to understand the full program because I was working deeply in it, and it was kind of like this secret skunk works operation in our R&D facility in Neuchâtel. And as soon as we started to communicate to the broader employee base, the thirst for knowledge, the thirst for getting to know the inside story about the products was just unbelievable. People were highly motivated by this as a long-term strategy for the company. And everybody, literally everybody, sees the role that they can play, whether it's physically on the ground talking with smokers, or whether it's cleaning laboratory equipment, or whether it's just simply telling their friends and family about the transformation story that we're going through. So everybody has a stake in the game.
Thank you, Alison. We'll do Charlie, then Brent, then we'll come to you, Judy, up the back, okay?
Are you satisfied with the rate of progress? And if I can extend the game analogy, where are we in the game? Have you got any plans do you think there are any tactical changes needed in the game?
Is that question directed to Moira or?
All four, really.
All four. Why don't I come to you first, Fiona?
Thank you. Well, from an Australian perspective, we are well behind the game, but what we're also seeing, and what I think should worry us in Australia the most is the movement to the illegal market. So, we now have an illicit tobacco industry like we've never seen before. We are seeing huge crops of illicit tobacco. We are seeing organised crime now very heavily involved in illicit tobacco, and it's a much easier it's a much easier product for them to distribute. So they're distributing it through the local convenience stores. They're distributing it through the local supermarkets, through the local the local tobacconists. So I think for us, the game to stop the criminals from taking over is we're losing, and we're addressing this in other drugs. So we're seeing the decriminalisation and legalisation of other substances, but we're going backwards in the game in Australia, I'm afraid. And I suspect I'm always, when Dr. Alex Wodak is optimistic, then I'm optimistic that we will prevail and that the consumer will actually, in the end, prevail and we will change direction. But right now, most consumers have to go to the black market to buy a nicotine-style vape, but also now a growing number of them are having to go to the black market to buy tobacco because they can't afford the legal product.
Samara, are consumers doing enough to step up to the plate and fight their corner?
See, it's a fight we cannot afford not to fight, because our lives are at stake, and these are, living is important to everyone. So, but the problem is we never thought of this as a fight. It didn't even appear to be one because it looked quite simple. There's cigarettes which are really deadly. There's something which is less harmful. We know it is less harmful because our health improved. So, there can be research on one end, and if I can walk 40 or cycle 40 miles, then I know that's true, and I can climb, and so there are a lot of benefits which we have experienced, so therefore we are sold on the idea. But we don't come from public health. This is not something which any one of us thought we would do, but now we have to organize, and research papers are written against us, and we have to figure out how to respond to it. And Jerry was quite helpful last time. We could get a response in. So we are just put in a fight which we were not equipped. And so it takes time for a consumer movement, because there have been smoker rights groups, but they didn't have traction. They didn't have a wide buy-in. But now it is genuinely about saving lives, because people should have access. Which is not to say that everyone will switch, but we should increase the number of options they have at price points they can afford, and in places where they can find them easier. It should not be that you can buy tobacco at every nook and cranny, but to get something less harmful, you have to pay more or go to a medical store.
Sonia, go Moira.
I think I'm a scientist and I'm also an optimist. I think ultimately the science becomes impossible to ignore. I think the question is how much collateral damage is going to happen while we wait for people to get on board with the science. And we did an interesting exercise recently where our statistical modelling team did a model to look at what's the opportunity of tobacco harm reduction, the best case, if you like. Because today, the debate is so focused on the potential unintended consequences and challenges of harm reduction. We thought, okay, let's look at what's the opportunity. And the results were absolutely stunning. So they took WHO's data on smoking prevalence, etc., and WHO's modelling method, and looked at 54 countries, which I think was something like 3/4 of the world population or something like that, and had a look to see what we could predict if all of the smokers in that country switched to smoke-free alternatives overnight, a smoke-free alternative that was 80% less risky than continuing to smoke, hypothetical product. They showed that over the course of those smokers' lifetime, if they switched to smoke-free alternatives and stayed with them and didn't go back to cigarettes, there could be a 10-fold reduction in the number of smoking attributable deaths compared to historical tobacco control measures on their own. So that tells me, okay, this is not a binary thing we're talking about. It's not the M-power measures or harm reduction. It's both together, and can we get on with it and move, because we're losing a massive opportunity, and there will be now collateral damage. And people are going to suffer because this debate is taking too long.
So the strength of a collaborative approach seems to add value, if you like, a weight to convince the message, or to convey the message. Brent, I'm apologise that it's taken so long to get to you.
I was second runner-up half an hour ago. I'm Bengt Wiberg. I'm not from Australia. I'm from Sweden. Bringing up flavors is very important. Why? Because it affects snus, nicotine pouches, heats, e-cigarettes, and you name it. So flavors are very important in order to succeed bringing down smoking. But has anybody, and this is a question to the panel, has anybody investigated those politicians or regulators who want to ban flavors? Is it banning a flavor, or is it reacting to provocative packaging? I have seen Russian-made nicotine pouches with 150 milligram per gram nicotine content with Bambi bears or cartoons or Kalashnikovs or, skeleton skulls. Thank you.
Yeah, go on, Fiona.
I think it's a very good point, and certainly the regulators in Australia are responding to, the unicorn hair flavoured product, the, teddy bear chocolate or those things. So there's absolutely, it's provoked by those flavours out there that seem to be addressing children, going towards children. But then, when you start looking at things like the cheesecake flavour or the cookies and cream or those ones, no, those are not necessarily directed at children, and you'll find that many adults and we've seen these debates going back and forth on social media with some of our regulators and some of our health officials about the fact that just because the flavour is sweet does not mean that it's directed at children. But certainly those products that are using teddy bears, that are using unicorns, that are using cartoon characters, then they are provocative, and they certainly are engaging and making it a lot easier for the regulator to say, yeah, you're obvious, these are for children, so we will ban them all.
Chris, do you want to add anything?
Sorry, if I could just go back to what I was going to give an answer to Charlie, and the game analogy. Well, before the end of this year, Sweden will be world champions. They will be the first country with a smoking prevalence below 5%. So we should all want to be like Sweden in that respect. And I just want to expand on something Moira said in relation to the modelling. One of the best arguments I've ever heard for tobacco harm reduction as a complement to existing tobacco control was a paper in 2013 by David Mendez and Ken Warner, who estimated that if all of the Empower policy measures and interventions were implemented fully and immediately and funded without interruption through to 2030, then the best case scenario is that there would still be 523 million smokers in the world. And the question then is, well, what else can be done for those 523 million smokers who are not responsive to everything we're already doing? And there's a great argument for doing something in addition to existing tobacco control policies and measures. And sorry, to Bent's question about is it the flavour itself or is it the packaging? I've always found it unclear as to what it is people are trying to regulate, if it's the appeal of the product or the experience of.
You cannot view how a flavor tastes. You have to taste it.
Mm-hmm. Agreed.
Yeah. Judy, I have kept you waiting for far too long.
It's a story of my life. They don't call me the late Judy Gibson for nothing, The title of this is Who Has a Stake in the Game? And I was thinking that actually the WHO, Bloomberg, Big Pharma, all these people will be represented at the forthcoming in November at COP10, and yet what stake do they have in the game? Because we who have a stake won't be there. And I was just going to ask you, probably to Moira, but I'm aware of Bloomberg's cabal and the various malign influences, and they are malign, and there's been an awful lot more. I think most people will agree that, I mean, for instance, in the UK, it's not now a drip against, epidemic, children vaping. It's become a river. I mean, we're almost drowning in it. I wonder if, it's a mad question, but the pharmaceutical industry, who do have a stake, they have a stake because they don't necessarily want tobacco harm reduction to go forward. Do you feel that they have got a malign influence behind the scenes, which we are not aware of? But you might be, Moira, because you're more in the scientific, pharmaceutical sphere, because it seems to me that people are pulling an awful lot of strings, and yeah.
Look, I don't have a clear answer to that. I think you can trace money flows from all sorts of different foundations into all sorts of different organizations, but it's extremely difficult to put your finger on, okay, what's the motive and what's the outcome. I think whether we all like it or not, these people have claimed a stake in the debate about harm reduction. So we do have to listen to them. We do have to understand what their point of view is. And we do have to have a response, and a response that's a rational response rather than perhaps the emotional one that we all feel in our guts. So I think that's the unfortunate situation we're in. There is not a magic answer that I can think of to turn these people and organizations around, other than science and a focus on the consumer. That's the two magic bullets, because ultimately they become really impossible to ignore. And we've seen it in regulatory debates in many countries. When the voice of the consumer is elevated, it's really hard for the Bloomberg example, for example, the Bloomberg-funded organizations to drown them out, because policymakers have to listen to their citizens. So I think that's why this forum is really important, to encourage consumer groups and consumer advocates to make sure their voices are heard, because they're so important.
Sorry, Martin. I just think it's an interesting one, Judy, because it's probably, this is one of the only health issues and that our health regulators are speaking about without the consumer. In every other conversation, it's, nothing about us without us. And, whether it's sex work law reform, it's always expected that sex workers will be at the table. If it's other forms of drug use, it's expected that the consumer, the drug user, will be at the table. And this is really quite unique, that this is the only debate where the consumer is absolutely excluded.
Why do you think that might be the case, Samara?
I don't know. I think there seems to be a view that the moment you pick up a cigarette, you just, you sign away all your rights, and you are not, you shouldn't expect to be treated humanely. And of course, since you're an addict, you cannot have, you're biased because of your addiction. So therefore, you also should not comment on. And of course, moment you say anything about tobacco harm reduction, no matter where you come from, you are already in the tobacco camp, because apparently the concept of tobacco harm reduction is not something which a consumer benefits from. It's just a construct. But that's how arguments have been made, and we have been excluded. We went to the last COP, and they wouldn't even talk to us. They would stay away from us as if. But we are the people who are dying from these products, and we really have a stake. So it's to say this to Judy about pharma, I'm really not equipped to comment on that, but What I do see a lot of times, that people who are not experts in understanding, they're not addiction experts, they're not behavioral scientists, they're not people who have been trained to deal with addiction, are the ones who actually control the narrative, but not. So usually when you would have something which would require expert opinion, you would have it from the right kind of experts. But I don't think those are involved, at least not in my country and many countries that I see, even at the WHO level.
I'm reminded of a psychologist, I don't know if you'll know her, Chris, from Harvard, I think, Donna Hicks. She does a lot of work in conflict resolution, and she talks about you won't overcome conflict unless you understand dignity, and that dignity is an intrinsic human value, but it's also an intrinsic human need. And the more dignity you afford one, the more you reinforce yours, and the more you reinforce that person's dignity at the same time. So is there a loss of dignity or a lack of dignity or respect among the stakeholders that is denying the opportunity for progression? Don't know if you want to take that, Chris?
Yeah, and as some of the questions were asked, so Alex mentioned two groups of people who have very legitimate stakes in this, the employees and investors, and Judy mentioned WHO and other public health organizations not here. To me, one of the most under-discussed legitimate stakeholders in all this, and for obvious reasons not here, is children. And what I mean by that is I view tobacco harm reduction as a child welfare issue. We're all agreed that tobacco smoking is the leading preventable cause of premature death and disease, and nothing kills like a cigarette. And we can also, I'm sure, agree that there's nothing more traumatic in a child's life than watching a parent or two parents suffer and die prematurely from a smoking-related disease, maybe in their 40s or their 50s, and that child has to go through life with that trauma, that pain, that lack of parental presence for the rest of their life, and it affects all of their relationships for the rest of their lives. So the way, when the subject of youth comes up, it's always obviously the negative of how do we prevent youth, but the way I think about the youth as stakeholders here is their parents are smoking, their parents are going to die earlier than nature would otherwise allow them to live. There's something we can do. There's many things we can now do, many alternatives we can offer them as a route out of smoking and that path towards premature death. So we're not only immediately helping parents who smoke to live longer, healthier, happier lives, we are helping their children and the family unit to exist together for longer. And so there are different people of different political leanings across the globe. When we think of perhaps in America, Democrats who are more opposed to tobacco harm reduction, I find that a way of speaking about tobacco harm reduction as a child welfare issue or as a social justice issue, it's something that they can more get on board with. And so just because Alex mentioned a couple of unrepresented stakeholder groups, and so did Judy, I thought useful to mention children as being the population group who stand most to benefit from their parents being around for 20, 30 extra years.
Okay, any other questions from the floor? Oh, yes, sorry. Couldn't see your hand there. You're in the Bermuda Triangle, as Clive described it.
Thank you. I'm Helena from China. I'm quite interested about this tobacco harmless reduction. There's some interest in my mind. I'm not specialist in either area. But think about two words. One is addiction. Another one is about nicotine. As I talk with some people during the concept, I found many people misunderstanding nicotine and the word of addiction. Because when we talk about nicotine, many people immediately think about toxic. There's some problem. And then addiction is a dangerous word. I'm addictive. But indeed, personally, I found addiction and also nicotine, both of them are neutral words, neither positive or pejorative. I was thinking about the psychology side for children. They can think about parents, they get disease or death or something, but they don't care. They still go to the grocery shop to buy the cigarette. They don't care the health because they are rebel. As soon as something is forbidden, they buy it. So the things I'm thinking about, why we don't have the right education to the current smokers and for the future generation. The right education means that, okay, nicotine is something like any chemical element, like sugar, coffee, or something. It's not forbidden if you really control the dose, how to say, the rate, the risk. We can still, like we are taking the coffee, we are surviving, we are living in the right state. So why we cannot really access any nicotine? Like we eat eggplant, we eat tomato, there's some nicotines. Give them right education. We're not rebel. Nicotine is not bad. I was thinking about that. Why we don't have the right media, let's say, channel to access the right information. Second thing is addiction. Anyone here is not active to anything. We're addicted to cell, to sugar, to anything. So the word addiction won't become rebel. Some people are suffering about addiction. I want to stop smoking, but I cannot. I feel guilty. Second time again, I feel guilty. I'm addictive. It's something bad. Psychology, I feel very vulnerable. If I tell them addiction is not a problem, okay, we can smoke, but like today, the vaping, whatever, any e-cigarette or heating system, we said minimize the risk for the health. We can smoke. Why we have to control ourselves to, let's say, to avoid addiction, whatever. So what I mean at the end is give them right education, give them right assessment of media communication. What is really the health of let's say, tobacco harmless? We're all here talking about tobacco harmless reduction, but any consumer understanding what means tobacco reduction. So something less in this chain is our consumer and also right media access. That's what I want to say. I'm not specialist in any field. That's my feeling about the consumer.
Yeah, I think that was more of a statement than a question. But I mean, what resonated in my mind was the issue of stigma.
Can I just make an observation on this? I mean, yes, there's the stigma, but in Australia, if you look at the other pharmaceutical nicotines, which are the gums and the patches, they're available to 12-year-olds. And there's never, ever been a question. And in fact, I've looked at a packet of nicotine gum the other week, and it says not recommended for under 12. But as far as I'm aware, there's actually no restrictions on the sale of the product in Australia. So we've never had this fear and loathing around nicotine when it was in gum form. It's now only when it's now in the vaping form.
Someone asked a question online: has nicotine gum or lozenges, do they come in tobacco flavour? Yeah. And if so, where are they? And if not, why not? I mean, so clearly the nicotine intake, if you like, is the key thing. Can we get back to the issue of stigma? I think if I was interpreting what you were saying properly, you know, addiction and toxicity and, you know, these are emotive words and convey a degree of stigma. Samrat, is that an issue that you think has inhibited progress, the stigma around vaping because of its perceived association with smoking?
Sorry, I didn't...
People feeling as though they're stigmatized because they vape because of the association with smoking.
Sure, I mean, you know, smoking has been enough stigmatized. There was a Philippine law which came out which actually demarcated the rights of vapers, delineated from those of smokers. So vapers would not be forced into smoking rooms and they would have their own space. As people who have transitioned out of smoking, we would like to keep it that way, and which is not to say that, you know, once you quit something, then you develop like a visceral hatred for everyone else who does it. I mean, there are people who do that, but generally, you know, we are supportive of the right of smokers to try something which is less harmful with the correct information. So I think it's important to also communicate accurately, even if, and I don't see there's the reason for miscommunicating and with the justification, no, but we're trying to achieve a noble thing. And if a small lie in that direction, or we, you know, inflate the risks of vaping intentionally, knowing that it's not true, because we want, a certain end result. I don't think that's ever a good strategy, because then what happens is you're losing the trust of the people, which, and then they're not going to listen to you, or they'll know that, okay, because it's also the internet age. You can find facts. You can't really hide the fact that vaping is less harmful, though WHO would still double down and they use language tricks, It's not, they wouldn't say it, but we know what they're trying to do.
I think it's actually, sorry. In Australia, I'm starting to sense that it's almost more deviant to vape than it is to smoke. And certainly I've noticed that around Parliament, that members of Parliament that vape do it much more surreptitiously. They'll all go outside for a cigarette, and that's actually seen as social. It's seen as poor you're addicted to smoking. But if you move to a vape, then there is something seen as subversive and deviant still around vaping in Australia, and it's new. It wasn't like this probably 12, 18 months ago.
That blows my mind. I've been thinking about this idea of stigmatization a lot recently since we joined forces with Swedish Match. I think stigmatization of vaping or heated tobacco users is quite an easy thing to do, because the act mimics the act of smoking. And smoking is bad, and smokers have made a bad choice, and therefore you must have. And I've been thinking, okay, what about snus users and nicotine pouch users? Because that affects nobody. There's no signal that somebody is using the product if they're using it, in a discreet way. So what's going to be the tactic that's going to be used against nicotine pouch or snus users as it starts to get more prevalent around the world? And that kind of worries me. What sort of tricks and devices are going to be thought up by those in tobacco control who are simply focused, I think, in my mind, on the wrong goal?
We have, go on, Chris.
Sorry, it's just because I heard you in your question about education around nicotine. Education around nicotine. And so nicotine has a historical problem in that it's always been conflated with smoke. For 100 years, smoke and nicotine in the eyes or the minds of smokers, even physicians, are one and the same thing. And as a consequence, we have very high rates of misperceptions among both physicians, smokers, and the general population about nicotine as a constituent of smoke that causes cancer. Unacceptably high rates of misperceptions, and that has been a misperception that has deterred a lot of adult smokers from even contemplating switching from smoking to vaping. So to the question of education, I have to commend organisations like the National Centre for Smoking Cessation Training in the UK, whose part of their job is to communicate to smokers who come to National Health Services about what is vaping, how is it different from smoking, and because one of the key concerns or questions that smokers have is, am I not just trading one dependence for another or one addiction for another? The National Centre for Smoking Cessation Training is clear and consistent in communicating to smokers that it's the inhalation of smoke that's the problem. That's what we need to change first. If there's a subsequent dependence on vaping, that is a problem that will be can be addressed in the future, but it is nowhere near as serious or urgent a concern as stopping the inhalation of smoke. So their FAQ section explains the difference a lot better than I just did. But my point is that organisation, and to be honest, all of the communications from Public Health England and Cancer Research UK and the British Lung Foundation, consistently for the past 5 years now at least, has been to try to dispel this notion that nicotine is what causes harm, what causes disease, and that nicotine, when decoupled from the toxic constituents of smoke, is actually, the risk profile is far lower. And so they should have confidence about using a nicotine product that is decoupled from combustion. And I'm sure that these types of education efforts are taking place in many countries in the world. to me that the UK, from what I've seen, is leading the way on communicating to smokers through National Health Services, hospitals and clinics, explaining in basic English what is the difference between a cigarette and a vape, and what are the implications for health in the future attributable to those differences. So it can be done, and why Australia has such a different, I would say, opinion, because we all have access to the same information. So why things are so different in Australia and India, other parts of the world, is the real question. Yeah.
I'm very conscious of our time, ladies and gentlemen. We're fast approaching the end of our allocated slot. I'm going to ask our panellists just to put them into any final concluding remarks that you might want to make. But we had a great session that Clive led on Wednesday night, and it was the chronology, if you like, of alternative products from, I think he started off in about 2010, 2011 period and right through to 2023. And the thought that crossed my mind during that session was that life is best understood backwards, but it's just a pity you've got to live it forwards, you know. That was sort of prevalent in my mind. So if we were learning the lessons today and thinking about the future, sticking with our theme about stake in the game, what might be your concluding remarks from your perspective? Does that make sense? Chris?
So, sorry, are you essentially asking, what do we think the next 5-10 years might look like?
Yes.
Okay. It's not a bold or brave prediction to say that jurisdictions that implement more prohibitive or restrictive policies on smoke-free products in general, and then certain characteristics of those products like flavors, nicotine strengths, the more prohibitive, the more restrictive the portfolio of alternative options that are available to adult smokers. I'm worried that progress that has been made in reducing smoking prevalence over the past 5-10 years with the availability of those options is going to start to stall and perhaps even worse, start to uptick again. And it would be, no one here would take any pleasure in saying told you so, because we're talking about people and quality of life and duration of life, and the real people are going to suffer as a consequence of those prohibitions and restrictions, is my prediction. And I would, the other side of the coin, predict that jurisdictions that maintain and even expand adult smokers' options to a range of satisfying and appealing smoke-free alternatives will continue to see their adult smoking rates plummet. Speaking from a biased perspective, I hope the UK continues to be a bright, shining example of resisting precautionary knee-jerk policy, and continues to be driven by the excellent science that's coming out of UCL, King's College, multiple universities and organisations across the UK, the Cochrane Group. So I predict that the more permissive governments will continue to see smoking rates decline. Unfortunately, I shudder to think what Australia is going to look like in the next year or two, what the US might look like as more options are cleared from shelves. And I hope, well, as Mara said, science and data will ultimately come to be of such a weight that hopefully no government can deny it. And I just hope that things don't have to get too bad or go too much in the wrong direction for governments to acknowledge the huge contribution that THR products can make to driving down smoking that may not otherwise be achieved.
You have a mic, Samarat, so I might as well come to you next.
So I remain hopeful that we will see negligible. Smoking will cease being a problem in our lifetimes. You know, I remain hopeful because everyone does know that smoking is the deadliest way you can consume nicotine. And irrespective of how the policies come, you know, because in India they banned vaping in 2019, and now you can find it in small villages. So the ban did nothing, right? And that's true also in other countries which have stricter, I think Hong Kong was discussing, that how their ban was not working. Taiwan, they had, the people there said that it's not implementable. It's not, you cannot have nicotine in only one form banned, but available in all the other forms. So I do believe, and as the science also becomes more robust, as consumers become more aware that these products exist, I think we will reach, it took us this much time to reach 100 million. I think it'll take much less to get to the next 200 million. And, and then there will be and then when people have voted with their, choices, I think we'll have a huge impact on how it's also viewed in political or public health circles.
Thank you. On you go, Moira.
So mostly what Chris said. I would just echo what you said, Chris. We start to see data that clearly shows that restrictions on smoke-free alternatives are directly correlated with the persistence of smoking. And I hope that people begin to really focus on that evidence and think, okay, well, what should we do next? And I just have two sort of additional thoughts. The first is, I think as a stakeholder group, and we mentioned most of the stakeholders, I think, that have a voice, we need to decide what's the goal we're fighting for. What are we actually trying to achieve? Is it the end of the tobacco industry? Is it the end of nicotine addiction? Or is it the end of smoking-related disease and premature death? I firmly believe it's the latter. And then I'm minded of a panel discussion I took part in a few weeks ago in London, not about our subject, but about regulation and policy making. And a former MP said, and this stuck with me, the best stakeholder in her view is a stakeholder who realizes they're not the only stakeholder. So we all need to understand each other's point of view, whether we like it or not. Get to know it, get to understand it, and get very, very good at arguing our point to achieve the right goal.
Yeah, great concluding remark.
Yeah, absolutely, Moira. And I think in Australia, the voter will convince the politician. It will be the voter that convinces an MP that if they want to be re-elected, then they need to change their policies and be more sympathetic to people who have chosen safer alternatives to nicotine use. And that is growing, but we are going to need to coordinate that in Australia especially. Now, I'm a Republican. I really want to see us become independent of the UK as fast as possible. I think Australia could have its own head of state. However, I do hope that we actually we maintain some connections with the UK and that we do adopt some of the excellent work that the UK has been doing in tobacco harm reduction.
Thank you very much, thank you. One of the roles of a chair of these sessions is to keep to time, so I have failed miserably in that respect. I can actually talk for Scotland, and I remember I was speaking at a conference once and I had an allocation of 10 minutes to speak, and I was going on for about 15, 17 minutes, and I could see the chairperson getting really frustrated and upset, and I said, look, I'm really sorry, but I don't have a watch on and there's no clock in the wall. And someone said, yeah, but there's a calendar on the wall behind you, mate. So listen, folks, I hope you found that an interesting and engaging session. So please show your appreciation for our distinguished panel here. Thank you very much indeed.